hello, check, 1 2, hello, check, 1 1 2, hello, check, 1 2, hello, check, 1 2, hello, check, ठीक है?
हेलो हेलो
जी ठीक
check, sound check. ठीक है.
Once again, extending a very warm welcome to all our distinguished members and participants. May I request all those who are standing to please take your seats. We shall be joined shortly now by the distinguished dignitaries for the inaugural session. And just to bring the House to order, may I please request all those who are standing to please take your seats. All these students who are joining us, welcoming you all and requesting you all to please settle down, take your seats quickly. And ladies and gentlemen, requesting you all to please settle down. We are now going to begin with the formal session, the first inaugural session for the day. In a few moments from now, we already have the dignitaries marching towards this auditorium, requesting you all to please take your seats. All those who are standing, drawing the attention of you all and requesting you all to quickly make this place look in order. And we take a minute more, requesting you all to settle down. Ladies and gentlemen, we are now ready to unfurl the formal proceedings for the day, requesting all those who are entering and who are standing at the right extreme end to please take your seats. And ladies and gentlemen, we are being joined by the esteemed dignitaries, the chief guest, Professor V.K. Paul, member health, Niti Aayog, the chief guest. Ladies and gentlemen, with a rousing round of applause, we welcome our esteemed dignitaries, Professor V.K. Paul and Professor Ajay Kumar Sood, the chairperson, Scientific Steering Committee on One Health, the principal scientific advisor to the Government of India, gracing the days amidst a rousing round of welcoming applause. Namaskar. Distinguished gathering of dignitaries, visionary leaders, luminaries from across ministries and departments, esteemed delegates from overseas, policymakers, scientists, academicians, youth representatives, ladies and gentlemen. We are indeed honored and delighted to welcome you all very warmly and heartily to this historic dawn, the National One Health Mission Assembly 2025, translating knowledge to practice. One Earth, One Health, One Future. May we have a welcoming round of applause for that as we raise the curtains. Thank you very much. Deeply etched in our Vedas is the Sanskrit invocation. Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashyantu, ma kaschit dukbhag bhavet. A prayer for health, happiness, and freedom from diseases for all. Ladies and gentlemen, crafted under the visionary guidance of our Honorable Prime Minister of India, Shri Narendra Modi, and led by the principal scientific advisor to the Government of India, India launched the National One Health Mission. And the National One Health Mission Assembly 2025 is a mammoth initiative that brings together 16 key ministries and departments under one coordinated strategic framework. The One Health Mission is indeed an exemplification of our ancient wisdom, reaffirmed by science, intertwined into policy to translate into action to optimize health outcomes for all. United by this vision, the National One Health Mission Assembly 2025 brings together stalwarts from across sectors, disciplines, and borders to create synergies in strengthening health security and the sustainability ecosystem by solidifying the pillars of pandemic preparedness for humans and animals, integrated surveillance, routine preventive measures, and joint outbreak investigation. So, with those words, ladies and gentlemen, to set the tone and the context of this assembly and to welcome this august house, may I now invite a distinguished physician scientist with over 3 decades of experience in leading health research and translating it into impactful public policy, both in India and globally. Ladies and gentlemen, please welcome Dr. Rajiv Behel, the Secretary, Department of Health Research and Director General, Indian Council of Medical Research.
Respected Professor V.K. Paul, Member Niti Aayog, responsible for health, respected Principal Scientific Advisor to the Government of India, Professor A.K. Sood, my fellow secretaries, international delegates, members of international organizations, scientists from all across India, young students, both from colleges and schools. I would like to welcome you all to this One Health Assembly, which celebrates the establishment of the National One Health Mission under the chairmanship of the Minister of Health and with the scientific leadership and steering of the Principal Scientific Advisor to the Government of India. We are extremely pleased that this mission, which is essentially aimed to help us to be prepared for future pandemics, as well as our current problems of zoonotic diseases, have so much participation across the government with whole of government approach. This involves 16 departments and ministries of the Government of India. And to celebrate that, I'd like to welcome on stage my fellow secretaries, Dr. Rajesh Gokhale, Secretary DBT, Dr. M.L. Jat, Secretary ICAR, Indian Council of Agricultural Research, DG, and Secretary of Department of Agricultural Research and Education, and Chairman ISRO and Secretary Department of Space, Dr. to please join me for us to light the lamp together with our chief guest and Professor Sood. And this is a symbol of this lamp signifies that we are looking for this light, this enlightenment to guide us for the future. Professor Mani, also please, Dr. Parminder Mani, Secretary in the Science, in the department, in the PSA office. Dr. Mani, please, may also kindly join us.
या कुन्ते तुषारहारधवला या शुभ्रवस्त्रावृता या वीणावरदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा
Shubham karoti kalyanam arogyam dhanasampada Shatrubuddhi vinashaya Deep Jyotir Namostute Deep Jyotir Namostute. And that, ladies and gentlemen, marks an auspicious inaugural as per the rich Indian traditions by invoking the blessings and the guidance of the Supreme. And may we thank all the esteemed dignitaries for doing the honors. And now, ladies and gentlemen, we bring to you a kaleidoscopic view of the National One Health Mission journey, the movement encapsulated in this audiovisual. May we have the AV, please?
For over 2 decades, the world has witnessed multiple epidemics and pandemics emerging from the human-animal environment interface. Nipah, swine flu, Middle East respiratory syndrome, Ebola, Zika, and the recent COVID-19 pandemic are strong reminders that the health of humans, animals, plants, and the environment is deeply interconnected and cannot be addressed in isolated systems. Recognizing this global reality and under the guidance of the Honorable Prime Minister, Shri Narendra Modi ji, India has launched the National One Health Mission, led by the Principal Scientific Advisor to the Government of India. The mission brings together 16 key ministries and departments under one coordinated strategic framework. The mission prioritizes intersectoral research and development focused on improving the health of humans, animals, plants, and the environment. Another key objective of the National One Health Mission is strengthening surveillance through technology-enabled system. A technology-enhanced surveillance ecosystem is being developed across the animal-human environment interface. This includes wastewater surveillance in major cities and airports, along with the detection of antimicrobial resistance genes. Surveillance is being carried out across bird sanctuaries, slaughterhouses, zoos, farm, and wildlife corridors, enabling early detection of spillover signals. Advanced tools, artificial intelligence, genomics, and next-generation sequencing make this surveillance faster, more accurate, and highly traceable. Another key focus of the mission is accelerating the development of medical countermeasures for diseases with the potential to cause pandemics. Several medical countermeasures are currently under development. Rapid diagnostics, such as TruNat for Nipah and Kyasanur forest disease, RT-PCR tests for monkeypox, Zika, and other zoonotic diseases, and monoclonal antibodies for Nipah are advancing rapidly. In addition, vaccines for Kyasanur forest disease, Nipah, Crimean Congo hemorrhagic fever, lumpy skin disease, and avian influenza are also under development. The mission places a strong focus on strengthening India's laboratory capacity by establishing a national network of BSL-3 and BSL-4 facilities across ICMR, DBT, CSIR, ICAR, DAHD, and DRDO. This network of 23 functional high-continent laboratories supports the Integrated Disease Surveillance Program in outbreak investigations by testing human, animal, and environmental samples. Personnel have been trained in high biosafety operations, multi-species pathogen diagnostics, genomic sequencing, bioinformatics, and immunology, significantly enhancing national preparedness. Data integration forms another crucial foundation of the mission. A pertinent example of this digital transformation is the National Digital Livestock Mission and the Bharat Pashudhan app, which digitize animal health records, improve traceability, and strengthen monitoring. Likewise, the Integrated Health Information Platform provides near real-time geotagged human health data for early detection and timely response. Together, these platforms unify India's surveillance landscape to support faster, smarter, and evidence-based decisions. When outbreaks occur, India responds as one. Scientists, doctors, veterinarians, forest officers, epidemiologists, and administrators work under a coordinated command. Through the National Joint Outbreak Response Team, ministries converge to contain and control outbreaks swiftly and effectively. A clear testament to India's strengthening pandemic preparedness are the National Health Emergency Simulation Exercises, Vishanu Yuddha Abhyas, and Viral Sankraman Abhyas, drills conducted under NOHM. These drills brought together experts from human health, animal health, wildlife, disaster management, and laboratory systems to test coordination, communication, and rapid response capabilities. Innovations like India's first BSL-3 mobile laboratory, Ramban, now make it possible to deliver high containment diagnostic capability directly to outbreak sites, reducing turnaround time and enabling faster containment. One Health is not just a program. It is a national movement built on awareness, collaboration, and shared responsibility. A healthier nation begins with informed and prepared communities. Through the National One Health Mission, India leads with unity, science, and innovation, protecting tomorrow for one world, one health, one India.
So after that powerful and insightful presentation, the powerful video, time now to make this seminal occasion all the more epochal by a release of an important and a pivotal document. And to do the honors, may I please request our esteemed dignitaries on the dais to kindly release the BSL-3 Laboratory Network SOP Compendium. Ladies and gentlemen, the compendium is a pivotal document that standardizes the procedures for collecting, handling, and testing human, animal, and environmental samples across India during outbreaks. and the distinguished dignitaries on the days marking the release of this pivotal document. By detailing uniform standard operating procedures, this compendium aims to ensure that laboratories in the network adhere to harmonized protocols, thereby enhancing the quality and reliability of outbreak investigations and facilitating coordinated multisectoral response. Thank you very much. And time now. Ladies and gentlemen, it is my distinct honor to now invite a distinguished physicist, an acclaimed researcher, and one of India's most respected scientific minds. Ladies and gentlemen, please put your hands together for Professor Ajay Sood, the Chairperson, Scientific Steering Committee on One Health, the Principal Scientific Advisor to the Government of India, to please address us.
Honorable Chief Guest Dr. Vinod Paulji, distinguished secretaries and officials from center and states as well as union territories, esteemed representatives from multilaterals and partner nations, colleagues from science, health, environment, and agriculture, friends and partners in the One Health community. A very good morning to all of you. Namaskar. It is a privilege to welcome you all for the National One Health Mission Assembly 2025, a gathering that makes an important moment in India's collective journey towards an integrated, science-led, and future-ready health architecture. In recent years, India has been steadily weaving together what once existed as parallel worlds: human health, animal health, environmental stewardship, and community resilience. The National One Health Mission is the culmination of that effort, a framework that is both a visionary and deeply practical, created to bridge gaps, align capabilities, and connect ministries, scientific institutions, and frontline systems into one coherent fabric. This mission reflects the Honorable Prime Minister's consistent call for a holistic, resilient, and technology driven health system. He has emphasized that a healthy India is the foundation of a developed India, and that our preparedness must extend from villages and livestock to forests, laboratories, and global supply chains. This mission translates this vision into action. What makes today special is not just the scale of participation, which you can see here, but the story it represents. For the first time, 16 central stakeholders, including states and union territories, have come together with a shared purpose. Alongside, we have Youth of India as One Health warriors and global leaders who bring insights from across continents. Today's theme, translating knowledge to practice, One Earth, One Health, One Future, reflects the purpose of our coming together. It underscores the importance of turning knowledge into meaningful action on the ground. One Health, One Earth speaks to our shared environment, One Health to the interconnection across sectors, and One Future to the responsibility we collectively carry. As we embark on discussions over these 2 days, our agenda captures both the breadth and the boldness of this mission. It also reflects the Honorable Prime Minister's vision of an India that is better prepared, more resilient, and capable of safeguarding both its people and its ecosystems. An India that moves from reacting to crises to anticipating and preventing them. I wish you all a very fruitful interaction in these 2 days, and we hope that this mission will take our collective efforts much farther. Thank you very much.
Thank you very much, sir, for your inspirational and sagacious address. It is indeed our privilege to have amidst us as the chief guest a noted persona of deep intellect, the member of the national institution transforming India, the Niti Aayog. Ladies and gentlemen, Professor Vinod Paul, a globally recognized medical scientist and a public health exponent. And it is our proud privilege to now invite you to please address us, sir.
Thank you. Namaskar, good morning. Respected Professor Ajay Soji, Principal Scientific Advisor to the Government of India, very distinguished and esteemed secretaries of different departments and ministries, Government of India, distinguished invitees from the state governments, our partners, UN partners, and other fellow travelers in global international health, and above all, the delegates representing the entire nation. Today is a beginning of a Jan Andolan for preparedness for future challenges in health of humans, wildlife, and domestic animals, and indeed the environment as well. It's an honor for me to join all of you today at the National One Health Assembly 25, a platform that truly symbolizes the spirit of integrated health and whole of society collaboration. Today we gather not merely as individual sectors that we represent and that we have expertise in, but also as one unified ecosystem committed to safeguarding the health of our people, our animals, and our environment. In this endeavor, in the endeavor of National One Health Mission, we draw inspiration from the Honorable Prime Minister's call for One Earth and One Health at G7 convening in the midst of global COVID-19 pandemic on 12th June 2021. He said, we have a shared future and these challenges have to be met through the mantra of One Earth and One Health. As we meet here, we all continue to face complex health challenges, zoonotic diseases, antimicrobial resistance, climate-driven health shocks, and ecological imbalances. These threats do not respect borders, sectors, or ministries. They exploit every weakness in our system. And therefore, our response to must transcend silos and individual groupings. The One Health approach is no longer an academic ideology. It is a national security imperative, an economic stability strategy, and a social justice commitment, and our very important pillar for attaining a safe, secure, Viksit Bharat as we move forward. India, with its vast biodiversity, large livestock population, dense urban centers, and dynamic environmental transitions stands at the intersection of opportunity as well as vulnerability. We are recognized globally as a potential hotspot for emerging and re-emerging zoonotic diseases. But let me also say with deep conviction that India is fully poised and is capable of mounting a, emerging as a global hub for solutions in this space as well. We are hotbed for challenges, but we are also the place where solutions will be crafted and be made available not only to our own nation, but also to the world. The National One Health Mission represents one of the most ambitious, integrated, and future ready frameworks ever created in our country. Under the guidance of the Prime Minister's Science, Technology, and Innovation Advisory Council, chaired by Professor Sood, and through the stewardship of multiple ministries and scientific agencies, India is leading the way in institutionalizing One Health as a permanent pillar of pandemic preparedness and integrated disease control. This is not a temporary project. This is a long term commitment, and we have a stable architecture to take this commitment forward. A critical pillar of this architecture is integrated surveillance. The time has come to break the artificial boundaries between human disease surveillance, animal health surveillance, wildlife monitoring, and environmental data systems. A virus does not differentiate between sectors, neither can our surveillance system, therefore. We are building mechanisms that connect data sets across ministries, across different states and union territories, and indeed across academic and research networks as well. Real time reporting, federated data architecture, and standardized surveillance indicators will allow us to detect early signals of outbreaks long before they reach hospitals, homes, workplaces, and schools in our country. Technology enabled surveillance is transforming our ability to predict and prevent disease emergence. AI models, GIS based mapping, satellite linked environmental analyses, and mobile applications for frontline workers are no longer luxuries. They are routine and essential tools of our work today. One of the most important and often overlooked components of One Health is interface surveillance. I'm happy to inform you that a major initiative is already underway in, in ensuring surveillance at slaughterhouses, livestock markets, poultry farms, peri-urban settings, zoos, wetlands, and sanctuaries where animals and humans have a deep and sustained connect. When an outbreak does occur, the speed and cohesiveness of our response determines the ultimate outcomes. India has demonstrated during COVID 19 and subsequent events like the Nipah outbreak that a unified national response, swift national response, saves life. The joint outbreak response framework developed under the One Health mission will institutionalize this approach, and it will combine the strengths of epidemiology, veterinary science, wildlife sciences, environment sciences, laboratory networks, and local authority systems into one single national team. Outbreak investigation, risk communication, containment, and community engagement must be synchronized. I'm so happy to see here communities being represented, and that is why today is the start of National One Health Mission as a Jan Andolan. And indeed, this is a proud moment for our nation. Preparedness requires that our scientific ecosystem stays ahead of pathogens. Medical countermeasures, namely diagnostics, vaccines, and therapeutics, which eventually save lives, animal lives, and human lives, must be available rapidly at a scale. Recently, last year to be specific, Niti Aayog, with the support of all the ministries, launched a report, namely Future Pandemic Preparedness and Emergency Response. Under this report, we provide a pathway for India's 100-day mission for medical countermeasures. We envisage that India will be in a position will be in a position to deliver countermeasures within 100 days, as is the benchmark globally today. We wish to invest in pandemic modeling and forecasting, animal models, diagnostics validation system, clinical trial systems, as well as creating centers of excellence for skilling in this regard. We also envisage reforming and streamlining our regulatory system to ensure that countermeasures are available in the soonest possible time frame. Another pillar of One Health preparedness is our national network of BSL and BSL4, BSL3 and BSL4 networks. We are so happy to see the release of the SOP document today, and this demonstrates that this laboratory system, which originally represents different ministries and departments, has now come together to be able to respond to One Health related threats and for pandemic preparedness. Our endeavors are guided by the philosophy of whole of government, whole of nation, and whole of society. No mission of this scale can succeed without a skilled and empowered workforce. We must build a new generation of One Health professionals, experts who can think across sectors, who understand epidemiology as well as ecology, data science as well as community behavior. Joint training programs for doctors, veterinarians, environmental scientists, microbiologists, and public health officers is essential. We must also integrate One Health thinking into medical, veterinary, and environment science curricula nationwide. And we must invest in training of our frontline workers, Panchayati Raj institution members, municipal staff, animal handlers, and so on, because they all could be the first responders. States and local governments are the real implementing engines of One Health. While national frameworks provide direction, it is the states that translate policy into action. I strongly encourage every state to establish a state One Health platform that brings together multiple departments like the national network, like the national convening that you heard about, and ensure data sharing and be prepared for joint response. At the same time, going further, we will need district level One Health units and cells. That's the work to be done for integrated surveillance and rapid response. India has a unique opportunity to lead One Health paradigm in the world. We bring to the world a model of One Health that is affordable, scalable, and inclusive. Through the G20 process, WHO collaborations, South South partnerships, and knowledge exchange with other countries, India offers to foster One Health security for all nations. As we stand here, I would like to call upon ministries, scientific agencies, state governments, and community organizations to commit to a shared outcome, that is, the health of our people, health of our animals, and indeed the health of the environment. Let us ensure that every discussion in this assembly translates into measurable action, whether it is surveillance, research, workforce development, or community empowerment. In closing, let me emphasize that One Health is not merely a framework. It is a philosophy, a duty, a promise, and an endeavor. A promise that we make to our children and to future generations. A promise that we build a safe, healthy, and resilient India by working together, guided by uh, the visionary guidance that we receive from the Honorable Prime Minister. Let us move forward with determination, unity, and a shared vision for one earth, one health, and one future. Thank you very much. Jai Hind.
Our earnest sense of gratitude to you, sir, for guiding us with your exemplary vision and wisdom. Time now for a message from one of the most articulate voices of the government, who's strengthening the health landscape. Ladies and gentlemen, the Chairperson Executive Steering Committee on One Health, Honorable Minister for Health and Family Welfare and Chemicals and Fertilizers, Government of India, Honorable Minister Shri J.P. Nadda. May we have the message played, please?
Good morning and very warm welcome to all of you at the National One Health Mission Assembly 2025. I would have loved to join you all in person, but due to some certain pressing engagements, I'm not able to join this inaugural session physically. This year's theme, Translating Knowledge to Practice, One Earth, One Health, One Future, is both timely and insightful, reflecting our national priorities as well as the broader global health agenda. Over the past decade, India has established itself as a major player in the health research and pharmaceutical sector internationally. Our scientists, researchers, and industry leaders have delivered breakthroughs that have strengthened our nation's health security and contributed to the global well being. India's vaccine leadership has been exceptional. We developed indigenous COVID 19 vaccines like Covaxin, Covishield, Corbevax, and the world's first intranasal vaccine and supplied vaccines to more than 100 countries. We have also advanced next generation platforms in mRNA, DNA, viral vectors, and biosimilars, laying the foundation for rapid responses to future pandemics in the diagnostic sector. India has emerged as an innovation hub driven by advancements in technology, strong research capabilities, and a rapidly growing ecosystem of startups. Indigenous technologies like TrueNAT, PathoDetect, CRISPR based tests, and a growing ecosystem of medtech startups have greatly expanded our capacity for rapid, accurate, and affordable testing. Our clinical research network, genomic surveillance through INSACOG and One Health initiatives are strengthening public health science like never before. The CoWIN platform, developed during the COVID 19 pandemic, demonstrates India's exemplary capacity of developing a high quality database for almost its entire population. One of the emerging examples of India's leadership towards pandemic preparedness is the launch of the National One Health Mission. The mission brings together 16 different central and state ministries, departments related to human, animal, environment, health, pharmaceuticals, science and technology, earth and space sciences, defense, fisheries, agriculture, and disaster management. It is a unique example wherein all stakeholders have pledged to work with each other to protect the health of the humans, animals, environment, and plants. The National One Health Mission is the first of its kind, which showcases India's tremendous strength in pandemic preparedness by collaboration of various ministries and departments. I'm happy to note that the mission has already initiated important activities related to integrated surveillance across human, animal, environment sectors in slaughterhouses, bird sanctuaries, zoos, wastewater, surveillance in major cities of India to track AMR and infectious pathogens, joint outbreak investigations, and development of medical countermeasures. The national network of 23 BSL-3 or BSL-4 labs established under the mission are like the first line of defense for quickly detecting any new or mutated pathogen which can cause outbreaks. The network undertaken as a part of the National One Health Mission will help in integrating efforts to historically improve the health across sectors, identify early warning signals for emerging epidemics and pandemics, and help us in developing focused interventions to be better prepared for the next pandemic. I'm sure that the collective strength of all departments that have been brought together by the mission will yield one of the best outcomes and reassert India's global leadership in protecting health of all. I congratulate all the partners and the stakeholders of the National One Health Mission for organizing this conclave, which will provide a valuable opportunity for people coming from different streams to interact, share scientific knowledge, and collaborate. I wish success for this conclave. Jai Hind.
And as we embrace those pearls of wisdom from the Honorable Minister, may I now invite Dr. Nivedita Gupta, the National One Health Mission Coordinator from the Indian Council of Medical Research, to kindly deliver the vote of thanks. Ladies and gentlemen, with a welcoming round of applause from you all, Dr. Nivedita Gupta.
Very good morning to one and all. And it's really a proud privilege for me to offer this vote of thanks on behalf of the National One Health Mission. I would first of all sincerely like to thank the Honorable Minister of Health and Family Welfare and Chemicals and Fertilizers, Shri J.P. Nadda ji, for his very encouraging remarks at the beginning of this conclave. Though we dearly missed his presence during today's event, but his encouraging words would really instill adrenaline in all of us, and we will work towards the success of this mission. I would also like to thank sincerely Dr. Vinod Paul. So, your enthusiasm and your encouragement always helps us to set the bar higher and higher. And your visionary leadership really helped us to do quite a bit of things during the pandemic. And we look forward to your continued guidance to steer the work of this mission as well. I would also like to thank PSA sir, Dr. Ajay Sood. Sir, your visionary guidance and leadership has really put us in a place where India is now in a position and steering one of the most unique One Health, I would say, landscape in the world. So thank you very much, sir, for your visionary leadership, your continuous guidance and hand holding. I also would like to specially thank all the secretaries who have come from various departments. My special thanks to Secretary DARE and DG ICAR, Dr. Mangilal Jat sir. I would also like to thank Secretary Department of Biotechnology, Dr. Rajesh Gokhale, for being a very pivotal part of this mission. My sincere thank you to Secretary Department of Space and Chairman ISRO, Dr. V. Narayanan, for coming here, sir. And also I would like to thank Dr. Rajiv Behel, Secretary Department of Health Research and Director General ICMR, for his visionary guidance and his passion to take the activities of this mission in a very integrated and collaborative way. I would also like to thank all the departments which are a key in the cogwheel, I would say. Department of Animal Husbandry and Dairying, Ministry of Health and Family Welfare and NCDC, Ministry of Environment, Forest and Climate Change, Ministry of Earth Sciences, then Defense Research and Development Department, National Disaster Management Authority, Ayush, Department of Pharmaceuticals, Department of Science and Technology, Council for Scientific and Industrial Research, Ministry of Fisheries, then all the state governments and representatives from the Directorate General of Armed Forces. I would also like to thank various international speakers and participants who have really taken pain to help us and support us in this mission. My special thanks to Dr. Tedros Adhanom Ghebreyesus for sending DGWHO for sending us a recorded message, which you will hear in the subsequent sessions. My thanks to Dr. Alu Dohong from FAO for attending this meeting. I would like to thank Dr. Semmate from the World Bank and Dr. Hikupi from World Bank for joining us and gracing this occasion. I would thank Professor Jane Halton from CEPI for sending her recorded message. We missed her presence as she could only get the visa at the last moment. My heartfelt thank you to representatives of embassies from the US, UK, Italy, Norway, Switzerland, Finland, and France, colleagues from WHO, CDC, FAO, other national and international agencies for joining this. And I would fail in my duty if I don't thank the chairs of various committees under the National One Health Mission, Dr. Madhuri Kanitkar, Dr. Renu Swaroop, Dr. Chandru, and Dr. N.K. Arora for steering various committees on medical countermeasures, the network of labs, data, and surveillance, and guiding the activities of this program. I would also like to thank Dr. Parminder Maini for her continuous engagement in the activities of this mission, and all the colleagues from VRDLs, IRDLs, MRUs, MRHRUs, directors of ICMR institutes, independent researchers, colleagues from industries, innovators, independent experts from various departments. And I would earnestly and specially like to thank our young colleagues who have joined from various schools, colleges, as well as from various parts of the country, the hackathon winners. We are really very grateful to you and look forward to continuously engage with you under the National One Health Mission, and look forward to having you as sentinels of this mission so that you could inform your state health officials whenever you see anything wrong or anything unusual happening in the environment, people, or animals around you. So, very warm welcome to each one of you, and thank you for joining. And finally, I would like to thank the additional DGs of ICMR, Dr. Sangamitra Pati and Dr. Alka Sharma, the senior leadership of DHR ICMR, uh, uh, Anu Nagar Madam, Dr. Richa Koda Madam, Richa Pandey, Manisha Saxena Madam, Dr. Pragya, who's the director in charge of the National Institute of One Health, Tusharji, Jagdish Rajeshi, and the entire organizing team. And the list is long. I want to thank each and everyone who has helped in making this conclave happen. And if I have missed anyone in this room, I'm really my apologies. But I sincerely thank each and everyone who's sitting in this room and has worked behind the scenes to make this conclave happen. Thank you very much.
Thank you very much, Madam, for that warm vote of thanks. With that, ladies and gentlemen, we culminate the proceedings of the inaugural session, and time now for us to express our earnest sense of gratitude to the distinguished dignitaries on the dais with a resounding round of applause for gracing this epoch-making morning with their gracious presence and wisdom. Thank you very much. Ladies and gentlemen, the multi-purpose hall now awaits you for a hot sip of tea coffee, requesting you all to kindly use the rear exits and kindly allow us to use these exits for the esteemed dignitaries. Also drawing the attention of all our dear students, requesting you all to please stay back with us. Your role has already been highlighted, and we request you to please stay here in this auditorium with us. And requesting everybody to please reassemble on time. We have the next session commencing at 11:45. Thank you very much. Enjoy your break. noted that.
This is my thing.
This is
Correct.
yours. Yes.
Perfect.
So down arrow you can,
Diana.
right, sir?
So
Welcome back, ladies and gentlemen. Requesting you all to please settle down. Requesting all those who are yet to take their seats to kindly make your way. Requesting all those who are standing to please take your seats. And if I may request all those who are seated in the rear seats and rows, if you could please bring your bright faces a little closer to the dais, please. Can we make this look a little more crisp? All those who are sitting seated in the rear rows, requesting you all to kindly take your seats in the front rows.
You had your tea? इसके ऊपर
Ladies and gentlemen, we already have amidst us an exalted panel and some of the most applauded luminaries to take us through the upcoming session. I once again request all those who are standing to quickly settle down and all those who are seated scattered in the most rearmost rows, if you could please quickly come back and take your seats in the former rows ahead of you. Thank you very much for making that move. And we are ready to begin with the proceedings of the session formally, requesting all those who are standing to kindly settle down. Health is the business of every sector and not just the health sector. In this background, ladies and gentlemen, our opening session delves into an overview of the One Health landscape and pandemic preparedness in India and transcends onto highlighting the sectoral contributions to One Health across ministries and departments. To begin this session with a plenary address, ladies and gentlemen, with a thunderous round of applause, please welcome on the dais Professor Ajay Sood, the Principal Scientific Advisor to the Government of India. A very warm welcome, sir, and may we please request you to please take forth the proceedings for this session.
Both.
Namaskar. Welcome once again for the first session on One Health landscape and pandemic preparedness. We have a panel discussion with very eminent people on the dais. We have with us Dr. Rajiv Behel. We have with us Shri Naresh Pal Gangwar, Dr. Mangilal Jat, Shri Tanmay Kumar, Dr. Rajesh Gokhale, Dr. V. Narayanan, Dr. Samir Kamath, uh, Shri Manish Bhardwaj, and Mrs. Punya Srivastava, Secretary, MOHFW. Welcome to all of you to this panel discussion. And so the format is that I'll give a brief introduction in few slides, and then I'll request each one of the panelists to give their overview and contribution to this One Health collective. So let me start with a brief presentation just to recapitulate what this One Health mission is, which was also mentioned in the plenary session. This is just to set the stage rolling. Can we? So, over the last few decades, we have seen how diseases move freely between people, animal, and the environment. And our systems have historically approached these challenges uh, sector by sector. This highlighted the need for a more integrated and coordinated way of working. So, the One Health approach recognizes that animal, human, and environmental health are deeply interconnected, and we need to strengthen one, which means it will strengthen all. So, strengthening one will strengthen all, which means we cannot have any neglect of any sector, and neglecting one weakens all. So, the genesis of the National One Health Mission, it was mentioned, let me recapitulate. For years, the One Health concept, which is what I have shown here, has been gaining global prominence emphasizing this interdependence. So earlier it largely remained within scientific and policy discussions with limited operational integration. So the COVID-19 pandemic was a pivotal moment. It underscored our vulnerabilities and highlighted the need for collective and decisive action. India recognized that a more integrated approach across the three sectors is essential for future preparedness. Now, recognizing this need, following extensive consultation across ministries and scientific institutions, the Prime Minister's Science, Technology and Innovation Advisory Council, PM STIKE, in its 21st meeting in 2022, approved One Health as a national priority and recommended the development of a coordinated national framework, which is what I have shown in this diagram. So the mission received cabinet approval in February 2024, paving the way for its formal launch as a national initiative. Following this launch, a comprehensive governance framework was established to enable a whole of government effort integrating surveillance, data systems, research outbreak response, and prevention across human, animal, and environmental sectors. And this is what this mission marks a significant shift from concepts to implementation, ensuring that One Health is not just understood but operationalized across systems. Now, let's look at the pillars of the National One Health Mission. Its purpose is simple but ambitious: detect threats easily, respond rapidly, and prevent outbreaks before they become emergencies. The pillars of the mission, as shown here, are pandemic preparedness, integrated surveillance, strengthening routine preventive programs, and joint outbreak responses, which support targeted R&D, integration of databases, streamlining regulatory and approval processes, and governance mechanism. So this is the whole of system in approach. So the global One Health landscape, if you look at, which is what is shown here, we have this mission. It aligns with the primary global frameworks, the quadripartite and the One Health joint plan action to address worldwide health securities. So we have the partners WHO, FAO, WAH, and UNEP. And under G20 presidency of in 2023, which was led by India, the Chief Science Advisor Roundtable focused on leveraging One Health for enhanced disease prevention, control, and pandemic preparedness, championing the cause of One Health. Now, the governance structure of the mission is what is shown here. We have all these 16 ministries and departments along with the state players, and this India mission aligns with the global One Health approach and goes a step further and creating one of the world's first national integrated One Health system, which spans across human, livestock, wildlife, and environment sectors. So as I mentioned, it is a whole of society approach, and each ministry leading it in what it does its best. This ensures faster detection, clear communication, and coordinated response across sectors. Now, mission overview, I'll quickly mention just the keywords. It has the integrated disease surveillance. It has targeted R&D for gaps in disease preparedness, joint outbreak response, pandemic preparedness, human and animal, streamlining the regulatory aspect, mechanism for data information sharing, strengthening routine prevention programs, and linking appropriate activities to the global efforts. So it strengthens existing national programs rather than creating parallel ones. This is important. And the goal is to build a resilient country that can anticipate risks, not just react to them. So the operational mechanism is very straightforward. We have the executive steering committee chaired by Honorable Minister of Health. Then we have the scientific steering committee chaired by PSA, which looks at setting the scientific agenda and oversight of all the mission activities. And under that we have advisory and review committees, 4 of them, which is what I have written here. It is chaired by independent experts, and they are all here in this meeting: surveillance and outbreak investigation, BSL-3 lab network, research and development, and the data integration. So these 4 committees, they look at all aspects, and we discuss that in scientific steering committee and executive steering committee. So as you know that the National Institute of One Health in Nagpur, the Honorable Prime Minister laid the foundation stone on December 11, 2022, and NIOH will serve as the institutional anchor for coordination of the mission. I will not go in detail. As I mentioned, it has a first thing which we have done is the notification of BSL-3 lab network. 23 BSL-3 labs now support high-risk pathogens diagnostic across sectors, and labs have been trained to handle both human and animal samples safely. And national joint outbreak response team have been notified and operationalized with representations from all sectors for coordinated cross-sectoral outbreak investigation. So we have a very important center state and state linkages, which you all know are very critical for operationalizing One Health on the ground. And the first state and union territory engagement workshop was held recently, which helped to co-develop frameworks, strengthening cooperation and support local implementation. And as you see today, the SOPs were released on this framework. So we have many key initiatives under this mission, and I'm sure our panelists will refer to that and discuss what is happening. We have the youth engagement, several activities such as the Idea One Hackathon. You can see downstairs all the players who have participated, which to build awareness and innovation at the human animal environment interface. We have many community awareness generation, which includes webinars, workshops, newsletters. One of them is shown here, Vigyan Dhara from Office of PSA, focused on One Health. This particular issue, online courses and learning modules are being made, and One Health themes in university curricula will be introduced as we go along. So I think let me just finish it by mentioning the future prospects where we need the participation of all the players. It need to strengthen linkages, which include center state and state connect, and we need to organize regional consultations. We need to have R&D support, cross-sectoral R&D support for medical countermeasures, artificial intelligence tools for disease modeling, and integrated surveillance. We have to have a global connect, and then we need most importantly community engagement, enabling youth participation and community awareness to enhance local level engagement. Multisectoral initiatives, again I will not mention. You can see each sector has taken up activities under one mission, from research and diagnostic to surveillance, environmental monitoring, and animal disease control. So this, as you all will agree, reflects a fundamental shift. We are no longer responding as separate departments but as one ecosystem. This was highlighted in the remarks of Honorable Minister, and this is really the theme of this One Health mission, and we will hear more about it in the coming session. So I think we will all agree that One Health is not a one-time initiative. it is a long-term mission. And the experience of COVID-19 reaffirmed the need for better coordination across systems, and the National One Health mission will strengthen India's readiness for emerging health threats. So our collective aim is together we are safeguarding the health of people, animal, and the ecosystem that sustain us, which really is the theme of One Health, One Earth, and One Future. So we will proceed now with the panel discussion. I'll request my esteemed panelists to give their remarks in 5-6 minutes, and then we will have a discussion further. So may I now request Dr. Rajiv Behel, Secretary, Department of Health, Research and Director General ICMR, to give his opening remarks, and then we will set the ball go rolling. So you have a presentation. Small.
Thank you very much, sir. Respected Professor Sood, PSA, Government of India, secretaries of 9 departments who are on the dais. This is a meeting where we have from across India scientists and program people, and from states all across India, states and union territories, to discuss how what we are currently doing in One Health Mission and how will we take it forward. So the states are the most important in this whole series. So I would really request that all this discussion that we will now have, can I put the slides on? So what we were going to have is each of the departments will talk, but you will see a lot of overlap. And we intentionally want you to see that overlap, that many of the things which we will talk about, none of them will be purely from one department. They will be from multiple departments, and many activities will be overlapping. So regarding the Department of Health Research, we are the nodal department for implementing the activities, given that the One Health Mission budget is within the department. But that does not mean much because all the 16 ministries and departments work extremely closely together. Our contributions are to all the parts of the National One Health Mission. We contribute to surveillance. We contribute to technology enhancement in surveillance by making new tools available. We contribute to the national joint outbreak response, and we also contribute to development of medical countermeasures by all the departments that are responsible. In surveillance, although the lead is the national, the NCDC, or under the Ministry of Health and Family Welfare, the Department of Health Research contributes by sentinel syndromic surveillance, which means that at our medical colleges, we have 165 medical colleges that form part of our network, and we are doing now syndromic surveillance in these VRDLs or these medical colleges. The numbers are smaller than 165 because we are starting in these and working towards having all those medical colleges where any case of severe acute respiratory illness, any case of severe acute encephalitis, or severe fever, hemorrhagic fever or fever with rash, and severe acute diarrhea, every week samples are taken and analyzed for a list of priority pathogens. And these priority pathogens in not only include commonly detected pathogens, but also less commonly detected pathogens in case we don't find the common ones, and rare or exotic pathogens if we don't find priority 2. In fact, If we don't find a pathogen of category 1, 2, or 3, we take those samples to do sequencing and metagenomics so that we can find the cause. The idea is to be prepared for a pathogen X. The panels below show weekly data of, in the left side, I have the surveillance for respiratory illnesses, and on the right, it is acute encephalitis. We have multiple surveillance projects in partnership with all the departments of Department of Animal Husbandry, Department of Environment and Forests, Department of Agricultural Research and Indian Council of Agricultural Research, in bird sanctuaries, slaughterhouses, zoos, and these are meant to find a model in which we will try to see when there are humans at the interface of wildlife and livestock, if any of the pathogens are jumping from one species to the other. We are also part of the National Biosafety, High Biosafety Level Laboratories. As you can see, the Indian Council of Medical Research has about 10 labs out of 23. 10 labs are ICMR, but there's also labs from DBT, CSIR, DHD, Indian Council of Agricultural Research, DRDO. But we have also helped in training all these 23 labs for human pathogens. Similar training for animal pathogens has been done by Indian Council for Agricultural Research. I'm also very happy to show that we have participated in the planning and execution of 2 mock drills where a mock epidemic or mock outbreak was reported in a state, first in the state of Rajasthan, and then the next one we have done recently in the state of Madhya Pradesh. This is done with all the leadership of the departments at central level, but also the chief secretaries of that state and the secretaries of different departments of the states planning this exercise together so that we can see it, that what is our preparedness from the level of a village, a community health center, a block, a district, the state, and the national team in finding a, firstly in investigating an epidemic and then making a plan to uh, to control that outbreak. And these 2 outbreaks you will see later in some more detail. We also contribute along with other departments like Department of Biotechnology, the Indian Council of Agricultural Research, and many others to developing countermeasures against priority diseases in which we are engaged. We have a phase 1 protocol already not only submitted but approved by the regulator for Casanur forest disease vaccine. The Nipah monoclonal antibodies have been made by both the Department of Biotechnology Institute, THSTI, and the National Institute of Virology working together with industry. Zika vaccine trials are underway, and H5N1 vaccine as well. So this was just to give you a flavor of how a single department becomes a part of a mission and works with everybody else to go towards our goal, which is national preparedness for any emergencies related to any infectious pathogen. Thank you. Jai Hind.
Thank you, Dr. Ajib Behel, for this overview of the activities at ICMR and also for coordinating this mission. May I now request Shri Tanmay Kumarji, Ministry of Environment, Forest and Climate Change, you can actually give from here. There is a mic if you don't have a present. Yeah, can you put it on? आपका इनके बाद है Yes.
Respected Principal Scientific Advisor to Government of India, my colleagues, Secretary Department of Health Research and DG ICMR, the esteemed audience that is present here, experts, officers from different ministries, state governments. I take this opportunity to first and foremost compliment you for organizing this conclave. And a short while ago, in about a month back, we had a meeting on One Health. And very soon now we are having this conference where we have brought all the related departments together on dais. And true to the theme of the conclave, One Earth, One Family, One Future, I think this theme itself of having a One Health is a cross-cutting issue that we all have to deliberate on. This special session on One Health, landscape and pandemic preparedness has once again brought in focus the close relationship that exists between environment, human health, animal health, and the interconnectedness between all three domains is what calls for a integrated approach, a collaborative approach, where we are able to deliberate on the issues which affect each other. India is one of the 17 mega diverse countries in the world today, and we have more than 1,000 protected areas. In fact, the number of protected areas has increased from 745 in 2014 to 1,134 now. That is, we have added almost more than 3 protected areas per month over the last 10 years. This itself, while enriching the biodiversity, has also thrown a challenge in terms of the pressures of the environment on human population and vice versa. The pressure of human population on the animal kingdom. So the zoonotic spillovers is actually a reality. It is a threat, and it needs to be dealt with, in a holistic manner, in an integrated approach. The studies indicate that the more than 75% of the pathogens, etc., which affect the human health come from the animals itself. And we had the statistics show that globally, zoonotic diseases account for about 1 million illnesses each year. 1 billion illnesses each year is a lot of, is a real challenge. So 1 billion illnesses each year because of zoonotic disease is something that we need to deliberate on. And more than 30 pathogens have been, have originated from the animal kingdom itself. So therefore, we need to actually come together, and the One Health mission that has been launched and the SOP for which has been released is a step in this direction as to how we can come together not only at the national level, but at the state level, at the district level, at the panchayat level itself. While the technical things have been explained here, the administrative issues call for not only surveillance, but early detection. Then we should be able to identify the reasons. Therefore, there is a need for a strong network of research labs related to animal health, related to the the human health, the exchange of the data, the exchange of research findings, the coming together of the scientific community to be able to cope with the the challenges that are being thrown. And it is in this respect that I'd like to mention that we as a ministry have been working very closely with the health ministry in the joint response teams, in our own surveillance methods, not only of animals but also of migratory birds, which also bring together their own diseases, the avian influenza, then the COVID-19. All these are challenges which have come up from time to time, and we have been reacting. As has been rightly pointed by Mr. Sood, rather than reacting, we should be able to anticipate. And in this, area, the ministry has recently, under the visionary leadership of our Prime Minister, who had a meeting of the National Board for Wildlife on 3rd March, we have actually set up an institute, the National Referral Center for Wildlife Diseases at Junagadh. So that has been launched, and Honorable Prime Minister inaugurated, actually led the foundation stone for that in that meeting. So these are the steps which have been taken, and we have been working very closely with the ministry. The the MFCC has also come out with a biomedical waste management rules 2016, and we have a portal where we are able to track the movement of biomedical waste and its disposal. These are some of the steps that have been taken by the ministry along with the other departments to be able to present a joint action plan, a joint methodology of carrying out research, and also to contribute to each other. So it is only then that we are able to come out with a holistic response.
Thank you.
Thank you very much for the.
Thank you very much, Tanmayji. May I now request Dr. V. Narayanan, Secretary, Department of Space and Chairman ISRO, to make his brief comments.
Yeah, very good morning to all of you, most respected Principal Scientific Advisor and distinguished panelists, secretaries of various departments. It is a great honor and privilege for me to be with you in sharing a couple of my thoughts. The National One Health Mission is a mission, immense significance for the nation as it looks at the health of the nation in a very holistic manner, considering health and disease management across the domains of medicine, vegetation, wildlife, environment, and climate. Not only does this target the general health and safety of our nation, it would also keep us prepared for any epidemic or pandemic that would threaten our society in future. Dear friends, I was looking at the country's growth. 1947, when we got independence, the average life expectancy in the country was just 32 years. From that, 2 months back, this number has increased to average healthy life of the Indians have become 72 years. Let us give a big hand to the people who have contributed to that great cause. As you all know, Indian space program, we are contributing significantly in multiple areas, including communication, earth observation, navigation, and space exploration. And our contribution in the health sector, a small way we have started. So that's what I am going to address to you. Before I address, this year, we had got great two important missions. This year, this month, June 2nd, we had lifted off the 4,400 kg communication satellite, the heaviest satellite ever lifted off from Indian soil, and we have succeeded. Another important mission is the costliest satellite ever built in the world, the NASA ISRO synthetic aperture radar satellite, for which 13,000 crore is invested by NASA, and similar payload we have also built, and the full satellite was built by India and placed in the orbit successfully by Indian. It is one of the fantastic satellites. Coming to ISRO's contribution, as I told, solely not like other departments, we have not done great job, but something we have done. Number one, the telemedicine is one of the very important area we are contributing, not now, almost last 15 years. Today, we are having 182 telemedicine nodes across the country, connecting the super specialty hospital. Please understand, when we have got in the city super specialty hospital, those people who are in the remote village, they should get benefit out of it. This is the place probably we have contributed in a little way. And we have developed and deployed many instruments on our satellite as well as data analysis and archival tools in public domain which enable Earth observation. The vast data and analysis from these platforms have supported several departments and state ministries in surveillance and forecasting of diseases like malaria, dengue, and so on. We have deployed many such prediction and early warning systems for diseases in the Northeast region. We have also deployed projects for geotagging of health centers and institutes to support public health initiatives. One of our significant milestone is the National Health Resources Repository, which we developed along with the Ministry of Health and Family Welfare. And ISRO's homegrown quality practices have led to improvements in emergency care services in the hospitals through our health host program. And COVID-19, I think India handled excellent way under the leadership of our Honorable Prime Minister Narendra Modi ji. Even 140 crore people is such a vast, huge population. The way we handled, I think we can be proud of the way we handled the COVID-19. And to our contribution, I still remember for want of just half liter of the medical oxygen, even my own village, we lost two of our colleagues. And under that situation, 24/7, we were operating our oxygen plant. To our credit, we have supplied something around 600 metric ton of oxygen to 3 states. And we are supported in this activity. And we are here to support whatever way you want in the One Health India mission. We are ready to support. In fact, our space assets can do lot of things in forecasting, lot of things we can do. And coming to another important thing, today we are talking about the human spaceflight program. And already it is going to be a reality by 2027. We are going to send our Gaganyatri using our own rocket. And lot of things are done in that area. Recently, Subhashnu Sukla was sent to space and brought back safely. One of the important experiments done is the muscle regeneration under microgravity condition by Institute of Stem Cell Research. Actually, it has brought lot of result by adding couple of reagents. How we are overcoming the problem, we have got lot of handle on that. And this year, April 25, we have also signed a MOU with the Sri Chitra Institute of Medical Science for the space medicine. In fact, when today we are having only 2 astronauts in our country, in another 10 years we are going to have number of people. So space medicine is very, very important area. Now, even though I am not a medical person by profession, in my house, lot of medical books are flooded. In fact, my father-in-law, 50 years he has worked in the area of filarial diseases. And so many medical books are there. I had the opportunity to read his DSc thesis. My wife has worked in the area of the diabetic medicine. And thereby, I have become little knowledgeable. And solely, with the entire support of ISRO team, we are ready
Dr.
to
Narayan.
support in
We
a big way.
appreciate.
Thank you.
But before you leave, there is a suggestion from Dr. Rajiv Behel that can you launch One Health satellite, National One Health satellite, at the earliest for surveillance. So this is a time for you to commit, and this is something. All right.
Yeah, we will take it forward with the approval of Honorable Prime Minister of India.
Yes.
We
yes,
will
thank
take
you.
it to him and we'll take it forward. Thank you.
Thank you.
Thank you.
Thank you very much. May I now request Secretary Department of Animal Husbandry and Dairying, Shri Naresh Pal Gangwarji, to make his brief comments.
Thank you, Principal Scientific Advisor, sir, my secretary colleagues in the Government of India, representatives of the state government, and ladies and gentlemen. First of all, I would like to thank Principal Scientific Advisor, sir, and his team, and ICMR for providing this platform to me for sharing what my department is doing and contributing in this One Health mission. This platform is a true reflection of the approach which you were talking about in his initial remark, that is whole of society approach. Not only representatives from all the stakeholder departments of Government of India and the state governments are represented here, but also several representatives from the society are also represented on these platforms. The importance of One Health, as has been talked about by the previous speakers, I would not go into that. We all know that animal is the starting point of many of the diseases. 5 out of recent 6 WHO public health emergencies of international concern had animal origin. We have got around 536 million livestock population, and if we add poultry, that is 51 million, both put together becomes almost similar to our human population. And animal health, as I have pointed out, that it is the starting point of many diseases. That therefore, animal health becomes a very important concern and a very important aspect of our One Health approach. Ministry of Department of Animal Husbandry and Dairying has been systematically working on preventive, curative, as well as surveillance part of animal diseases. Under the preventive animal health program, we have a very ambitious and very comprehensive program of universal vaccination, which covers foot and mouth disease, brucella, PPR, and CSF. And it is a 100% centrally funded scheme. And in past few years, we have been able to cover 1.23 billion animal with FMD vaccine, 47.7 million brucella vaccine, 270 million PPR, and 8.7 million CSF vaccine. We all know that brucella is a zoonotic disease, so there is always a danger of spreading this from the animal to the humans if it is not controlled well. These programs will certainly reduce the disease burden and genetic spillover risk of these diseases. We also support vaccination against other economically important diseases as per the state priorities under these programs. Apart from that, we have, because India is a very big country and we large with this kind of large population of livestock and poultry, it is very important to improve our service delivery to the animal. And the biggest challenge in animal disease control and delivery of services is that normally humans, when they fall ill, they seek medical services, whereas in case of animal, they don't seek. We have to provide those services to animal, and that is why our service delivery to animal has becomes very important. And in order to improve our service delivery of animal health to the livestock and other animal population, Honorable Prime Minister in March 2024 launched Bharat Pashudhan National Digital Livestock Mission. This is a platform where all the animal are registered, and through that we are effectively delivering our vaccination and other important services. This platform is also providing inputs to our disease surveillance programs, so for early detection and forecasting of disease. And one of the institute under ICR, Nivedi, Bengaluru, is doing extensive work on disease surveillance and forecasting using these data being generated from National Digital Livestock Mission. Apart from that, we have been working in strengthening our laboratory network. 5 regional disease diagnostic laboratories and central disease diagnostic laboratories are functional. And but this is not maybe seeing the size of country like India. Much more work is to be done on strengthening our lab systems. And recently, under G20 pandemic fund, we have got a grant of 25 million, particularly focusing on improving our lab infrastructure, and that work is going on, and ministry is focusing on improving our lab infrastructure through our other schemes also. And this is going to be one of the major focus area coming forward from here. Then, as has been pointed out, that One Health approach requires joint collaboration and joint action by all the stakeholder ministries at the Government of India level. So One Health National Joint Break outbreak response team has been established, and the ministry is extensively participating in the actions being taken by this. We established one health support unit in the ministry for helping states to develop their one health action plans. And state of Uttarakhand and Karnataka have been helped to develop their action plans as a pilot project. Several other activities like holding one health camps, community awareness program, and other things have been are being done continuously by the ministry. As I pointed out, that going forward from here, we need to really invest on improving our animal health, animal veterinary healthcare system, and states has a very important role to play. Ministry, with the help of states and in consultation with other experts, is developing a standard norms for establishing veterinary health institutions at village, at panchayat, and other levels. And very soon we will be issuing this to the states, and we'll hope that states will adopt that minimum standards and improve delivery of health services to the animal. Apart from that, several mobile units have been set up and things like that have been done by the department. At the end, I would say that this is a very important platform which you have provided us, sir, and this will bring this approach of One Health at the in the national discourse. This has already been done by establishing this national mission, and ministry will contribute in every possible way and whatever are the role which have been given, which will be given to the ministry, will participate and deliver this vision of One Health to the nation. Thank you, sir.
Thank you very much for your comments and also the way we are all participating together. Thank you so much. May I now request Secretary, Department of Agriculture, Research and Education and DG Indian Council of Agriculture Research, Dr. Mangilal Jat, for his brief comments.
Respected Professor Sood, colleagues on the panel, friends, when we talk about agriculture, I think agriculture sitting in the center of the intersection of the health and environment. So there is a strong connect between the health and environment. And I think we have seen one example, COVID, where agriculture through healthy food have helped. So I think agriculture beyond the genetics contributes into a larger way to the health or the One Health. And in that context, Professor Bahal and I have been discussing on agriculture for health. And I think that takes beyond the genetics. In terms of the ICR's contribution to the One Health program, and animals again comes because we got a division of animal sciences and fisheries from this One Health perspective, where we've been working all the science part of it together with the Department of Agriculture, Animal Husbandry, and ICR been contributing to 5 key areas in One Health program. Now, the first one is zoonotic disease surveillance and the research part. And we have quite a few institutions which are involved into this. So Nivedi, as was mentioned, is one important institution, the National Research Center on Equine, and also Indian Veterinary Research Institution, the NISAD. Those are the key institutions which are playing very, very important role in terms of monitoring and surveillance of the zoonotic diseases like rabies or avian influenza or anthrax and all those. The second part is the Nivedi, which is playing very, very important role in National Animal Disease Control Program, which is a flagship scheme launched by our Honorable Prime Minister in 2019 for control of the foot and mouth disease and brucellosis by providing the logistics support and supplying of the indigenous kit. Then the National Animal Disease Referral Expert System, which was also indicated by some of the hackathon colleagues outside, which was developed by the Nivedi and has recently been awarded under the Department of Administrative Reforms and Public Grievance. So congratulations to the colleagues at Nivedi, which also provides the forewarning on the animal disease outbreaks, including the zoonotics. Now, also together with the Indian Council of Medical Research, Department of Biotechnology, Department of Animal Husbandry and Dairying, and other related departments, the ICR works, on the joint disease outbreak investigation, diagnosis of the zoonotic pathogens through the network of the BSL-3 laboratories, and quite a few laboratories are part of this network of the 23 laboratories. And many of the other ICR institutions are part of the integrated human animal disease surveillance system. So that's where we are contributing. Also the All India Network Program on the One Health approach to the zoonotic diseases. The ICR is targeting some 15 zoonotic diseases by collaborating with the medical and wildlife institutions. Now, the second contribution is related to the food safety and antimicrobial resistance mitigation. So we have a network program on livestock and poultry product safety. So ICR ensure the monitoring of the foodborne pathogens, drug residues, and contaminants in the animal products. In addition, we address the challenges of the antimicrobial resistance, which is critical for the One Health issues. So we got All India Network Program on antimicrobial resistance in fisheries and the livestock. That's another one. And we are generating the countrywide AMR data, which is very, very critical for the One Health program. Through 31 centers, dedicated centers to generate the data on the AMR. But not only generating data on the AMR, we started working on antimicrobial uses, AMUs, which is going to contribute further to the One Health program. The third aspect is related to the wildlife and environmental health. So our institutions, again, NISAD in Bhopal is contributing to that, and also the eco-health research by studying the disease ecology at the interface of the domestic animals, wildlife, and human. That's another contribution. The fourth one is related to the capacity development and human resource management. Again, our institutions been working on those aspects, including training of the veterinarian, veterinarians, medical professionals, extension workers, and all. And the fifth aspect, which is we are trying to contribute on the policy support and inter-sectoral collaboration. So together with all other departments and even our international partners, we are working to contribute on that, and also generating the scientific evidence. And I think when we talk about the AMR, and I was discussing with our colleague DDG Animal Sciences, I think we need to have a mechanism in place to generate more of the data and have a data repository, because data is something very, very important, which even our Honorable Prime Minister been highlighting. We truly need to have the data access, and we need to strengthen that work. And I think agriculture is very, very critical towards the One Health. So we would like to strengthen this partnership and collaboration further together with all the departments and the ministries. And I think this is a unique program, and which is one of the best example across the world. I have seen even international agriculture, people talk about One Health, but the elements what we have together, and within 1 year, the progress, I think nobody else can do it. So my congratulations to the leadership here for the significant
Thank you very
achievements.
much. Thank you very much. And as you can see, there have been always cross references with various ministries, and that is the spirit of One Health, truly. And there is a program which is under discussion, National Plant plant health initiative, which will also tie up with the National One Health Mission. So that is again in the formation and which is being led by ICAR. So we will have more integration with the plant health very soon on that. So thank you very much. And now may I now request Secretary Department of Biotechnology, Dr. Rajesh Gokhale, to give his brief remarks.
Honorable Principal Scientific Advisor, Professor Ajay Sood, distinguished secretary colleagues, national and international experts, policymakers, scientists, and friends. I think first of all, it's my privilege to talk to all of you and address National One Health Assembly 2025 and this gathering of amazing, talented people who are all here today, actually. I think it's an amazing opportunity for all of us to really create a programmatic transformation in the country by developing this One Health Mission program. I must first of all also congratulate the PSA office and ICMR for taking this leadership to putting together this wonderful set of group of people actually, and I think bringing together the talent which is very important for this flagship initiative of National One Health Mission. As discussed already by others, the mission program really is a collaborative, multisectorial, transdisciplinary framework for addressing health risk as interface of human, animals, and ecosystem. And Department of Biotechnology being a cross-cutting by the nature itself, is kind of cross-cuts across various ministries and departments. In fact, we cannot do anything without help and guidance of these other ministries together. So I think our role is to a primary catalyst, being a primary catalyst, translate fundamental biological understandings into translational capacities, deployable technologies and solutions that secures the health continuum. If I really look at Department of Biotechnology's framework, I think we rest on 5 pillars actually. The first one is a strategic convergence, which ensures that the basic and translational research is aligned and we bridge the critical gaps that are really required to do. The second one is a technology deployment, where we drive ingenious capabilities and focus on rapid and scalable, affordable technologies that work across all the ecosystems. The third pillar is of ecosystem resilience, which is of building the various capacity and capabilities all across systems, setting up data centers, setting up centralized infrastructure and reactive mode. And so that we can not work in a reactive mode, but work in a preparative mode actually. The fourth one is the data management, where we want to keep the primary data, as also talked by ICR DG as well actually, where we want to deposit, storage and annotate the sharing of biological data across all systems actually. And that's very important for us to do as a country, which is a very critical important component of One Health Mission anyway as well. And finally, the fifth one is an international partnerships. We need to align with various international players so that our technologies are kind of not only for the country, but for the entire world available for that activities to look at it. I think what Department of Biotechnology brings in is test bed models that are very important, which can be then implemented by other line ministries to be able to do it. Towards this, we had a One Health consortium kind of program, which was actually ran for last 4 years, which is for seamless real-time data to identify and track zoonotic pathogens. This was done amongst 28 centers, departments and ministries across all the ministries, with 11 veterinary sciences, 8 medical sciences, 1 wildlife and 8 NER veterinary laboratories actually. And what we did was, in a small scale, we tracked 10 zoonotic diseases, which were all bacterial, viral, parasitic and foodborne, and 5 transboundary animal diseases actually. A lot of interesting learnings are there from this. Various protocols and methods have been developed, which can be very well adapted now to this larger national ambitious program of activities. And therefore, I think this will be a fantastic opportunity for us to work together. Finally, I will just say that DBT remains committed to serve as an engine of scientific innovation and One Health Mission. And I just think that this conclave will enhance from our partnership to integration, which will be the true mission of the One Health Mission program. Thank you.
Thank you very much, Dr. Rajesh Gokhale. Very insightful comments. And now may I request Dr. Samir Kamath, Secretary, Department of Defense R&D and Chairman DRDO to make his brief remarks.
Professor Sood, my distinguished colleagues, and ladies and gentlemen, a very good afternoon to all of you. And I'm indeed grateful to the organizers for giving me this opportunity. Some of you may be wondering what is Chairman DRDO doing in a One Health mission. Normally we work on weapons, platforms and sensors, but one of our key responsibilities is to also ensure that our services, when they go for their missions, are protected against any biological weapons which can be used on them. It is also to ensure that our civilian population is protected if one of our adversaries uses a biological weapon on us. So we have one laboratory, Defense Research and Development Establishment, which is located in Gwalior, which works exclusively on biological warfare agents or defense against biological warfare agents. This laboratory also addresses the needs of our soldiers in terms of human waste disposal when they are stationed in both high altitudes as well as remote locations. So the biodigester technology which this laboratory has developed has not only been useful for our services but has also now been implemented in the Indian Railways. So what I can say is that DRDO, although this is not our primary mission, we are committed to working very closely with the mission, and the work that is being done in the mission will also be very useful for what is our primary role in terms of biodefense for this. So my best wishes to all the people who are gathered here, and I'm sure the deliberations that will be held over the next couple of days will go a long way in providing the solutions the country needs. So thank you very much.
Thank you very much. I can assure you that you are extremely important, and biosecurity is very much a part of this One Health, and it cannot be understated. Thank you very much for your comments. And now I'll request Secretary National Disaster Management Authority, Shri Manish Bhardwaj, to make his brief comments. Manish.
Respected Professor Ajay Kumar Sood, Principal Scientific Advisor to the Government of India, esteemed dignitaries on the dais and off the dais, policymakers, guests, ladies and gentlemen. So, I'm thankful to the organizers for giving an opportunity to NDMA for making its statement on this platform where we feel as a whole of government approach and the way we can also contribute and has been contributing to the overall development and particularly for the One Health mission. So India's experience with the SARS COVID outbreak, the zoonotic diseases and alerts and climate linked biological risks have amply demonstrated that human, animal and environmental health factors are deeply interconnected. For NDMA, One Health is therefore both a public health priority as well as a resilience imperative, covering the three facets, particularly early detection, integrated preparedness, and coordinated action across sectors and various levels of government. During the SARS-CoV outbreak, NDMA's 24/7 control line, the National Control Room, served as an operational backbone for the states and ministries, helping coordinate movement, permissions, information on oxygen availability, and logistics support. We also provided the psychosocial and counseling and emotional support through our systems for affected individuals and families. So therefore, strengthening India's resilience, system resilience remains a priority. NDMA has an hospital safety guideline, which basically reinforce hospitals' ability to remain functional during epidemics and CVRN incidents by embedding triage, isolation, infection prevention and control, surge planning, evacuation decision making, etc. So therefore, it is a public health security function that protects communities, and it has been amply covered by the guidelines by NDMA on this fact. Similarly, sir, One Health also requires that animal health and environmental safeguards be fully integrated into disaster planning. The National Disaster Management Guidelines, they include a chapter on safe disposal of animal carcasses and environmental safeguards. NDM is also working on animal inclusive DRR, basically for livestock evacuation, emergency fodder, vaccination drives, and restoration of value chains, and to mainstream them into the district and state disaster management plans. NDMA also mainstreams the mental health and psychosocial support into biological disaster readiness through psychological first aid, district level psychological teams, psychosocial teams, and community centered communication so as to cater to the anxiety, the stigma, the social disruption that must be also addressed with some empathy and scientific clarity. NDMA issued guidelines on disaster mental health and psychosocial support in 2023, which was revised 2023, which placed special emphasis on vulnerable populations, human dignity, and rights-based response. Therefore, sir, NDMA's contribution would like to contribute to One Health in strengthening the governance architecture, coordination discipline, and to operationalize the cohesion needed for human, animal, and environmental systems to function seamlessly. I thank the organizers for giving an opportunity to
Thank
present
you.
our case. Thank you, sir.
Thank you. And last but not the least, I have the pleasure of requesting Madam Punya Srivastava ji, Secretary Health and Family Welfare, to uh, give her closing remarks as well as address our young folks whom I see they are here. So how are they connected to this One Health? In few minutes, आप बताइए कि what is your impression and how do you want to see it?
So, respected Principal Secretary Advisor, Secretary DHR, all my colleagues, secretaries here, respected scientists, experts, officials from state and local governments, and dear students. So, at the outset, I would just like to quote the Prime Minister, who has been time and again saying that we need a very holistic and integrated approach to the well-being of humans, animals, plants, and environment. He's also been saying that it is rooted in the India's ancient philosophy of universal well-being. So our healths are very interconnected, and being the secretary of the Human Health Department, I would like to say that actually health, as has often been said, is at the receiving end. It's the cause. I mean, humans do cause diseases, but they're also at the receiving end. In the last 1 year that I've spent in the health department, I have made often very frantic calls to Secretary Department of Health Research. And to the students, I would like to say this, that whenever anybody falls ill, in your school, at home, in your family, in your village, your town, your city, if you if you dive deeper into it, you will find that the cause lies somewhere, and it is this cause which lies there which has forced us to come up or encouraged us to come up with the One Health approach. Now, what does One Health approach mean? In practical terms, it could mean that when there is an outbreak, the National Joint Outbreak Response Team that everyone speaks about goes there. Students, when you will do an enterprise search or a Google search, you will find that there are a lot of incidents which occur for which it is very difficult to find an immediate cause. We had people dying in one part of the country, Rajouri, Jammu. We had mysterious hair fall incidents in one part of the country in Maharashtra, Buldhana district. We have brain fever cases occurring in any another part of the country in Kerala. Why are these incidents occurring? At some place, it may be connected to the food we are eating. It could be connected to the pesticides that we are consuming. It could be related to the way the sewage is being disposed into the village water ponds and other water bodies. So human health is very related. Why did COVID occur? A lot of research has gone into what caused the pandemic to occur. It was the bats, no, Dr. Behel. So it came from wildlife, or it came from research occurring on wildlife. When you look at all these factors, you realize that we are not isolated. We are deeply interconnected with each other, whether it be the animals, whether it be the plants, or whether it be the environment. And this is the reason where across the globe we are talking about one earth, one health now. And my big thanks to the principal scientific advisor for getting all of us 13 ministries, departments, and the number keeps on increasing on one platform. And the great thing which I think the principal scientific advisor's office has done is that he has said that all of us need not work on our own One Health units. If we just collaborate, we can together handle the task which is there before us. I would also like to bring to your knowledge, I'm sure you've heard about it, but the government, after or rather during the course of the pandemic, pooled its resources and launched the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. It is under this mission that the National Institute of One Health is being set up. And the reason we looked at this very comprehensive mission was that if you want to strengthen healthcare in the country, and if you want to be prepared for pandemics, if you want to be prepared for outbreaks, you need to strengthen the public health infrastructure, you need to enhance the surveillance and outbreak response. And it is not just outbreak response to human health crisis, it is the outbreak response to whether you have animals dying in a zoo, whether you have avian influenza. My colleague here in environment mentioned the avian influenza arising due to which could be arising due to migratory birds. It could be due to diseases which are affecting our livestock. So that's why we need enhanced surveillance and outbreak response. And my colleagues here from the NCDC, I'm sure they will be talking about how the integrated disease surveillance program has been expanded through the IHIP to ensure that we monitor all kinds of disease conditions and outbreaks. The third component of the PM Abhim is the pandemic and emergency preparedness. And many of the work elements that are contained in PM Abhim have already been described by Secretary DHR in his presentation. The biosecurity aspect has been emphasized by both Chairman DRDO as well as my colleague from the NDMA. The pandemic research is something that all of us, many of us are jointly doing over here. So the country is working on trying to integrate the One Health approach and each and every aspect of healthcare service delivery. And in the research that we are doing, we are also leveraging technology a lot for the purpose. Secretary Department of Agriculture Research spoke of the antimicrobial resistance a challenge that the country is facing. As you are aware, since yesterday we are celebrating 1 week of antimicrobial resistance initiatives. Yesterday, India launched the National Action Plan for Antimicrobial Resistance. And I know it's a big ask, but I'll request the students who are here that please do go and look at what does antimicrobial resistance mean. It means that each and every pill that we are taking, each and every medicine that we are taking to tackle a disease will not work tomorrow. because now we are resistant to that particular drug. So the issue is serious. The issue is what we are facing in our day-to-day lives. And therefore, my request to the students here are to acclimatize themselves with this concept, to understand this concept, to imbibe it, because they are our future. Tomorrow, regardless of the job you go for, whether you are a doctor, whether you are a biologist, whether you are a municipal official, if you are aware of the One Health approach, I'm sure you can contribute to a healthier country. And my big thanks to all the people who have taken out time to attend this conference, because your findings, your awareness, your inputs will make the job much easier for my department. Thank you.
Thank you very much for this insightful comments. You will all agree that we had very insightful comments from all the participants, all the panelists on the dais, and it must have given a lot of food for thought. So I have great pleasure in thanking each one of the panelists for their very unique contributions, and thanks to all of you who are in the audience for your patient listening. So I close this panel discussion and thank you very much, and all the very best.
Ladies and gentlemen, I believe that there would be no exaggeration to say that it feels like a moment of pride to witness the exemplary contributions and the ambitious endeavors and the zeal of the distinguished departments that have been shared through this session. And I think it is our responsibility to do give them a resounding round of applause, to wish more power to them. Thank you very much. So, as they say, diseases know no bounds. And after traversing through the states, ladies and gentlemen, time now for us to incorporate and reflect upon the global scenario. We shall right away be moving into the session. Just allow us a few minutes to get the days decked up. Yet another noted panel to take forth the deliberations and to reflect upon the global insights and wisdom.
One person from Sefi, she has sent a message. Somebody who's come from Sefi. So in place of Jane Halton, somebody has come. Maybe they will be on dais. Yes, actually, दो table remove करो. Okay. वो जो person is joining on this. What's the name? Mandeep Digra from Sefi. Then FAO says Scott Newman has come, it seems. So she wants that. You want Scott Newman also to sit on stage? Why?
We don't have this virtual messaging from them. Is it? I tried this off. Let me just confirm that. Okay. Sandeep President from Settings. He's the director and head R&D programs. जब मैं ते कहाँ उसको भी बुला के आगे बिठाओ हाँ नहीं डोंट वरी डोंट वरी ओनली director as head director and head R&D programs for SEPI R&D programs. So you will just confirm I'm not taking this name, right? If this also would be coming. No, ये इनका इनका रिकॉर्ड आएगा ना क्या है एक मिनट में पूछता हूँ जैन हॉल्टन का कुछ एक मिनट हाँ हाँ please go I've just made Dr. Paul said wait we're just ready to announce that not to leave the hall it's not a break.
And may we request you all to kindly give us a few more minutes. And please do not go away. Please take your seats. We are ready to bring to you yet another very enriching session that shall be steered by yet another exalted and learned panel to be chaired by Professor V.K. Paul, an eminent persona amplifying. And ladies and gentlemen, we already have amidst us, and may I request you to once again welcome this personification of exemplary erudite acumen. A very warm welcome once again, sir. Yes, sir, we are being joined by the other esteemed panel members and requesting the eminent panelists to please grace the dais. Please welcome, ladies and gentlemen, Dr. Rosa Perrin, the Strategic Advisor, One Health Initiative, WHO. Dr. Jem Mete, the Regional Practice Director, South Asia, World Bank. Please join me in welcoming, sir. And also extending a warm welcome to Dr. Mandeep Dhingra, the Director and Head R&D Programs at CEPI. This session shall also have some messages from Dr. Tedros Ghebreyesus, the Director General WHO, Dr. Aliu Dohong, the Regional Representative Asia Pacific FAO, so with that, may I please request you, sir, to take forth the session proceedings. Professor V.K. Paul, the esteemed chair for the session.
Good afternoon. We are gathered here in this session in the presence of our very esteemed partners, and we are here to learn about One Health movement initiatives in the world.
Joining us.
He's doctor.
Ladies and gentlemen, we are delighted that while we do have Dr. Aliu from FAO joining us over a virtual message, we are more than delighted to be welcoming Dr. John Newman from FAO, who is amidst us. And if we could have the pleasure of having him on the dais along with the distinguished members, a very warm welcome, sir.
Distinguished colleagues on the dais and friends, I was starting with the submission that we are here amongst our very esteemed partners, our multilateral organizations, who are here to support our endeavor on One Health in the country. We would like to hear from them what is, which is the way the global community is taking the notion of One Health mission and pandemic prevention and response in other countries. What are your guidance, documents, SOPs, initiatives that you may like to share? And we will then have our own reflection for all of us to consider how to embrace that and how to build strong international partnership for the National One Health Mission in our nation. I'm very pleased to start with the video message of Dr. Tedros Adhanom, the DG of WHO, and I think this can be now played, I guess. Very, very thankful to the DG
Excellencies,
WHO. Yes, sir.
distinguished guests, dear colleagues and friends, Namaste. I thank His Excellency Prime Minister Modi and the Government of India for their leadership and commitment to One Health. The health of humans, animals, and our environment are inseparable. An estimated 70% of emerging infectious diseases in humans originate in animals, from Mpox to Ebola and possibly COVID-19. That's why the WHO Pandemic Agreement, adopted at this year's World Health Assembly, recognized One Health as a foundational principle of pandemic prevention, preparedness, and response. A One Health approach is essential, not only for zoonotic diseases, but also to address climate-related illness, food safety, antimicrobial resistance, non-communicable diseases, and many other preventable health risks. We must break down the silos between sectors to better understand and address the health of people, animals, plants, and our shared environments as one coherent system. WHO is committed to working with the Food and Agriculture Organization of the United Nations, the World Organization for Animal Health, and the United Nations Environment Programme in the quadripartite. As WHO assumes the chairmanship of the quadripartite in 2026, we will work to strengthen the global commitment to fostering collaboration and partnership on One Health. Together, we can create a future where the health of people, animals, plants, the environment, and the planet thrive in harmony. I thank you.
Thank you, Dr. Tedros. Thank you, World Health Organization. We now have a message. Are you going to build on this? Yes, indeed. So I invite Rosa, please, to kindly take the message of the DG forward on behalf of the World Health Organization.
You. Thank you very much. Namaste. First of all, thank you, the organization, the government of India, for inviting WHO to this important event. And following Dr. Tedros' inspiring message on the importance of One Health, I would like to take a few moments to share how our WHO is actively advancing the One Health approach through our ongoing initiatives and collaborations. So to start, why One Health matters more than ever. The World Health Organization since 1946 has aimed for the highest possible level of health and well-being for all people. And this remains our guiding vision, but achieving it has become increasingly complex. That's why the One Health approach is the way to solve the high complex global challenge of our time. The One Health approach gives us this integrated, sustainable and equitable collaboration across sectors that we need to solve these complex and health threats. And there is a kind of urgent implementation of this One Health approach. We have seen recent health emergencies that have underscored this urgency. COVID-19, Ebola, the re-emerging of other zoonotic and vector-borne disease. But also we are facing this triple planetary crisis with climate change, pollution, and biodiversity loss. And we have a rising of non-communicable disease, threats of food to food safety and security, malnutrition, and as has been mentioned, antimicrobial resistance is also increasing. So in this context, One Health is not just a strategy, but is a necessity for building resilient, inclusive, and future-ready health systems. And that's why WHO is very much committed to the implementation of the One Health approach. But this is not only something that WHO wants to do, it's something that has been requested by the member states. And you can see here that there has been many resolutions in the World Health Assembly in the last years where the member states have requested WHO to contribute and to work on a One Health approach. You have here the one resolution in 2021, strengthening preparedness and response to health emergencies, or the one in 2023 to reduce the impact of chemicals, waste, and pollution on human health. And I think that one has been mentioned also today, and Dr. Tedros has emphasized this, is the adoption in May this year of the WHO pandemic agreement. This has been a milestone in health law, and it's very important that within the pandemic treaty, the Article 5 is all dedicated to One Health and is one of the pillars of this treaty. So having said that, I want also to guide you a little bit on what WHO is specifically doing within WHO, but also with our external partners. To highlight and to this commitment on One Health, in WHO in 2022, we created the so-called One Health initiative. That is a small team that is guiding within WHO and with external partners the policies on WHO on One Health. We have three main pillars of activities. The first one is building and strengthening partnership and collaboration within WHO, but also beyond UN organizations. And I will speak in the next slides about this quadripartite collaboration on One Health that has also been mentioned this morning. A second important pillar of our activities is enhancing this One Health political advocacy and scientific leadership. And with this, I want to emphasize the work that has been done with, for example, the G20, when India was the chairing. The share of the G20 was a lot of work on One Health, and in our scientific leadership, the work that has been done by the One Health high-level panel of that is guiding the quadripartite on scientific issues related to One Health. But we are also working on implementation, because One Health is not only words, but is what really is needed at national level. And in this context, we have developed the One Health Joint Plan of Action that we'll also take you through in the next slides. So as I mentioned, and also following the words of Dr. Tedros, One Health is crucial, not only for zoonotic diseases or for pandemic prevention, preparedness, and response, but One Health is key to address all increasing complex health challenges of our time. That's why WHO is implementing One Health approach beyond pandemic prevention, preparedness, and response of zoonosis. We are also having strong programs on One Health in other areas like neglected tropical diseases, food safety, antimicrobial resistance, and more especially also on environment, climate change, and health. And we are working together with our regional and country offices. So this is something that is not done only at central level in Geneva, in Switzerland, but we are doing across the world through our regional and country offices. And as said, One Health is something that we need to work with other partners. That's why since many years we are working very much close with our partners, other UN organizations like the FAO, the Food Agricultural Office, the UN Environmental Program, and the Animal Health Organization in the collaboration that we call the quadripartite cooperation. And we launched in 2022 the so-called One Health quadripartite joint plan of action, in which we have defined six action tracks in which coordinated programs are being put in place, and we are working together across these programs. But we are not working only with UN organizations. We are enhancing our collaboration with member states, with other intergovernmental organizations, with Codex Alimentarius, for example, but also other international organizations like academia, OECD, and many development banks. Dr. Tedros has also mentioned that in 2026, WHO will host the chairmanship of the quadripartite, and in this we are very much committed to advance globally in the World Health Agenda. And some last remarks, conclusions, or maybe key messages that I would like that you go home with these key messages. One Health is essential for tackling today's global health threats, pandemics, but also beyond pandemics, climate change, food safety, antimicrobial resistance, non-communicable disease, etc. Pandemic preventions start at the source. It is also mentioned today that more than 70% of emerging diseases are zoonotic. That's why early detection and containment at the animal, plant, environment, and human interface is critical. And I think that this morning was also said that communities are central. Pandemics start and end with people. That's why empowering frontline workers and engaging local populations is key. And an important message that I think that we must all go home with is that collaboration is not negotiable. Is an imperative if we want to solve health threats, make One Health a reality. We need to break silos to foster these multidisciplinary partnerships and collaboration. And urgent action is needed. There is no time to waste. We need sustainable political commitment, financing, and integrated governance that will ensure resilience and equity in future health threats and emergencies. Thank you very much.
Thank you, Dr. Rosa. Thank you indeed, and thank you, WHO. I am very honored to now invite our team to play a video message from Dr. Alu Dohan, Regional Representative for Asia Pacific, FAO. On behalf of FAO, can we have the video, please? Thank you.
Your Excellency Prime Minister of India, Mr. Narendra Modi, honorable representatives of the Government of India, distinguished One Health expert, partners, and ladies and gentlemen. It is an honor to address you at the National One Health Conclave 2025. I thank the Government of India and the National One Health Mission for convening this important gathering and for your leadership in advancing the One Health agenda, both nationally and globally. We meet at a time of profound transformation. Asia is home to nearly 60% of the global world population. And by 2050, the global population will approach 10 billion. This demographic shift brings opportunities, but also major challenges for agri-food systems, the environment, and public health. Ensuring food and nutrition security for all will require agri-food systems that are sustainable, resilient, and capable of supporting growing population while protecting natural resources. India's updated nationally biodiversity strategy and action plan and visa launched at CBD COP16 is a strong commitment to halting and reversing biodiversity loss by 2030 and achieving harmony with nature by 2050. It's a whole of government and whole of society approach aligned with the Kunming-Montreal Global Biodiversity Framework, sets a clear target for restoration, species recovery, and community-led conservation. The One Health approach is essential to achieving these goals. It requires close collaboration among public, health, animal health, environment, and wildlife sectors. Yet, too often, environmental and wildlife expertise has not been fully integrated. To prevent future pandemics and to transform agri-food system effectively, these sectors must be fully engaged in One Health planning and implementation. India's Pandemic Fund project, launched in 2024, is an important example of this integration. By strengthening animal health systems, improving surveillance at the livestock-wildlife-human interface, and incorporating environmental monitoring, India is demonstrating a model of comprehensive pandemic preparedness. The collaboration among key national institutions and international partners, including the World Bank, Asian Development Bank, FAO, illustrate the type of partnership that One Health requires. We also recognize that biodiversity conservation and One Health are mutually reinforcing. Land use planning to prevent encroachment, buffer zone to reduce human-wildlife conflict, and wildlife health monitoring are measures that support both biodiversity objective and One Health outcomes. These interventions strengthen the resilience of agri-food system while reducing diseases risk, protecting forests, conserving ecosystem, and ensuring proper land use management are therefore not only environmental priorities, they are fundamental to preventing genetic spillover, safeguarding food security, and building resilience to climate shocks. Ladies and gentlemen, sustainable agri-food systems must deliver safe, nutritious food while maintaining ecosystems on which agriculture depends. Climate smart and biosecure practices in agriculture and livestock will reduce emission, minimize disease risks, and ensure long-term productivity. These are win-win solutions for climate, biodiversity, health, and rural livelihood. FAO remains committed to supporting countries in this transformation. We are working with partners to align national biodiversity strategies and One Health frameworks, identify shared priorities, and develop investment cases that balance production needs with sustainability and health outcomes. Tools such as livestock sector investment and policy toolkit, the One Health assessment tool and the global livestock environmental assessment models are available to support evidence-based decision making. We also continue to build technical capacity through initiatives such as the in-service field training program for wildlife, environment, biodiversity, and ecosystem professional FTVWEBE, enabling them to contribute fully to One Health initiatives alongside animal and public health experts. But tools and strategies alone are not enough. Strong partnerships are essential. This conclave offers a valuable opportunity to strengthen collaboration, harmonize approaches, and build the cross-sectoral leadership that One Health requires. Let us commit to bridge gaps between the agri-foods, health and environment, and wildlife sectors. Let us ensure that environmental and biodiversity perspectives are central in One Health decision making. And let us work together to build agri-food system that are sustainable, resilient, and capable of delivering safe and nutritious food for all, now and for generations to come. I wish you successful and productive conclave. May our collective efforts here inspire action and partnership that advance healthier, more food secure, and sustainable future. Thank you.
Thank you, Dr. Dohang. Thank you indeed. We have the presence of Dr. Scott Newman, representing FAO. Would you like to build on the message of the Honorable Speaker? Over to you, sir, briefly.
Thank you very much. And first, I would like to thank the organizers for inviting FAO to be part of this very important landmark event. I think that just to complement a few small points here, FAO's vision for One Health is the application of One Health in agri-food systems. We recognize this region, broadly speaking, is home to roughly 60% of the global population. We need to be able to provide food and nutrition security for many people now, as well as the projected population dynamics in the near future. From our perspective, how we do that is very important. We need to make a transition, really looking at how to transform food systems to be more sustainable, to be more climate smart, to provide us with safe and nutritious food. And where is all this food coming from? It's coming from the environment that we grow it in. And so when we look at and think about environmental contaminants, when we think about diseases in the environment, if they're out there and we're producing our food, and that's where our food is coming from, as it moves through the system, we will be next to receive those downstream elements. So really important for us to really focus on how to make One Health more inclusive of the wildlife and environment professionals. They have largely been sort of the less or lower input segments and sectors. And so as we go forward, we really look at, particularly here in India, with your great leadership in One Health, with today's event and the establishment of this sort of infrastructure that will carry forward, this is really a very special moment. Last thing is just to say that our regional quadripartite program is having our regional event next week in Thailand, where 4 participants from each government in our regions, in the countries in our region, have been invited. So we ourselves also recognize the very importance of having public health, animal health, wildlife and environment sectors collaborating, and we'll deliberate on how to roll out or implement One Health at country level in the following week. So we really appreciate this opportunity to contribute. Thank you very much.
Thank you, Dr. Newman. I have the honor to now invite Dr. Sam Mette. He represents the World Bank. He's a Regional Practice Director, South Asia. Over to you, sir.
Thank you. Oh my, the picture is younger than I am. I need to Look, it's a real pleasure to be here. I'm going to talk about how we at the World Bank are approaching this topic and give you some ideas about the things we are doing in India that are relevant. When it comes to the strategic approach, it is consistent with what you heard from a number of speakers before. That is, the bank is trying to move away from reactive responses, and instead we are trying to go for prevention and preparedness, which is pretty much a no-brainer, one would think, right? And we adopted an operational framework on how to do this in 2018, as well as issued a flagship report putting pandemics behind us, which advocates for sustained investments in One Health. Now, when it comes to the economic rationale for this, which we often look at, COVID-19 is estimated to have cost the global economy over $13 trillion, and prevention costs that are required are estimated to be about 1% of this cost. In these kind of estimations, they are rough estimates, right? But frankly, in this case, it's so obvious, you don't need to fine tune too much. The case for on the economic side, it's clear. Except there are kind of two complications. One is once a crisis is over, people and the governments tend to forget about it very, very quickly. So during the crisis, it's all you think about. Right afterwards, we have a very difficult time actually having action on certain obvious topics. And so in this case, it's so important that countries lead this effort, governments care about it during non-urgent times, and thus the importance of events like this. The second complication is the global public good aspect of this agenda. So it's not enough if some countries move on this and others don't. And it's also, one could argue, it's not fair to expect the poorest countries to bear all the costs of this actually global agenda, right? So you are only as strong as the weakest link, and that's kind of coordination and collaboration structure matters. We have four key pillars that we organize our work in this. One is prevention at source. Second is strengthening systems. Third, financing at scale. And the fourth one is cross-sectoral collaboration. I'm going to say a bit more the last two topics. So financing at scale. One of the things we are doing is we have, our regular lending operations in many sectors, and actually some of those lending operations touch on this topic. So it's important for us to make meaningful contributions within that agenda. And then I mentioned this global public good aspect. So in recognition of that, the World Bank hosts the Pandemic Fund, which provides grants to countries to help tackle some of the challenges. There, what we are trying to do is maximize the impact of those grants, right? By raising additional sources, some of that might be non-concessional. So right now, until now, this pandemic fund achieves a 7 times multiplier, which is not too bad. But leveraging funding is the key to this whole thing. And when it comes to the fourth item, the cross-sectoral collaboration, it's tough. It's tough within our institution, which we are trying to tackle. It's even tougher on the government side. I noticed that here, for example, for this event, 15 ministries and departments were invited. So you can imagine the scale of this thing. And this, again, this is another reason why such events are so important. It doesn't guarantee success, but it's a mandatory condition for it. Examples of implementation from India, I'll be very brief here. One operation that we have is $500 million Transforming Public Health Systems for Pandemic Preparedness Program. It among other things, it supports establishing India's first center for One Health research at Nagpur, which will play the coordination role for the One Health mission. We are also active in states through operations, for example, in Gujarat and Kerala, strengthening antimicrobial resistance. To wrap up, in closing, let me highlight again the key challenges that we see: fragmented governance, siloed funding systems, and limited capacity. We are pleased to note India's efforts to address these challenges through the One Health mission led by the Principal Scientific Advisor. And we stand ready to continue supporting these efforts through our lending and work in national and state levels. Thank you.
Thank you indeed. Thank you. We now would have a video message from Professor Jane Halton, Chair of CEPI. CEPI is Coalition for Epidemic Preparedness Innovations. A video message to be followed by comments by Dr. Mandeep Dhingra, representing CEPI on the dais. Thank you.
Excellencies, distinguished guests, valued partners, colleagues and friends. It's a privilege to be able to join you briefly at the commencement of this conclave, and I'm deeply sorry that I cannot be there in person. This is a really important discussion, and it's happening in a country that is fundamental
Recording
to
in
global
progress.
health security. I'd like to acknowledge the great work of the government, scientists and commercial partners in India for the contribution they make to One Health, to global health security and to pandemic and epidemic preparedness. I think as we look around us today, the world is increasingly unstable. That can make us all feel a little nervous, a little unsettled. But it can also present opportunity, particularly for those who are prepared to be bold, to be courageous, to step forward and to step up. And in the world of vaccines, epidemic and pandemic preparedness, that is precisely what we need. And CEPI's mission is, I would argue, a bold one. It's to ensure that we have the vaccines, that we do the development, that we can respond equitably to epidemics and patterns which may have pandemic potential, in order that we can get access to those vaccines equitably whenever and wherever they are needed. India is fundamental to that mission. India, of course, produces 60% of the world's vaccines. Your contribution during the COVID-19 pandemic was, of course, exceptional. 7 licensed vaccines. You administered 2.2 billion doses of vaccine. And of course, as we look forward, that role, I believe, will only increase. And particularly when it comes to the CEPI 100-day mission. Our mission, our driving force, is to ensure that within 100 days of an outbreak of something that we believe has epidemic and pandemic potential, we do not have a vaccine, that we actually can develop such a vaccine. It's bold, it's a challenge, but we believe it can be achieved. And that means, of course, doing a lot of work about preparing before any such outbreak. And we are doing exactly that at the moment, working with the Serum Institute to prepare an investigational stockpile of vaccine, working with Oxford. And this is in relation to an outbreak of Rift Valley in West Africa affecting people and livestock literally as we get together today. So it's worth reminding ourselves that preparedness is not a development problem. It's not a welfare issue. It's not just an issue of low to middle income countries. It's an issue of security. It's an issue of mutual self-protection, and it is an opportunity for us all around the world to work together. We need to protect everybody. And so as we go forward, I look forward to working with you on CEPI's 100-day mission. Together, we can be bold and we can take steps to deliver this message to deliver the mission and to protect people around the world. I wish you all the best for the conclave.
Thank you. Dr. Dhingra, would you like to add?
Just briefly, good afternoon, and thank you to the organizers for inviting SEPI, and thank you to Professor Paul for the wonderful work that he's leading. As Professor Jain said, 100 Days Mission is at the heart of SEPI, and that is where it ties to the work that is being done in India. But I'd like to highlight two areas, which is capitalizing on the manufacturing capabilities that India has built and showcased during the COVID pandemic, and leveraging that, and India as not just a regional leader but also a global leader. And that is where the role of R&D in SEPI comes in, where we're trying to establish platforms and make them as rapid response platforms across the world. But lastly, but not the least, is from a perspective of preparation and being prepared, is the work that's being done on disease X. Being able to anticipate what could become a pandemic of the future, and the role of artificial intelligence, computational biology that is being done in that. So that's the work that R&D at SEPI, by bringing together partners, is trying to facilitate, and is able to link that into the country specific plans that are happening. And hopefully, as Professor Jain said, it's not just a matter of survival of one country, but it's a matter of global health security. That is the force behind the R&D at SEPI. Thank you.
Well, as we move to the conclusion of this very important session, let me first thank WHO. A big hand to WHO, please. Thank you, Dr. Tedros. Thank you, ma'am. Thank you for being here. A big hand to FAO for being here, the World Bank, and SEPI. Thank you very much for your inputs, your participation, and having brought the messages from your leadership. Thank you. As we heard since this morning repeatedly, the pathogens do not respect the lines on the map. In fact, the pathogens don't read the maps. Outbreaks in any part of the world are technically and truly, potentially, a threat to every other part. And as you have heard from DGWHO repeatedly, he would say, pandemic is not over if it is not over everywhere else. So it shows that we are one community, we are one earth, we have one health, and truly we have one future. In this regard, I would like to offer 3 suggestions for international collaboration. You heard this indeed from our colleagues colleagues present here. Firstly, there's an urgent need for us to share surveillance data for timely, preemptive, proactive, and comprehensive response. We prepare for war during peacetime, and today perhaps is peacetime. So we must learn to share surveillance data in a timely manner and be ready to respond. We don't know when the threat would come. We surely know it will come. So it should happen between the nations, within the multilateral system. It needs to happen across sectors, animal kingdom, food, agriculture, environment, wildlife, and human. So the comprehensive, one health driven sharing of information. Of course, let's make sure that the data safeguards across institutions and countries are taken care of so that they don't fall in the wrong hands and they're not misused. So my first request for international community is to create a system where safely data is shared. It's being done even now, but I think we need to have a formal regime in this regard. Second, we have capacity for surveillance more in some geographies, less in others. Even within our own nation, we're still building the future, fully loaded, future ready, Viksit Bharat level of surveillance system. This is work in progress. And you've seen the progress that has been made in the exhibition as well as from the previous speakers. But then the world needs a lot more of infrastructure. So we must put together our resources, because surveillance system across the world would be needed for every other part of the world. So we need to build more. What we have, we share. We share. And we work together through shared SOPs. But we need to build a lot more of surveillance system, manifold, developing a network of labs, again across the One Health spectrum, building interdisciplinary teams, and then creating local and national capacity and to creating also a convening to be able to work together. So creating more infrastructure is a need of the hour. We will do our part, but I think we together owe it to the rest of the world to do it across the world. Third, a huge request for resource mobilization, guidance, technical support for India and for other nations in the space of research and development. A few suggestions. We need to build capacity for pandemic prediction, tracking, and modeling. We have some, but we need to build so much more. We are doing our part. We will do more. We are happy to share, but we need to be able to forecast the trend of outbreaks, which look to begin with very benign and then they take a different shape. We need R&D support for epidemiology, biology, genomics, and indeed R&D support for countermeasures. We need to do it together. CEPI, you have taken initiative, but others also have a role. We need vaccines for animals as well. We need diagnostics. We need new therapies. And we need the use of the frontier technologies to be able to do so. We can only do it together. We can do it together and we must keep in mind. So R&D support across basic sciences, epidemiological sciences, and then for countermeasures. And for this, I suggest that we create research networks, network of networks, and that should be a shared responsibility of all of us, including global community. So these are my three requests to the international community. What does India offer? What do we offer to the global community? Firstly, we offer to you the model of One Health mission at the national and hopefully then sub-national level that we are unfolding. So here is the model that you may like to spread the good word about. You may like to see its adaptation in other geographies and other countries, and we'll be happy to extend our support. In the bargain, of course, we will also learn to do it better, and our team of very esteemed secretaries would be very happy to work in that. So we have a model, bottom-up model which is shaped on the Prime Minister's vision of community participation, that is Jan Andolan, and it is technically robust and it is multisectoral, it is federal, it's not union government alone, it's also the state and the district authority. So that's the first offering we have. Second, we have offering for digital solutions. I think we have a unique strength in offering digital solutions. We have IHIP, it's famous, it's a legend. We had COVID and equivalent, and we have digital portals in the Indian Council of Medical Research System, the DBT, and so on. So a lot of digital tools are available. Happy to share with you in a systematic manner. We also have telemedicine solutions, which will be required for us to make a difference. So telehealth, One Health solutions are also available that we are happy to offer. Third, and perhaps the most important, we are the pharmacy of the world. We are the hub for vaccine development. We are the potential hub for diagnostics. And as we are moving from strength to strength, we offer to build on this and to be able to work with the global community for novel countermeasures developed rapidly with your help. India has a vision for 100-day mission. We are happy to, to, to help other nations to think through that paradigm, but we also need your help for our 100-day mission to be successful, because you have technologies and we look forward to make use of those technology and take the products to scale. That's our strength. Take them to the scale is our strength. So we offer the capabilities of quality, affordable vaccine, therapeutics, diagnostics, and other medical products for India and for the world. So 3 requests and 3 offerings is what we bring to this discussion today. I'm very happy to be a part of this. And let's remember that in this game, we are one earth, one health, and one future. Thank you very much.
May we request all the exalted panel members, the esteemed chair, and the eminent speakers to kindly give us a photo up here. If you could kindly step forward. And ladies and gentlemen, a lot of food for thought laid on our platter. The learned panel has shown us, has carved a way for us to now walk on with their exemplary experience, insights, and wisdom. And I hope our sincere sense of gratitude does reach out to them with some rousing round of applause. Thank you very much. Thanking all the distinguished speakers for their valuable time and insights. Well, after a lot of food for thought on the platter, definitely time now to satiate the taste buds. Well, we welcome all the invited dignitaries from overseas and the speakers to now kindly proceed to the Leaders Lounge, which is at level 2. And if I may request all our other very esteemed guests and participants, if you could please join us at the multi-purpose hall that awaits to serve you. Also, to draw your attention, if post lunch you're able to find time, the west counter at the level 3 has some registration kits that await you. Only post lunch, if I may request you. Level 3, the west counter, has some registration kits awaiting the participants who've already got registered. So if you could please march your way to level 3 to collect your kits. With that, thanking you all and requesting you all to kindly be back here on time so that we bring to you our upcoming sessions of deliberation. Thank you very much for your gracious presence and participation throughout.
Recording stopped.
I just want to ask, how do you prepare for it? Your phrases and everyone just hit the ears.
Thank you. Firstly, thank you so much. This is very kind of you. Thank you.
At DHR summit, last year DHR summit.
Okay. So, I am in such a tough spot because I've done so many events for ICMR back to back. But the problem is, how do you make the audience feel fresh and new to what you have to render? So, you all put me in a very tough spot, I must tell you.
No, ma'am, I'm a professional MC. I do it mostly for government events. My name is Dr. Meenal, and I'm a PhD in management, and this is my passion. Oh, wow.
Good deal you are.
My honor. You all are from ICMR. Yes.
ICMR.
Okay, okay, wonderful.
Check, sound check.
आप जरा
Ma'am, can you hear us? Hello, mic check. Mic check.
Good afternoon. I am struggling to hear you.
We can hear you.
Recording in progress.
Can you please switch on your video?
Okay, I can now hear you.
Can you please switch on your video?
Okay, one moment, please.
We can hear you.
My video is disabled by the host.
आप उनको बोलना तो पहले स्लाइड शो बोर्ड में करेंगे
All right, ladies and gentlemen. So this time I'm not going to ask you how the lunch was because you all are appearing so fresh and energized that I'll just say I'm so happy to be welcoming you all once again. Thank you so much for making it on time and requesting you all to now please take your seats. A few minutes from now, and we unfurl the next session for you all. All right, ladies and gentlemen, requesting you all to please take your seats. It's aptly said that it is not technology that changes the world. Indeed, the people, the intellects behind it. And ladies and gentlemen, this session now intertwines the two. Technology for enhanced surveillance with some of the most learned and applauded plenary address speakers to unfurl this session for us now. So before I invite them on the dais, I request you all to please quickly take your seats. So ladies and gentlemen, amidst a very warm and welcoming round of applause from all of you, may I now take the honor of inviting Dr. Mangilal Jad, the Secretary, Department of Agricultural Research and Education, and the DG ICAR to please grace the dais. Ladies and gentlemen, you all just shared that the lunch was really good. All right, we'll also be joined by Dr. V. Narayanan, the Secretary, Department of Space, Chairman, ISRO, the Chairman, Space Commission, shortly. A very warm welcome, sir. And we are being virtually joined by Kat McCullicuddy, the head of Global One Health Security, UK Health Security Agency. A very warm virtual welcome to you. With these words, may I please first request you to kindly make your plenary address, sir? Sure, sir.
Thank you so much. Good afternoon, everyone. I hope you had very good food, which is making you healthy. So, the session is on enhanced disease surveillance using the technologies. And in that context, what ICR been contributing to the whole One Health mission for the surveillance, I'll share some of those aspects. It's a backbone of any public health program. We all know about it. And I think the issue is all the disease outbreaks cannot be predicted or prevented. But with the proper surveillance, I think we can do better. So from that perspective, is there someone putting the presentation? Okay. So from that perspective, the whole program is designed. Next, please. Do I have a control? Now, based on the ongoing collection, analysis, and the dissemination of the health data, this is whole the objective of the system is to receive timely alert for potential disease outbreaks and epidemics to enable rapid response and containment. So that's one objective of the surveillance. The second one is to guide effective interventions to optimize resource distribution and the information which is crucial for policy decisions. So those are the two broader purpose or the objective of the surveillance. Next, please. Now, when we talk about the technologies for the surveillance, I think we can see the clear impact, the technology-led impact And to cite some of the examples, we can see the faster outbreak detection and the response we have seen, the better prediction of the emerging zoonotic threats, the reduced livestock mortality and economic loss, and we have some real good examples of the surveillance. For example, the lumpy disease, there is a serious outbreak, but I think we were able to do better in that context. Strengthen the multisectoral coordination under the One Health. I think that's another example, and you can see this example here. And we can congratulate Dr. Bahal from that perspective for bringing all of us together. And the evidence-based policy formulation, I think what Professor Sood indicated in his concluding remark signifies on this particular aspect. So we can see the clear impact of the technology-led surveillance. And I think this is really helping all of us in doing our business better. Next, please. Now, in that context, there are digital innovations for the surveillance. And we have seen a lot of young minds bringing those innovations just outside the hall in this context. So there are tools for the mobile data collection, there are cloud platforms and the connectivity, and there are spatial risk mapping. So a sequence of the events, once we have the digital data collection, put them in the cloud, and then develop the spatial risk mapping. And there are examples around. So for example, AP Collect 5, the AP Info, IDSP, those are the examples of the mobile data collection we've been using, and the maps what we been generated. So on the GIS or on device GIS, whatever are there. Now, these are all important from the perspective because the disease containment is very, very complicated. So effort to prevent of to further spread it, I think so digital innovations can really help us in that perspective. Next, please. Now every one of us talk about AI in all fields. So artificial intelligence is also being used for the surveillance, for contact tracing, and there are some good examples which were used during the COVID-19 pandemic. Now, in that context, we need the analysis of the diverse data. And I think the AI can help us better in terms of analysis of the diverse data. And when we talk about One Health, I think we see the diversity when 16 departments and ministries are sitting together. The data is coming from different aspects. How to make use of the data, I think those tools can really help us. And then helping us in terms of predicting the outbreak. So we do that modeling in terms of predicting and enabling the accurate forecast using the predictive modeling. And then we use the automated contact tracing using that data. So the AI driven automated contact tracing significantly enhance the efficiency and effectiveness of the outbreak control efforts. So artificial intelligence, of course, medical science have used a lot AI and the big data analyticals. We always discuss about agriculture because agriculture is driven from a lot of intersectoral, multisectoral data because decision making is little complex. So we should be making better use, but I think artificial intelligence has a greater role to play in terms of the disease surveillance. Next, please. And then it comes to the big data or Internet of Things and the application of the geospatial tools. So the big data tools aggregates the information from the multiple sources, providing the real-time surveillance and the trend analysis. For example, the Google flu trends, the one example from that perspective, and also the in terms of the IoTs that utilizes the remote sensing or the sensors, variable monitors to transmit the health data from the field to or the patients. And there are examples on smart watches, sensor based collars, and all those things which can help us in better surveillance. And the third aspect is on the GIS, which enables us in terms of the spatial mapping. Next one, please. Now, the point of care testing and genomic and environmental surveillance is another aspect. So we truly need rapid portable diagnostic tools which facilitate early case detection and reporting. For example, the lateral flow assay, loop mediated isothermal amplification of the DNA, all those aspects can help. Now, the genomic sequencing of the pathogens from the clinical or environmental samples, which assist in the tracking of the transmission and the variant emergence. And there are examples, and there was a lot of discussion this morning on the wastewater surveillance. I think that's one example on that respect. During the COVID-19 pandemic, also the air samples based on the surveillance for the foot and mouth disease or any other respiratory diseases. So those are the examples how the genomic sequencing of the pathogens from the clinical or environmental perspective can be used. Next, please. Now, the another aspect that comes, and again, my colleague Dr. Narayanan is going to be there, the satellite and remote sensing, which is going to play a very, very important role in terms of the surveillance. And our PSA requested to launch a One Health satellite. And I think it's from that perspective because it's something very, very important. So the satellite data, whether the weather data or from the vegetation NDVIs and things like that, integrated into the early warning models for vector-borne diseases. So early warning, not only from the perspective of the agriculture or any other perspective, but I think there is a disease triangle which governs with the weather and the vegetation. For example, the Japanese encephalitis or the malaria, those are the examples which where satellite or the remote sensing can really help us. Also, the remote sensing allows the proactive risk assessment and guiding the timely interventions. So I think we have to make better use of the remote sensing or the geospatial technologies for the surveillance of the diseases. Next one. Now it comes to the disease surveillance platform. So it's integrative platform, the integrated disease surveillance program or integrated health information platform of NCDC, which is one example of the digital surveillance platform, which centralizes the laboratories and the clinical data, enabling the real-time monitoring and reporting. So it's very, very helpful from that perspective. Um, so ISDP is something very, very important. Also, the automated dashboard and e-health records facilitate in information decision making or informed decision making. That's another example. And for example, the unmold tablets, and there are many, many examples around which can be used using the digital surveillance platform. Next, please. Now, the integrated health information platform, which been using, which got 4 of different parameters or the aspect. or helping in terms of the joint monitoring mission of the IDSP, then disease prioritization and influenza strengthening. I mean, there are many aspects which were undertaken under this integrated health information platform by the team under the One Health mission. So these are some of the examples. Next, please. Now, there's another example which is on the National Digital Livestock Mission. I think this is something very important and exciting mission, having a complete digital ecosystem where you can see the connectivity between the human, the livestock, and the wildlife. And you can see the diagnostic laboratories and the frontline workers which are connected, the farmers and the other data sources. So bringing all those together, which can really help us in terms of better surveillance and monitoring of the disease outbreaks, especially for the livestock. Now, this was initiated under the guidance of the principal scientific advisor to Government of India. It's a joint venture of Department of Agriculture, Animal Husbandry and Dairy, and also NDDB. So this is truly helpful in terms of better disease surveillance and contributing to the One Health system. Next, please. Now, this is the structure of the NDLM presently. So you can see the traceability, so the database from the Bharat Pasudhan, and a mention was made by someone. Then the surveillance and the information communication technology, and you can see the traceability for the animals. For example, the ghee or the pasmina. And as of now, under the you can see the number of the livestock owners registered under this, the transactions happening, and the transactions per second happening. I think this is a record in terms of having the better surveillance using the digital tools under the Bharat Pasudhan program. Next, please. Now, structure of this NDLM, you can see the Bharat Pasudhan and the different ministries, departments, and how they are functioning. So I'm sorry, I can't read, so you can't also read. So this is helping both way. So I can skip this slide. Next, please. Now, livestock disease risk for warning through the artificial intelligence and machine learning based disease modeling. That's another one, and our colleagues sitting here from Nivedi have done a great job in developing this version 2 of the National Animal Disease Referral Expert System, which was also awarded, as I indicated in the morning session. And I think this is one unique example for the early warning system powered by the artificial intelligence, with set of capabilities needed to generate and disseminate the timely and meaningful warning systems. So that's another example which contributes significantly to the One Health mission. Next, please. Now, this is on the livestock disease for warning. So the different kind of data, whether includes the animal demographic data, the animal disease data, the extracted from the remote sensing sources, the different data, and also the meteorological data. And using that data, analyzing it, I think this is truly helping in terms of the risk for warning for the livestock diseases. So that's another example which is contributing to the larger One Health mission. So these are some of the examples how the Indian Council of Agriculture Research, the team in Animal Husbandry division, been working and contributing to the One Health mission. Now, final slide. There are some, next please, challenges. And I think the one of the challenge is lack of integrated databases across the sectors, which is a challenge all across. And I think under the One Health mission, if we can bring all the data together, harmonize the data, have the better interoperability of the data, can be very helpful in terms of making further progress. Also, there are limitations of the connectivity, the internet connectivity in the rural areas or the remote areas, because the livestock herders also based in the remote areas. So that's another challenge for all the digital or the technology enabled surveillance system. The another challenge is equity in the access. So there's a digital divide that may limit the comprehensive coverage. Somewhere we can have more coverage, somewhere we can have less coverage. So I think that's another challenge. The data privacy, I think we are dealing with the people. So the data privacy, cyber security, and ethical issues are another challenges which we have to address when we talk about the technology enabled surveillance of the diseases. I think we need more trained people, the human resources, more particularly from the emerging technologies, for example, artificial intelligence, machine learning, and the geospatial sciences, and the cost of the tools and the maintenance. But I think the way our young colleagues are innovating and making the new innovations, the cost is going to go down, and India got so many talented people, and we are sure that they will do a good job in terms of innovations to bring the cost down, and we will be making better use of the technologies. Next one, please. So finally, a few concluding remarks. I think the technology enhanced surveillance is a critical aspect of the modern One Health system. We have seen it, but I think we can do better. But I think it's something very, very important. Also, um, this strengthens the national preparedness, safeguards the livestock and human health, and provides climate resilient solutions for emerging threats of the diseases, especially the zoonotics. And the ongoing innovations and the capacity building and the collaboration between all the departments and the ministries is something very, very important for the future preparedness. And in that context, I think bringing all the 16 departments and ministries together under this One Health mission is one of the best examples what we can do to safeguard for our safeguard future. And in that context, let me again congratulate Professor Rajiv Bahal for bringing all of us together. So these are some of the thoughts and the work what the ICR colleagues been doing, and I just presented on their behalf. I'm not an animal scientist. I'm not a technology savvy person. I'm an agronomist, but I think the team is great, and we feel proud on their contributions to the mission, which is country's mission, and I think we are dedicated to contribute to the country's mission. Thank you so much.
Thank you very much, sir, for connecting the dots of possibilities using technology as a tool with your very insightful address. Thank you so much. And if may we please now connect to the head of Global One Health Security, UK Health Security Agency, Kat McCullochady, to please address the August House.
Apologies. It is always really lovely when you are speaking about the ability to enhance our lives with technology, and you fail with technology immediately. So I hope that you can all hear me okay. And my apologies for not being with you in person today. If it makes you feel better, it's 4 degrees Celsius in the UK right now, so not missing very much. Okay. So to begin my presentation, I would just like to address the Honourable Minister, the ministries, senior officials, colleagues. I thank you for the opportunity to speak with you today on the UK's lesson creating One Health through the assistance of technological advancement. As I have been so kindly introduced, my name is Kat McGillicuddy, Within the UK's Health Security Agency, I lead our Global One Health Security Unit. So within One Health, we are operating in an ever-increasing, multifaceted landscape, threats and vulnerabilities to the health of each individual's health. We recognise we must protect and enhance the health of each individual sector, and we collectively, not just singularly. But our principal operation is full of connected, complex, compounding, and cascading threats, which are exacerbated by geopolitical instability and conflict, increased economic, political, and climatic migration, climate change, land use and utility change, AI-enabled biological misuse, and then, of course, the shifting prioritization of health goals. But against that backdrop of complexity, we're also operating at a time of great possibilities. The One Health family across the world is more working together than ever before. And with the support provided and promised by our new technological capabilities, I know we are going to strengthen. So, 2023, the UK government has seen the opportunities by the innovation to understanding, preventing, and responding to human, animal, plants, and the environment through our UK biological security strategy. This strategy, which integrates across governments with One Health approach, aims to build resilience and biosecurity and surveillance, while also driving growth in life sciences and our biotechnology sectors. I'll spend the next couple of moments speaking on our focus areas under each pillar and finish with some lessons identified as we implement our biological security strategy. So pillar one, this pillar of the strategy is designed to strengthen our understanding on the biological risks we face now, as well as into the future. The ambition of UK and priority focus for this is that new tools are used to understand the biological risks of the UK and globally, to have a focus on enhancing our threat intelligence by significantly increasing the data we can use and the intelligence which results to capture our biological threats. One program is our biothreats radar, and this is a key step in strengthening the UK biosurveillance strategy and early warning system. The biothreats radar provides a near real-time integrated view of high-priority biosecurity threats worldwide. And here we combine open source intelligence and official One Health assessment across human, animals, and plant health to inform government decision-making and strengthen our early response. Another area of focus is our unified communication. Here we're enhancing public engagement with a view to develop a coordinated biological security communication campaign. The aim of this campaign is to ensure consistent messaging to the public and stakeholders on health threats, preparedness and response. And as you've mentioned already before, it is by engaging with all of our stakeholders in health that we can do a much better job. Our next pillar is that on preventing the biological risk. And here we are working to conceive activities that prevent biological risks from emerging where possible, and we recognise not always possible, or from posing a national threat or risking national interest. With this work, the UK is focusing on strengthening responsible innovation, shaping global norms, and addressing emerging biological risks, while ensuring that the UK remains one of our global leaders in life sciences and biotechnology. One example of activities under this pillar is the development of the Engineering Biology Responsible Innovation Advisory Panel. A huge mouthful even for me to say, but what this is an expert advisory group of leading academics and industry figures from across the UK, working in engineering, biology, life science, and biotech sectors. And it provides a two-way dialogue between the UK industry and academia and the government to support policy development and action for responsible innovation. We know that we are in an age of increasing innovation, but we have to do some of this very responsibly. Moving on to my favorite pillar, I am completely biased, but our favorite pillar is the characterize and protect threats. And this pillar is about the rapid detection of threats when they do occur, with the priority being on efficiency and ensuring threats are detected as early and as fast as possible. This capacity in the UK has been enhanced by building network biosurveillance capability and expanding the use of novel surveillance tools. I'd just like to spend a moment on some of these tools to show you where our area of focus has been. So we've expanded the use of surveillance animal environment to enhance our ability to efficiently characterize and service. Which takes us to our last pillar, so pillar 4, which is defining responding to biological. This pillar is focused on responding at speed and effectively to biological risks that have reached the UK or UK interests, with the aim to minimize impact on population health, livelihood and development, as well as ensuring a rapid return to everyday life. Recent steps taken to sharpen the UK response include testing our response plans to ensure the ability to guide the UK in response to major pandemics. And this is, of course, our exercise Pegasus that I think some of you are aware of, and we will be looking forward to speaking to you on our learning from our exercise Pegasus coming months. I have very quickly run through all the activities we have underway at the moment and as regards our biological security strategy. And we have learned many lessons since 2023 and the start of the strategy. What we understand is that technology is critical for faster, earlier, and more effective response to health. And investment in new surveillance technology is essential to address an ever-increasing complex landscape. But with advances in biosurveillance, they deliver the greatest value when they strengthen the 3 C's of One Health action. That is communication, coordination, and collaboration. It is a One Health approach that will best protect on our against our shared health threat. Innovative technology or an AI-enhanced systems, they must be in the loop. That will enable leaders to make confident, agile decisions based on integrated multisectoral and in short, what I am saying is technology is a tool in our toolkit. The bottom line is that the 3 C's that make One Health surveillance work are what our investment. I realize that is a very quick run through of some of our examples that we have in the UK, and I look forward to speaking with you, hopefully in person, very shortly about some of our advancements in this area. I'd just like to finish my talk today with thanking my team for supporting and both the country as well, but mostly the organisers for extending your hands and invitations to you. It's a great pleasure, and I wish you a very fruitful symposium. Thank you very much.
Thank you very much, ma'am, for broadening the horizon of deliberations for the session with your valued insights. I hope the echo of the round of applause just extended to you does reach out to you. Thank you very much. And ladies and gentlemen, please join me in welcoming now Dr. V. Narayanan, the Secretary, Department of Space, Chairman ISRO, Chairman Space Commission, to kindly address the August House.
Very, very good evening to all of you. It's a great privilege to be with you to share our thoughts, our contribution, whatever we have done and what can be done by space in the area of One Health mission. And my structure of the presentation, I thought before going to the contribution towards the health sector, what are all the accomplishments made in a couple of slides and where we stand and what is the contribution we have made and what is the way forward. And the space activity was started in 1962 and 63 we had the first tiny rocket launch, and 15th August 1969 ISRO was formed. 1972 it became a separate department. Initially it was with atomic energy, and then from 72 onwards it is a separate department. Now, the entire accomplishments made over 63 years is placed here. We had 4,015 sounding rockets lifted off from Indian soil. 6 generations of rockets or launch vehicles are developed. starting from the SLV-3 cable of 35 kg to low Earth orbit to the Bahubali rocket Mark 3, 10,000 kg, 103 launch missions we have done. 133 satellites during last 50 years. First satellite was launched on 19th April 1975. Aryabhatta with the support of other countries. From that to now, 133 satellites of various types are conceived and placed in orbit. The heaviest satellite is the GSAT-11, 6,000 kg communication satellite. And 433 foreign satellites we have launched, and 9 re-entry missions, 2 launches for NGVs based on the vision of Honorable Prime Minister of India, and 18 satellites realized by private players, including students we have launched. And right now we are getting ready for Gaganyaan program, and Gaganyaan also one launch was done for demonstrating one experiment. And recent missions, we have accomplished a docking experiment, and India becoming 4th country carrying out the docking experiment. And the 100th launch was successfully accomplished this year, January 29th. We have successfully accomplished the 100th launch. And Axiom program, we have sent our Gaganyaan 3 to space, International Space Station. Subhashnu Shukla was the first person sent there, and he has done 7. He has continued 7 experiments. Couple of biological experiments, biomedical experiments are successfully done. And then we had an important mission, NASA ISRO synthetic aperture radar satellite, as I told in the morning. It was a very prestigious mission, and NASA has spent 10,300 crore, JPL NASA. And then we have built a similar payload, and satellite was conceived by us, and we have launched successfully. And integrated airdrop test for demonstrating 7 parachutes we have done. And this month, on 2nd November, we have accomplished we have lifted the heaviest communication satellite from Indian soil, 4,400 kg satellite. And technology growth, there are 200 accomplishments this year alone from January to now. Almost every working day, one major technology breakthrough is happening, and which includes new rocket development, engine testing, payload development, applications. A lot of things are happening. I am not going to dwell on all those things. Upcoming mission, up to March, we are targeting at least 6 to 7 launches, including a commercial launch next month. A 6,000 kg communication satellite of other country we are going to launch, and we are also targeting our first uncrewed mission, and the first rocket coming from industry is going to be launched. So I think you are having all the details here. Coming to the application in the health related area, to be frank, we have just started contributing, and we strongly believe the space can contribute in a very, very big way. And let me thank the Secretary, Indian Council of Agriculture Research. I understand during his talk he has already told this idea. So thank you very much for putting a strong foundation for my talk. Telemedicine, this program was started in the year 2001, and almost 182 nodes connecting remotest possible, remotest villages are connected, and it is really serving the country in a very, very big way. Wherever I go to major hospitals, in fact, last week I was in Pune, D.Y. Patel Hospital, and they are having the connectivity. And then, of course, so many hospitals, they are connected, and really it is benefiting in a very big way. And real time, one can consult and get the details. And National Health Resource Repository, this is one of the activity. We signed a MOU with the Ministry of Health and Family Welfare 2017, and ISRO has contributed, to be frank, in a very big way. Developed Android-based mobile app for collection of the health resource assets in details. And we are having a Bhuvan platform equivalent to equivalent to very good platforms of the other country, which receive mobile geotag data, provide facility for modernization and display of assets. I think the day should be, there should be a day every Indian citizen should open Bhuvan portal, and you have all the data inside. Probably one has to go through, and even educated mass is not opening the site. Everybody is behind Google type of sites. Please open and you will understand a lot of things. Linking healthcare resources, asset data with administrative boundaries and natural resource data, tools for data analytics and updation, capacity building activities for the ministries. And there are a lot of 3,500 people in the field. They are working 1,400 attributes and a lot of work is going on in this area. Another important work what we have done for Ayush, the resource mapping. We are having lot of herbal gardens, but if somebody has to go manually and try to collect what type of plants are there, it's a very impossible and difficult unprofessional task. And in this area, we have done a lot of things. 1,880 herbal gardens has been totally mapped and we have uploaded. Of course, today we are having fairly good idea, but lot more work has to be done. In fact, this data has to be supported. Once you satellite takes the entire picture, we also should do some validation through the ground data. And this area further we have to strengthen our hand, but some good work is done in this area. And forecasting model for a vector-borne disease using remote sensing. In fact, remote sensing, we started the activities in the early, almost 50 years back, we started the activity. And at that point of time, the resolution of our camera was kilometers, came to 36 centimeter and 72 centimeter, 72 meter, 36 meter and 72 meter. Today, our capability is one of the best remote sensing data, 28 centimeter resolution. And who is having the best camera in the moon? India is having the best camera on the moon. No other countries. And India's camera is the best camera probably. And so really lot of things are done. This is one of the area. Only through the satellite only lot of work can be done. Don't underestimate other areas, but if you go through the manual work, nothing is possible. So remote sensing data and image classification, and then when we are talking about lot of disease, where it is clustered, and basically we have to do forecasting. And then only we can do the control and which area. In fact, I still remember, I think the youngsters, those who are sitting in the back side, you cannot understand. Those who are in the front, you can understand. When I was studying 10th standard, that was the time. 10th standard is 1979. I did my 10th standard. Okay, there was a disease called cholera. If it comes, that's all. My next village, single day, 20 people passed away. And then we were all worried in all the villages how it is going to spread, and nobody knows. That time, the health sector was also not that good. Today it is better. So we can understand through the satellite pictures, a lot of things can be done in this area. In fact, a model development for prediction of whatever disease, whatever indicated, this is done. And northeastern area, we are doing very good job, but lot more has to be done. Today as secretary, simply I should not claim credit and get out. But I have understood what is done, and lot more can be done through this space area. And then monitoring early warning of vector-borne disease. This is one of the very critical area in which ISRO has developed an early warning system, and GIS mapping of 6 major vector-borne diseases are done. But in my opinion, lot more can be done. For example, malaria, Japanese NC and filariasis. This is one of the area. Lot of things are done. Dengue fever and so many things are done, and we will be in a position to contribute. And climate and environmental monitoring. In fact, we are monitoring daily through the satellite what is the condition of the climate conditions, including Delhi, and we monitor. And because when somebody is becoming unhealthy, there are a lot of reasons. Water, contaminated water, and of course then the climate conditions, then air pollution. In fact, to study air pollution, now we are building a exclusive satellite, G20 satellite for G20 countries, and currently our satellites are capturing air pollution. And then we have to understand air pollution means what is the reason, what is the cause, and how to avoid. Probably will be a advisory role. We are not the implementing agency, but then so a lot of work can be done. Work is done and work can be done. And water quality assessment and management, hyperspectral remote sensing for water body monitoring on suspended soils, chlorophyll content, organic matter affect water reflectance, and lot of things can be done. In fact, this is one of the area we are having much better understanding. Air quality monitoring and water quality assessment. I think satellite data, even we are having best experts. We can understand by the picture itself, we can understand which is the contaminated water, which is the better water. We'll be in a position to understand and appreciate and inform the people. Suppose there are some drainage system problem, this problem, that problem, we'll be in a position to contribute this area. And coming to when we talk about One Health India mission, as I told, when we got independence, average life was only 32 years. And in fact, when I completed my MTech by seeing the foreigners. We used to think what type of health they are having and what is happening to our country. But today, I think the health sector has done outstanding work. Outstanding work. But our average healthy life has become 72. But then lot more has to be done. When we talk about a Viksit Bharat 2047, seeing a country as a developed country, if without proper health management system, how it can become a developed country? So this area, a lot of things can be done, and the space is one of the platform. As secretary, I strongly feel we can do lot of things. And as I told, we are also working on. The Honorable Prime Minister has given a guidance and vision to build a space station by 2035, and it will be a 5-module construction. What you are seeing on the right top is the first module. We made a 1:1 model which was displayed here in the same place on 23rd August, and it is going to be a 30-meter long, totally 30-meter by 25-meter size. But this is meant for what? Meant for carrying out lot of research and development, including medicine development. So many things can be done. I request people to come forward, this community also to come forward. Please first do a literature survey, what people are doing and what can be done. And then please come out with your own proposal. We are also there to handhold, and we can mount a lot of things. And another one is, as I told, space medicine is yet another important area. When we expose people to microgravity conditions, and there are a lot of things happening, fluid accumulation, then tissue related problem, muscle problem, then dental related problem, eye problem. So many things are happening. This is yet another area, probably in a small scale, but it has to be really done. And pharmaceuticals, I understand lot of good things can be done under microgravity environment. Probably you are all the experts. You can come out with the proper experimentation we can do. And with that, I can only tell, let me thank Honorable Prime Minister of India, Sri Narendra Modi ji, for his outstanding vision of this One Health India mission. And I can only throw a challenge to all the health department people. When India is becoming a developed country, I don't have any doubt it will become a developed country before we celebrate 100 years of independence with the vision of Honorable Prime Minister. I don't have any doubt. And I have got a request to all of you, the health people. When it becomes a developed country, the healthy life of Indians should become 100 years. Towards that, we all have to contribute. Thank you. Jai Hind. Maybe any questions, 1 or 2 questions I can take. Otherwise, yeah. Okay, thank you.
Thank you very much, sir, for your articulate and zealful address. I am just reminded of these words that you did not come this far to only come this far. So, ladies and gentlemen, with that, time now for us to extend our gratitude to the distinguished dignitaries on the dais for steering this session with your valuable insights and thoughts. And please allow us to now take this session to the next juncture. Thank you very much. So, ladies and gentlemen, the next juncture is an expert-led session of deliberations on technology-enhanced surveillance. While the dais gets ready, may I bring to you the learned panel that shall be taking forth this session? Are we energized enough? Yes, may I bring to you the details? All right, thank you. Well, we have very able persona to take forth this expert panel, which shall also incorporate the state implementers' reflections. This session shall be moderated by Dr. Nivedita Gupta, the head of Communicable Diseases, the Indian Council of Medical Research. With your warm welcoming round of applause, may I request you, madam, to kindly grace the dais. The expert panel, and I will take a moment before I take their names and I invite them onto the dais. This session sets a very vibrant tone in terms of drawing from a very vast, diversified stalwarts hailing from different disciplines and expertise. Thank you for giving us this moment, and seems we are ready to now begin with inviting the distinguished speakers of this panel. Very warmly inviting now Dr. Mrityunjay Mahapatra, the Director General of Meteorology, Indian Meteorological Department. Ladies and gentlemen, with a warm round of applause, requesting you to welcome all the distinguished panel members. Welcoming Dr. Rakesh Mishra, the Director, Tata Institute for Genetics and Society, Bengaluru, India. Requesting all the panel members to please come up and grace the dais. Warmly inviting now Dr. V. Ravi, the Head, Research and Development at Tata Medical and Diagnostics. Welcoming Dr. Vinay Nandikuri, the Director, CCMB, Hyderabad. Welcoming Dr. Balaji Chattopadhyay, the Assistant Professor, Trivedi School of Biosciences, Ashoka University, Haryana. And ladies and gentlemen, do infuse some energy as we now welcome Dr. David Blazes, the Deputy Director, Genomics, Epidemiology and Modeling from the Gates Foundation. Warmly extending an invitation to Dr. Jonathan Epstein to please come and grace the dais, ladies and gentlemen, the founder of the One Health Science, New York, USA. We are also being joined by Dr. Pranav Pandit, the Assistant Professor, UC Davis. And to bring us reflections from the states, from the state of Kerala, we are being joined by Srimati Shiba George, IAS, Additional Secretary, Health and Family Welfare Department, Government of Kerala. Welcome, ma'am. From the state of Madhya Pradesh, inviting now Ms. Bindu Sharma, the Principal Chief Conservator of Forests Production. Welcome, madam. And from Puducherry, the Union Territory, Shri Chaudhry Mohammad Yasin, IAS, Secretary Health. Ladies and gentlemen, that makes the distinguished panel to now steer a session of expert deliberations. May I please request the esteemed moderator to please take forth the session proceedings. Thank you.
So very warm welcome, and it's really my privilege to be moderating this panel with so many distinguished speakers on the dais. So thank you very much for joining this session today. And the way we have structured this session is that I will be asking you some leading questions based on the work that you have done or the organizations that you are representing. And for the states, the way this has been structured is that once all the speakers that I would be referring to for talking about the technologies that they have developed or they are either supporting. So we would really like to hear from the states how these technologies they would be able to implement and how they would help them in conducting surveillance or actually detecting certain diseases or signals early. So that's the way we have structured, and that's why my questions would be first to the key experts who are working in the field of technology enhanced surveillance, and this will be followed by some questions to the states. So welcome once again. And my first question to you would be Dr. Mrityunjay Mahapatra. First of all, thank you for joining this session. So, sir, we all understand that weather and climate very strongly influence disease patterns. So, how do you envision the role of technology in linking meteorological data with surveillance for early prediction of outbreaks? You want to present? Okay. So, may we have his presentation, please? Yeah, I would just request you to finish, sir, in 5 minutes.
So good afternoon, namaskar to all of you. Yeah, so IMD's role as a nodal agency for weather and climate services is known to almost all audience present here. When we consider the One Health mission, it is needless to mention that weather and climate plays a dominant role with respect to the human health or the livestock health or the aquaculture or the environmental health or the soil health or the agriculture. We have listened to our keynote speakers little earlier, how the technology can help in addressing the health concerns of all these uh, aspects. When you consider, for example, the human health, so it is the disasters, which is the major stress towards the human health, and especially the heat waves, cold waves, or the heavy rainfall floods and the cyclones, thunderstorms, etc. They pose a serious human health. Specifically, also we have got the vector-borne diseases, the air quality, the water quality, the allergens, etc., are also influenced by weather and climate. If you consider the livestock, yes, there is enough stress and disease risk due to the various types of weather events. We also have the influence of the water temperature and quality affecting the fish health, for example. Also, we have the biodiversity losses, the forest fire risks and pollutions, which are also influenced by weather and climate. The moisture stress, erosions, nutrient loss, and salinity, if you just consider, that also are influenced by the weather and climate. And nevertheless, the last but not the least, this crop growth or the crop yield are highly influenced by weather and climate. So therefore, we have to consider the role of weather and climate. We have to mainstream it. And I'm happy to inform you that the weather and climate are being mainstreamed and being utilized by every individual, every society, every organizations. And perhaps there is no such ministry left out in the country who is not linked with weather and climate informations. So can you go to next slide, please? Or we can move here, okay. Okay, so if you just look at present the current status with respect to forecasting, with respect to health services, we have got a seamless forecasting system. So for example, if we consider the heat wave, we start with the forecast from the season ahead, then we follow it up with the months, then follow it up to weeks on every Thursday. For example, today we are using the forecast whether there will be cold wave, whether the lower temperature or the higher temperature, whether there will be threat due to disasters, etc. for the next 4 weeks. Then we go for every day, providing the forecast for each and every sector. And especially for health sector also, we provide a forecast for next 2 weeks with respect to vector-borne diseases like malaria and dengue. Now, if you just look at these forecasts, they are seamless in the sense to ensure the consistency, accuracy, and continuity in the forecasting, and to evaluate the anticipated risk, activate preparedness measures, and also it is communicated to all the central and state agencies, the public sectors, the NGOs, etc. Now, if you look at the various types of products which are being generated, you'll find that we have got the heat-related indices, just like a thermal comfort or whatever it is. We have got the heat wave outlooks. We have got the cold-related indices like cold conditions and seasonal influences, wind chill factors, frost, cold and dry winds, etc. Then we have got the vector-borne diseases ideas like rainfall anomalies, rainfall and relative humidity combinations, temperature humidity combinations, its impact on the mosquito proliferations. So various types of malaria parasites, we issue the guidance every week. Similarly, with respect to air quality, also we provide the PM 2.5 and PM 10 concentrations, current status and forecast, and also we provide temperature inversions, fog, and other stagnation conditions. Early warning for each and every weather and climate conditions also provide a trigger for taking actions to ensure the health. The disease surveillance and early response, anticipating outbreak of various diseases, we carry out in collaboration with various agencies like ICMR, NCDC, etc. We have got the health system preparedness, like say managing hospitals and capacity. All these things are in very growing stage, and in preliminary stage, I will say in the future we have to enhance all these so that we can ensure the management of hospitals and capacity building, ensuring medicine and ORS, or planning ambulance and emergency response. Similarly, environmental health to consider, there is need or there is enhanced need for advisories to be issued for each and every corner of the country. But however, targeting at present are the major urban areas. Occupational health, yes, certainly, if you consider the daily laborer, if you consider domestic workers, if you consider rickshaw pullers, certainly they are more stressed persons, they're more vulnerable persons, and you need, for example, the specific information with respect to the health hazards and the impact on the right hand side. The right side diagram is an example of the threshold window or transmission window of various types of malaria parasites in a particular condition of temperature, humidity, and rainfall, etc., being provided every Friday. Now, if you just look at specifically, India is an agrarian country, agrometeorological advisory services for health mission, you will find that we've got various types of services. Already Secretary and DGAIR already told, DGICR has told about this. But I just mentioned that we are in collaboration with various agencies like ICMR, ISRO, state agricultural universities, central agricultural universities to provide the monitoring of weather parameters as well as forecast of weather parameters in various spatial scale and time scales. For livestock, yes, we are working with NVIDIA and NDRI to provide alerts for heat stress, FMD, and DSS. The measures for shelter management, vaccination, hydrations, etc., are also being provided for the sake of livestock. Concerning poultry specially, yes, we are in collaboration with DPR, and precautions for heat waves, cold waves, various diseases, respiratory programs, etc., are being provided to the poultry sector. Inland fisheries, yes. Now, apart from marine fisheries, inland fisheries are growing off in the country, and all of us know that India is one of the most important exporting country for the fish, and therefore we have to take care of that. So, monitoring of dissolved oxygens, water temperature, pH value of the water, etc. Apart from the disastrous weather warning, will certainly help to improve the fish health and also the output. The outcome is that we can reduce the mortality in all sectors, all living sectors, and we can improve so that morbidity can be reduced and productivity of all these sectors can be increased so that we can ensure not only secured health but also a nutritious health for each Indians. So towards this direction, we have got a future plan also. If we just look at the future plans, we will find that Mission Mosam, the Honorable Prime Minister declared on 14 January, it targets towards reaching out to each household with weather and climate information for each sector with realistic information. The target is that there should 10 to 15% improvement in forecast accuracy. The target is that it should reach out to each panchayat immediately. And finally, it should be village and households. So for this purpose, the first and foremost is that we have to improve our observational systems, and IMD in the Ministry of Earth Sciences is taking off a major initiative to improve our weather observational systems. Because weather forecasting is an initial value problem. Better the initial condition of land, ocean, atmosphere detected by remote sensing agencies or by the direct ground truth, it can help in numerical modeling systems, and hence we can improve the forecast. Now, once the forecast improves, all the sectoral applications, including the health sector, can improve. And by the way, if you just look at the outcome by 2030, there will be 3D hazard forecasting by the scale of the panchayat. And there will be dynamic impact of forecasting for health sector. Already we have got disaster restoration sectors. Early warning for every household we are planning for, and 10 to 15% improvement in forecast accuracy. So it can improve the human health in terms of alert for various types of disasters and also day-to-day parameters. The risk-based health advisories, life saved during the disasters will be most important objective of this mission. Reduced morbidity and mortality can be ensured with this mission in future by 2030. So if you consider crops, soil, fishery, and livestock, etc., there also you can say field-scale diseases and soil risk warning can be the new initiative. Pest and diseases risk mapping will be another initiative. Last mile farm and eco warning will be one of the most important initiatives, and better crop and livestock outcomes can be expected with all these initiatives. If you consider environmental conditions, we look at localized eco risk alerts, which is not in place, that can be one of the objectives in the future. And ecosystem hazard monitoring will be another objective. Community level participation and resource management and collaboration will be key to all these success and outcomes. So thank you very much.
Thank you, sir. My next question would be to you, Dr. Rakesh Mishra. So you did some impressive work on wastewater surveillance during the COVID-19 pandemic. How can wastewater surveillance strengthen our preparedness to track infectious pathogens and handle future pandemics?
Thank you. Thank you, Dr. Nivita Gupta, for this question. And thank you for giving us opportunity in this wonderful occasion to talk about uh, environmental surveillance from the work that we have been doing since the COVID time. In fact, that gave us the kind of platform and confidence that from the wastewater we can explore a lot about what is happening actually in the humans and now also now in the livestock and else, I mean everything else in the environment. So that made a base based on which I can say now that like all of you contribute 300 billion cells every day to the environment. That many cells we shed, and so is the case with other animals, and so many virus pathogen everything ends up in the waste, in the either in the air for some time or eventually in the wastewater. So that is actually a very rich source of assessing not only the pathogen, even the biodiversity, and that's what we are seeing when we are doing metagenome analysis, that we can even talk about how many different kinds of animals plants are around, even human genome variation we can asking. So it's a very, very powerful source of asking many questions. And today the environmental surveillance in context of pathogens more relevant. So so we can focus on that. So I'll just take 2-3 minutes to summarize the strategy that we are doing in very close collaboration with ICMR and many other institutions in the country, and that is to establish genome-based surveillance, which means you not only detect what is there in the environment, you can detect even the new variants that is coming because you are following the sequence or sequence-based analysis. Now, the next level of technology that we are deploying is the metagenome analysis, in which you can actually see anything that is around. And if you do longitudinal analysis and you see something increasing gradually, maybe that is the disease X that is coming. So if we do consistently in a systematic way longitudinal analysis, we will be far more informed in taking decision and preempting uh, 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 a potential pandemic or something. The key thing here then immediately becomes for a country of this size that it should be affordable, it should be accessible, and whole thing there should have a robust supply chain. So the other effort that we make in parallel is all the assays that we do, they should be developed and manufactured within the country so they are available to all of us when we require them. In fact, we are going to need them continuously. So indigenization is equally important factor in this when you are going to do it at a very large scale, and we can make it so affordable that fact cost will not remain actually a factor for doing the environmental survey. More challenging thing will be how many places you want to do, what frequency you want to do surveillance, and how many pathogen you want to follow on a continuous basis. And these will come when we pool lots of data together, do the analysis with the help of experts, epidemiologists, and even the molecular and evolutionary biologists. Then we can predict that these are the minimum number of surveillance that we need to do. So immediately become that pooling of the data, sharing on a real-time basis becomes very important to take immediate decision. And of course, long-term analysis to generate models, which can then help us doing surveillance in a strategic and a cost-effective and need-based manner. So this is a quick summary of how environmental surveillance we can do. We are making lots of progress, and I think already almost 50 cities surveillance is more or less in the place. And I think with the support of so many ministries and this much excitement, I think very soon our country will have full-fledged proper environmental surveillance system across the country in the small or medium size or big cities. So thank you. And if there are more questions, happy to answer.
Yeah. Thank you. So I would now move on to Dr. Ravi. So, sir, you have seen both sides of the world, I would say. You headed the Department of Neurovirology at NIMHANS, and then you also are working as head R&D at Tata Medical and Diagnostics. So my question to you is that since you have undertaken pioneering work on neurotropic viruses, and now you head diagnostic R&D in a private company, what kind of diagnostic tests, in your opinion, does our country need to be able to detect new or unknown pathogens very quickly? And also there's a follow-up questions on your insights, how to effectively improve public-private partnerships for common good.
Thank you, Dr. Nivedita, distinguished panel members and respected audience. It's a privilege to be in this forum. As Nivedita said, in the last 40 years, I've had the fortune of investigating more than half a dozen viruses causing innumerable number of outbreaks. One lesson that I have learned in investigating known pathogen associated outbreaks is speed is essence. The faster you detect the pathogen, you will be ahead of the outbreak. The slower you are, you will be chasing the outbreak. So having said that, when it comes to diseases where we do not know the pathogen, it's pathogen X, I think we need a three-layered strategy, in my opinion. The first one should be that you should have detection systems, I call them universal platforms, that are pathogen agnostic. In fact, in the direction you heard Professor Rajiv Behel talk in the morning, ICMR is doing a wonderful job, and I've been associated with it, is to develop syndromic surveillance, where a syndrome, all the associated pathogens you can detect in a systematic algorithmic fashion based on priority 1, priority 2, and priority 3 pathogens. I think we are moving in the right direction. We've just started. We are a year old. I'm sure in the next couple of years, we will have a huge data set on which we could apply, artificial intelligence and machine learning. The second is, as I said, speed is essence to have molecular platforms, be it PCR or next-gen sequencing or CRISPR or isothermal platforms available at the periphery and in strategic locations. I think we should also determine the hotspots where outbreaks are likely to occur and ensure that every state and strategic districts within the states are used for placing these point of care diagnostics. And nowadays, even next-gen sequencing can be taken. We ourselves in the encephalitis surveillance had taken to remote parts of Uttar Pradesh and Assam and done next-gen sequencing. So I think that's the second point. The third is, of course, what has been said since morning, to use technology, digital technologies, AI, machine learning. And most importantly for that, the data of testing should immediately, instantly go on to a portal where it is available for people to see and it also associated with the animal and the environmental data. We are now reaching a stage where instantly diagnostic data is going in, patient data is going in, but I think we need to integrate animal and environmental data so that we can quickly decide our interventions and block outbreaks. Moving to the second part of your question on, I've had the fortune, as Dr. Nivedita said, of 36 years in government and last 5 years in private, heading R&D. So, and I have the following things to say. Again, I would say 3 points. The first is to have trust in private, and the second is to encourage private innovations, allow them to develop the technologies. They are good at it. They are fast at it. I'll give you an example. At Tata MD, we developed a CRISPR assay for COVID in 100 days. And with the help of ICMR, we developed a variant detection PCR in a matter of 45 days. November 26th, Omicron was announced. January 5th, it was licensed and in the market. So we have that kind of speed and capability. But what we need is a good, robust network in the public health system that lays the agenda, that sets the priorities, and does rigorous validation. I'm again very happy to be associated with ICMR, that we have now protocols which was released in the VRDL conclave of 36 different assays, molecular and serology, and another 30-40 in the pipeline, where protocols have been developed in collaboration with CDSCO, and this is going to be a definite advantage for the privates. And last, of course, is to encourage innovation and participation, and also involve the private hospitals into the decision making process wherever it is possible, so that there will be trust. I think we are looking at a landscape that is very befitting of One Health mission. Thank you.
Thank you, sir, for those very valuable insights. I would now move on to Dr. Vinay Nandikuri. So, sir, CCMB has maintained a niche, and you people have a tremendous capacity to work in the area of next generation sequencing and metagenomics. So, I would like to hear your reflections on how can genomics and metagenomics advance our understanding of new and unknown pathogens, and how is your institute contributing to this initiative?
Identifying a pathogen with next generation sequencing is something that was extensively used during COVID. And as the variants were coming, we were able to detect them, flag them, and come up with ways to combat them. But COVID was not actually identified in India for the first time, or sequenced in India first. For all you know, next pandemic may be starting somewhere in India. There is always a possibility of some unknown pathogen. So our idea is to use genomics, metagenomics specifically, where it doesn't matter the genetic material is RNA or DNA, so that we are actually in a position to sequence the sample unbiased from no matter what the sample is, blood, stool, or sputum, or for that matter, wastewater. Whichever way the sample comes, we sequence it unbiased and identify possibly the pathogens that are responsible for the outbreak that is happening at that point in time. So this will also enable, once you sequence, what we do generally is we actually compare it with the database that is available. And if it is something that is already known, well and good, we know what the pathogen is. But if it is something that is not matching with the database, it is novel. It can be a new fungus, it can be a new bacteria, it can be a new virus. This kind of identification, of course, needs to be backed up, and we need to go into high resolution sequencings to confirm the identification of novel pathogens, preferably more than one center, so that there is a reliability, and there is very clear this thing. We otherwise we'll end up spreading panic. So, but this is something I think ICMR in collaboration. I mean, we are all doing working along with ICMR in setting up few places where the metagenomics will be done for the cultures or the samples that they will be sending it to us. Our idea is to one set up this methodology in such a way that going forward, if need arises, we may, or one fine day, we may end up getting a sample which may have something that unknown and may be causing some kind of a local problem. The other thing a sequencing can do is it can differentiate between the local phenomena and an infection that is coming from some other place, imported infection. So that is another aspect which we can actually in-depth sequencing can do. So the sequencing technology is here to stay, and this will also allow us, the other thing which we keep on talking about is antimicrobial resistance. Antimicrobial resistance is again because of the antibiotic resistant genes, and we can identify the antibiotic resistant genes and we can find out where is it coming, which ones are coming. The last part is One Health, right? We keep on talking about One Health, which basically means pathogens are moving around, right? If we can actually get the samples from various parts, from the animal farms, from the nearby water body, humans, that is the from the hospitals, and ultimately even something like rodents, we may be able to figure out how this zoonotic and transmissions that are happening and what is causing what. So genomics and metagenomics is a powerful enough technique that would enable all of us to actually do in-depth sequencing and identify most of the problems that we may, I mean, one, we need to establish, and we have established quite a lot during COVID, but we need to sustain that, and we need to establish more better techniques going forward, which will enable us to really combat anything that we can and we may face in the future. Thank you.
Thank you very much. I would move on to the next panelist today, Dr. Balaji Chattopadhyay. So, sir, you are working at Ashoka University and you have done some impressive work on climate change causing evolution of pathogens. So, I would like to hear your opinion on how will climate change affect the evolution of pathogens and what are the potential threats to human health due to this change?
I'm audible, right? Yeah. So I actually work on animals, particularly small mammals, more importantly, bats. Now, what we know generally is climate change essentially it plays an important role in environmental change. So environmental degradation, habitat loss, habitat degradation, etc. Now, this in turn has a great effect on biodiversity. The biodiversity that we have in extinction, uh, that is loss, range fluctuations. Some animals which are commensals might actually increase their range, some may not. Also in their abundance, right? Now, zoonotic pathogens are basically, these hosts are fertile grounds for zoonotic pathogens to evolve, right? So an understanding of how hosts are evolving across a range of environmental conditions gives us an understanding of the pathogens inside them that might be evolving. So what we do is we don't directly look into pathogens. We are looking into connection of host, its microbiome. We have understanding from literature already that under degraded or urban conditions, microbiome host diversity is lost, and also their microbiomes are very similar. At sometimes in urban environments, animal microbiome resembles human microbiome, what we call this pathogen pollution, pathogens from humans getting into animals as well. Now, this dynamics, however, is not well known. We also need to understand that not all animals are good hosts. Some are good hosts, some are bad hosts. We know now that those are good hosts or super hosts, hosts of multiple zoonotic pathogens. Most of them are invasive species or commonly occurring animals which may live close to humans. So some of the research that we are trying to do in Ashoka University is at par with disease ecology, where we are trying to understand the intricate play of diversity of host, the microbiome that they harbor, and within this how this microbiome is shared between various animal species within a community, between hosts and non-hosts, and how this actually changes under changing environmental conditions. Uh, we have done some work in the Western Ghats where actually we identified and we use metagenomics tools as all our honorable speakers before mentioned. So we use genomic and metagenomic tools extensively. Preferably, we are using portable sequencers like Oxford Nanopore, where you can actually do long reads. You can get the entire metagenome also. So you have more variable sites. You can identify pathogens more easily. You can understand their functional genes if they harbor antimicrobial plasmids, so on and so forth. So in that regard, so one is, in Western Ghats, we are able to identify a few adenovirus, novel adenovirus lineages. In Bangalore, we actually did a study on bats where we found pathogen pollution, known human pathogens in bats, and also like blue green algae, algal bloom agents found in bat diets. In Northeast India, we have several field sites across several states where actually we are replicating the environmental gradient. And what we are actually observing there is we find multiple bacterial pathogens of zoonotic concern in several bat species, particularly cave-dwelling bat species. Now, in regards to technology, we try to do genomic technology, particularly portable sequencer. So in case we need to establish field station in a remote area, these can be very helpful. In regards to actual enabling actual surveillance, with Dr. Anurag Agarwal's gracious funding support, we have tried to actually develop a very economical mobile laboratory setup a setup that is around BSL2 plus, which can be taken across even in remote areas. So on and so basically this is not going to help only in biodiversity surveillance, but can also help us understand its diet, its microbiome, and identify potential pathogens. So basically from sampling to sequencing and analysis and identification, everything can be enabled in one single laboratory facility.
Thank you very much for that valuable piece of work and information that you just shared. I would now move on to our international speakers, panelists. Dr. David Blazes, you are leading work on genomics, epidemiology, and modeling at Gates Foundation. We would like to hear your reflections on the technologies that are being supported by Gates Foundation, which, in your opinion, will improve the current surveillance systems and help in early detection of pathogens.
Thank you. Thank you for that question. And I would like to also briefly acknowledge and thank the government of India, the ministerial secretaries, and the organizing committee for convening this important topic and for inviting me to participate. Yeah, let me first mention a couple principles that we use to talk about this in terms of technologies as it applies to surveillance. I think it's important to, with all of these technologies that we've heard about, to mention that our North Star at the foundation is looking for public health decisions and to make sure that all this technology leads to a public health decision. So we've heard great examples of that here already today. And then the second principle is we have to make sure that we address cost and specifically lower cost because that's going to define sustainability. We all know that public health is chronically underfunded around the world, and I think we have to endeavor to get that cost lower. So my colleagues on the panel and the plenary speakers already did a really great job of explaining all the technologies. So I actually don't have too many things to add to that list, but I'll highlight a few in three areas. The first area is transition to molecular techniques. The second is advanced analytics, and then the third is new approaches or methods for surveillance. And so going to the first one, the transition to molecular techniques, obviously that's PCR and a variety of sequencing techniques that we've already heard about from speakers. But obviously the transition to molecular techniques will allow for faster, cheaper, and more multiplexing of diagnostics. It also standardizes, and a few things came up here that I'll also bring up. So biosafety and biosecurity will clearly be improved by transitioning to molecular methods. We're also working on being able to rapidly adapt these technologies, and so we're working with Nivedita and others at ICMR on local design of amplicons for targeted next generation sequencing that will allow for a quick switch to a new pathogen if it shows up. We're also looking at novel nanopore chemistry. I think that has the potential to drive costs down even further. There's a lot of companies looking into that, and then finally, obviously, I don't need to mention this here, but the link between molecular methods and product development is very clear. And so whether that's creating a novel PCR, a monoclonal antibody, or a vaccine, it can come directly from the genome, obviously. Switching to advanced analytics, obviously AI was brought up by many of you, and it's clear. My only concern with AI is that it's going very fast, and so how do we keep up with that? You know, we apply one foundation model, and then the next day or the next week there's something else, and so how do we make sure that our technology is kept up to speed? I think is something that we should focus on. Many people also brought up predictive modeling. It's very clear that all of the different data sources that we've talked about, whether it's wastewater or genomics or clinical diagnostics, they will each be covariates in these models. And so I think my British colleague brought up the human in the loop. We saw from the SARS-CoV-2, the COVID pandemic, that the models that were trusted were local. And so otherwise, a model can be created by a big tech company or whatever, but it's only going to be trusted if it's understood and created and categorized by local modelers. And so I think that'll be critical too. Bioinformatics, you know, the way to understand the sequences, I think is also critical. Historically, that's been created by academics. But now the big tech companies are all getting into this, and I think that's going to improve and professionalize the software, but it also will potentially lead to competition in that space. And then novel approaches, I think, to analytics are also important to think about. We're working with an Indian company now that has a really novel compression algorithm, as well as the ability to multiplex and pool sampling. We think it's going to probably lead to a five times reduction in cost for large scale testing. And then finally, the novel approaches. I won't go too much into this. They were really well covered by my colleagues. Obviously, wastewater surveillance is a way of the future. I don't think it's going to replace traditional surveillance, but it will certainly be complementary. So we're looking at new technologies there. We're working with NCBS and a consortium of others on looking at wastewater for wastewater and other environmental samples, so including milk, you know, to identify zoonotic pathogens. There's some work we're doing in Africa actually around doing metagenomics and targeted NGS around flies and looking for mpox and things like that in the Central African Republic and the DRC. And then finally, I'll close with, I think we do have to think about how to right-size surveillance. You know, various countries during the pandemic sequenced, you know, tens of thousands, if not more, variants of Delta or of Omicron. We probably didn't need to do that. And so understanding what the correct sampling frame is important. And we can do that with Bayesian frameworks. It's simple math, but it does take effort, and we have to do it for each pathogen separately. And so I'll close with that and just say that I really think from learning today and understanding from my colleagues, India really is a leader in this space for the world, and I think it should be modeled, your approach. So thank you.
Thank you so much, Dr. Blazes. That was really insightful. I would now move on to the next panelist, Dr. Jonathan Epstein, founder of One Health Science. So you have pioneered work on ecology of zoonotic viruses. Which viruses and which non-human hosts or reservoirs pose the greatest threat for the next pandemic?
Thank you very much, Dr. Gupta. I want to start by thanking you for inviting me to this esteemed panel, and thank you to the organizers for such an impressive and important event. It's really so far been incredible to see the absolute consolidation of One Health effort here in the country, and I think it bodes very well. And then I want to thank you for giving me the easy question of the day: what's the next pandemic? Right? That's always a fun one to puzzle out. But when I think about which viral groups and which animals to pay attention to, I kind of start with process, and I think about the fact that the majority of pathogens that cause big pandemics tend to be viruses, and they tend to be zoonotic viruses that originate in wildlife populations. So to your point, how do we know what to expect next? And so we think about the situations that facilitate what starts nearly every outbreak and epidemic, and that is spillover. Or what are the processes that bring us into closer contact with wildlife, whether it's directly or whether it's bringing our livestock into closer contact? And we know that the major drivers of spillover and emergence of pathogens tend to be land use change, where we are encroaching into wild habitats that bring us into closer contact. And another one is intensive or intensified livestock production without adequate biosecurity, when there's opportunities for wild animals to intermingle with domestic animals, and that creates opportunity for spillover. So knowing those processes are important statistically, and that they are intensifying, they're happening more frequently and more widely around the world, we see that there's going to be increased opportunity for spillover. And that brings us to what are then the groups of wild animals or pathogens that we think about as posing greater risk. And so we think about reservoirs for viruses, and for a pathogen to emerge, it's, there are properties of the virus itself, but then there's opportunity. So we think about reservoir species, wildlife species that tend to be common, abundant, and have, and geographically widespread. And then for the viruses that I think we should think about the most are the types of viruses that inherently have the ability to infect multiple species, so broad host plasticity. They may be carried by one type of animal, but are able to, if given the opportunity, infect other species and even adapt quickly to be able to transmit. So which viruses are also very adaptable and evolve quickly. And then in terms of the traits of viruses and the diseases they cause for transmission, we of course focus on respiratory viruses. So in a more roundabout way, coming back to your question, what are the types of viruses that I really think pose great risk? There are two groups. Influenza viruses, I think, are impossible to ignore. These are, zoonotic by definition, by nature, being carried by wild migratory birds. They don't all have the ability to infect and spread among mammals and people, but what we're seeing right now, particularly with avian influenza H5N1, is a zoonotic virus that is very much knocking on the door. We've known about it for decades. We've seen about 1,000 human cases over the last 30 years. Very few of them have transmitted among people, so they tend to, though they can be highly fatal and cause bad disease, they're not very good at spreading among people so far. But in the past few years, we've seen something fairly unprecedented. We've seen massive outbreaks, not only of H5N1 on poultry farms in many parts of the world, but in the Americas, we've started to see epizootics in mammals, spillover of H5N1 into wild mammals, marine mammals, where we saw massive die-offs of sea lions and seals that could only be explained not just by spillover, but by onward transmission within those populations. That's the virus having opportunity to adapt to mammals. We're also seeing terrestrial mammals getting infected in the Americas, and in something that is also unprecedented in the United States now, we're seeing H5N1 in dairy cattle, and we're continuing to see transmission among cows and from cows to people. So if part of the process of a virus emerging and causing epidemics in people is adaptation, this is a virus that is certainly having plenty of opportunity to adapt to mammals. And though so far in the United States, anyway, I'll speak to the human cases we've seen so far tend to be mild, there's also evidence for asymptomatic infection with H5N1. So that brings it into a whole other category of, should it become more transmissible among people and cause asymptomatic infections, we're suddenly thrust into a COVID-like situation where it's going to be very hard to detect cases of H5N1 as it's spreading. So I think influenza viruses are ones we have to pay attention to. The other group of viruses I think can't be ignored right now are coronaviruses. We've certainly seen precedent of global pandemics caused by coronaviruses, but thinking about the wildlife origins of coronaviruses, and particularly beta coronaviruses, the SARS-like and MERS-like coronaviruses, they originate in bats. And for the and particularly horseshoe bats, which are insectivorous bats that are very common and abundant throughout Asia and extending all the way into Europe, and they're present in Africa on the continent as well. So this is a reservoir species, a family of bats that is very abundant and widespread, has lots of opportunity to have contact with people or livestock. And we have seen incredible diversity of beta coronaviruses, of SARS-like coronaviruses in this family of bats. Not only that, coronaviruses, not unlike influenza viruses, have the ability to evolve very rapidly through recombination. And so we know that there are a lot of SARS-like viruses already in circulation in bat populations. We also know that when bat populations have co-circulation of multiple beta coronaviruses, recombination occurs and new viral variants emerge. Having also said that, we have seen evidence in rural communities in China living near caves with large populations of horseshoe bats that there's evidence for exposure, if not infection, with bat SARS-like coronaviruses. So people are having contact with bats enough so that they're getting exposed and possibly infected by these coronaviruses. And there's great potential that there are other coronaviruses out there that would have the ability to infect and spread among people as SARS did and as COVID did. So I think it's, I feel as certain as one can be, I feel that we're going to likely see more emergence of beta coronaviruses. This is an instance where there's plenty of opportunity and very little surveillance. We are just simply not paying attention to many of the communities that have opportunity for exposure to wildlife reservoirs like horseshoe bats, where these viruses can emerge. So influenza viruses and coronaviruses, I'd say, are the two we really need to pay attention to. Thanks.
Thank you so much. And now we know where the next pandemic is coming from, and we can prepare from today itself. Thank you so much. I would now move on to our last expert, Dr. Pranav Pandit. So you are artificial intelligence is, I would say, a very much in term now, wherein everybody wants to use it, but we are still grappling in the field of health, particularly to find a use, but we really want to use it. I would like to hear your opinion on how artificial intelligence can play a role in tracking diseases in animals and humans, and if you would like to supplement it with some relevant examples also, that would be very useful.
Absolutely. Thank you, Dr. Gupta, for the invitation, first of all. And I think, to be very honest, I probably have the easiest question of all the panelists, because probably all the presentations that we have seen in the plenary until now, all the examples definitely included a lot of use of artificial intelligence, machine learning models in health, of course, both in animal health as well as in human health, and of course at the forefront of One Health. However, I think the reason I'm more excited about it is especially because I come from a veterinary background, that too kind of doing research in wildlife epidemiology, which historically has been data scarce. And now, as you can start seeing, it's becoming really data rich. And along with that, there is a real democratization of computational resources, algorithms, easier to kind of get trained people around those algorithms and use them eventually. For example, I guess just to give a quick example, we kind of run a really large early warning system in the US for early warning for wildlife outbreaks. And it actually runs on almost more than 4 million records of wildlife cases. And it keeps on running multiple machine learning models in the back end to identify One Health problems, various outbreaks, including nowadays in HPAI outbreak, West Nile outbreak, and of course some conservation related diseases within wildlife as well. So that's kind of an interesting example that I can highlight here. The other interesting opportunity for AI, I would say, is certainly to bring in disparate data sources. So if there are what we call it as multimodal approaches in the machine learning models, where we can bring in various sources, as we have been seeing in various examples that have been shown here. It could be animal health related outputs or covariates in your approaches, and then of course human health related data sources that we can bring in to really complete the picture around a particular disease system which we are concerned about. For example, if we were to really think about emergence and reemergence of novel viruses, we'd certainly know that there are, of course, genomic evolutionary processes that kind of go in, as well as ecological processes that kind of play their part in. And probably machine learning models can help us bring in all those covariates in one approach and help us identify what might be the next, or where it might be happening next pandemic or next outbreak. Finally, I think I certainly would like to highlight some of the climate change related discussions here. There were many examples that were kind of shown. Climate sensitive infectious diseases, both in animals and humans. However, I guess we need to really bring in the context of some of the modeling approaches and that we regularly rely on. And one of them is our weather forecasting systems, which we need to really understand that it's been almost 40-50 years of data collection modeling that has gone into to come up with a system that we can daily rely on. And we are probably just starting in the One Health concept around building those models. So I think we have a lot ways to go ahead to come up with a reliable predictive environment or approaches to come up with models that we can really rely on. And to really expand on Dr. Blaze's point around so many models, and every day we see a new AI model being put out there, and what model to use. I think as an epidemiologist, I would highly recommend that it's definitely a One Health approach, because you're not just working with a human epidemiologist or a veterinary epidemiologist, but you're also working with a computer scientist, the stakeholder who is going to take that model output into a policy decision. So we need to really bring them in while developing those models. First of all, we need to identify the right problem to build through that model, or predict through that model. And finally, to use those domain experts for what we call it as external validation of the model. So there needs to be a constant check on those models, whether where it's going wrong and where it's going right, and to keep improving those modeling approaches. And I think the final point is to really think about the ethics around those modeling outputs. To begin with, we need to think about what would be the cost of, let's say, false positive prediction or a false negative prediction. And if we were thinking about various populations, the example would be what would be the cost of wrongly predicting a region to be of a high risk for a certain disease versus those are some of the considerations that we really need to consider before putting out all those models out in the open. And I think that's kind of my pitch.
Absolutely. Thank you so much. So we would now move on to the state implementers panel. And we have 3 states here, Kerala, Madhya Pradesh, and Puducherry. And the objective of this panel to the states is that we really want to know from all of you, sir and madam, that there have been quite a few technologies that have been highlighted by the experts. And if these technologies are available in near future, how would it help you in your state, and how would you go on implementing these technologies? We have a paucity of time, so if possible, I would request that if we could do without a presentation, unless you feel it is absolutely essential. So my first question would be to the state of Kerala. We have Sheba George, madam, who's an additional secretary from Health and Family Welfare Department. So, Madam, the question to you is that the state of Kerala regularly reports highly fatal outbreaks of Nipah virus disease. How, in your opinion, can technology help in predicting and preparing preemptively for future outbreaks? Sorry.
Thank you, ma'am. Yeah. The good question. So every year we are facing this Nipah outbreak in Kerala. That's one of the reason. Before I coming to that, the answer to the question, and the reason for Kerala picking up the cases only shows the strength of our community surveillance system. That is the importance of One Health program, which started in Kerala state in 2021 onwards. That is coming. This is last year the pioneer projects in 4 Pamba Basin districts as a part of the Rebuild Kerala initiative, and also now it's going on. So the community surveillance is a robust community level surveillance incorporating the traditional systems. That's also the combined with modern technology, which helps us to pick up Nipah even before it spreads as an outbreak. And it's also another point I bring to the notice that the equipping the community with the technology can also make wonders, as Kerala is highly the mobile coverage system and also the digital health literacy also there. So which improved the once we started the One Health program. So the technology in the hands of the One Health literate community will help Kerala to predict Nipah outbreaks in future. So another important point that I already mentioned that the surveillance and control of Nipah were rooted in conventional approaches. We are now seeking the technological solutions nowadays, mainly IDSP, the disease surveillance program of Government of India itself, moving into the digital platform, and so is the integrated health information platform, that is IHIP, and so which helps us to digitalize the surveillance data. So it made the surveillance faster and also its activities also faster previously in conventional methods. And so we are also attempting to mapping the GIS, geospatial mapping of all bateroids using the drone affected drone, and also using drone also. And then GIS helps us to integrate the affected zones, and also it incorporated activities and it effectively conduct the epidemiological investigations. And so another method we can use is that the CCTV monitoring of the affected areas, and also the mobile phone tracking of the people of the affected areas also we can use. And this helps us to a lot to identify the high risk people and also to study the transmission of mechanism of Nipah. And we are also launched the AIS platform to integrate all data to predict future Nipah outbreaks. And then another important point I can mention you in this platform is that EpiForm. And EpiForm is the name of the program in which the Department of Health in Kerala is associated with the Disaster Management Authority and the Ministry of IT and the Government of India. And recently, we are also planning to face of a study to analyze bats' behaviors using, I already said, drones, the behavior of bats in that areas. And in this study, we partner with IIT, Chennai, ICMR, and also ICMR NIE. And so another point is that the real-time surveillance to e-health. E-health is one of the main platform for the health department, government of Kerala. And also, I already said IHIP. And one of the digital platform initiatives as a part of Kerala State system improvement, Kerala Health System Improvement Platform. And this program we already launched. And so EWAS, Early Warning Alert and Response System. We can also use that to quickly detect and respond to disease outbreaks, and all including Nipah and also other health emergencies. And the e-health is also developed another app, that is PH app, public health app, which can be used for the field level workers, that is JPHNs, HIs, MLSPs. They can use the app and also implement the outbreaks in a proper way. It enables the real-time reporting and also unusual events, not in Nipah, all unusual events or symptoms, clusters, and the communicable disease outbreaks from the beginning, from the field itself. And another point is that the GIS already mentioned, enable GIS platforms based on hotspots, mapping of hotspots of all communicable diseases, outbreak locations, and also outbreak prone areas such as the bat roosting sites, areas with the high vector density areas in Kerala, in almost all the 14 states. And enable the tackling of logistics and also the community consumables, ensuring better supply chain management also using the technology, and which helps the tracking of birds, HR management, and also to tackle the outbreak proper manner. And so learning management system, one of the important part of this, that using the technology enhanced surveillance system, including the community level survivors. We already had 2.5 lakhs of volunteers we selected as a part of One Health mission and trained them to report in the community level. Our local self-government is very much important in this part, and they trained, they engaged all the community volunteers in this part. That is also important for this, in the future outbreak of the Nipah and all other community diseases or epidemics. Thank you.
Thank you very much, madam. That's really an impressive piece of work that you just shared. I would now move on to the state of Madhya Pradesh, and we have Bindu Sharma, madam, who's the principal chief conservator of forests. So, madam, the question to you is that during the past several years, the world has experienced multiple infections spilling to humans from wildlife. Examples are again Nipah virus, influenza, SARS, Ebola, etc. How do you intend to use technological tools for enhancing surveillance at human animal wildlife interface? Over to you.
Thank you, Nivedita ji, and distinguished speakers on the dais and respected audience here. In the state of Madhya Pradesh, we call it, everybody knows it as a tiger state, and we harbor 750 of them. And we use M stripes, which is an acronym for monitoring system for tigers. In wildlife, tigers, they are said to be, they predict the health of the entire ecosystem. They are the flagship species. So monitoring the tigers through M stripes, we use this technology. This is an Android-based mobile app, and we collect field-based data via GPS with a central desktop and web-based analytical tool. The system collects information on patrols, wildlife crimes, also human wildlife conflicts. And this is a collaborative project between NTCA and Wildlife Institute of India. M-Stripes has been, it uses GPS system, GPRS and remote sensing to collect information from the field. During the past several years, world has experienced so many infections spilling from humans to wildlife and vice versa, as we discussed Nipah virus and all this. Role I see of technology is we have nearly 15,000 forest guards who are our frontline staff, and they are using this M stripes. We are not reinventing the wheel, but what we need to work is on expanding the scope of this, the GPS enabled patrolling tool. Along with the logging tiger signs, the same app should allow guards to log signs of abnormalities and diseases across other wildlife. For example, if a forest guard finds a carcass or a sick animal, he can take a geotagged photo, and instead of that data sitting simply in a file, it immediately pings the veterinary officer at the nearest clinic. We are also using camera traps to identify diseases remotely. But the key is interoperability, that is linking forest mortality alerts directly to the district health officer. That will ensure that we manage risks in the jungle before they hit the villages and the human population. We also need to plan for National Referral Center for Wildlife. We need support from Wildlife Institute of India and IVRI Center for Wildlife for diagnostic support. That's all I have to say. Thank you.
Thank you very much, madam. We would now move on to the last state implementer panelist from the Union Territory of Puducherry, Shri Chaudhry Mohammad Yasin sir. So, sir, the question to you is that Puducherry experiences significant outbreaks of vector-borne diseases every year. Do you have any experience of using technology in enhancing surveillance for vector-borne diseases? Over to you, sir.
Right. Thank you so much, Dr. Gupta, esteemed panelists who joined us here today, participants, attendees. Firstly, I must commend Team ICMR for this wonderful program. I think even in my limited service career, this is the first time I'm seeing, a dozen odd sectors and departments and ministries coming together under one roof. Never before have I seen such a gigantic mammoth effort in this direction. So kudos to that. I I'll speak as an IS officer, as secretary of the departments of health, agriculture, and animal husbandry from Union Territory down south, while also drawing upon my cross-sectoral experience in the past years. But the question I want to ask first is, why are we here? Why did it urge us to put together a dozen departments and ministries and have this deliberation, this one nation, one health assembly? It is maybe COVID, the Nipah virus or the Zika virus, and the repetitive outbreaks which are scaring us. And uh, it is essentially the fear of what next, the fear of the unknown, and how you all as scientists and we all as policymakers go about deciding our next step to prepare for that unforeseen what's next. And it is at this stage, where we try to see, let's put technology at our disposal. And what does our experience tells us? And let's just look back at COVID. I was actually MD NHM JNK during the three COVID outbreaks. And more than anything, what I do realize is being inundated by a whole lot of apps. I mean, let's also understand that technology, when not done right, usually ends up being a host of replicated stuff, which actually becomes too much to handle. At one point of time, there were more apps and portals being created than the number of data entry operators available to fill it. What leads us here to understand is that this data is as good as how much expansive it is, how much genuine it is, and this is where the whole thing comes down to. There are three things that you can use technology effectively for in tackling even vector-borne diseases. That's primarily data collection. That is, we are using technology to expand the mechanism of how we can collect data, so that we can reduce the human effort there. And the data harvesting processes, maybe harvest data out of whatever is publicly or easily available online or elsewhere through existing database systems, and then data analysis, what we do with it. Now I remember when IHIP was first came up, and IHIP is possibly the most successful example of a distributed data generation and data collection system, which is also analyzing. And this was when I, as MD NHM, was having a hard time convincing hundreds of our paramedics to, in addition to whatever they were doing regularly, to also punch those SL and P forms, just so that people at the top could have a look at the bigger picture. It did make sense back then. I was one of those people who was being very pessimistic about IHIP. But I remember now, like 5 years down the line, as Secretary Health on the other side of the country, I I realized that it's actually making sense and it's actually coming to use. I mean, we are regularly predicting everything from dengue to diarrhea and whatnot with IHIP. So technology adoption is what's next. What actually makes the whole thing come true: the data collection, the data harvesting, and the data analysis. And just to answer the actual question, we in Puducherry have been trying to focus on vector-borne diseases a lot. I'll take you back 200 years. Basically, the French, so Puducherry was a French colony, not a British colony, and they instituted something called, they started something called the École de Médecine de Pondicherry in 1823. And the reason they did that was because they were kind of scared of the new diseases they were facing whenever they were arriving into the subcontinent. And they felt, the European scientists and doctors felt that they needed to study all of these diseases a lot more because they're going to be carrying them back. So just fun fact, 200 years down the line, that ecole is what we call JIPMER today. So Puducherry, as the medical hub of South India, has been, focusing on tropical medicine, and the ecole was actually in the, first 100 years of its history, was famous for generating the most valuable tropical medicine knowledge in the world. Uh, so it's intrinsic to us, and same is the case with, say, Kerala and a few other South Indian states. Uh, we are also privileged to have, apart from JIPMER, the VCRC over there. So there's a lot going on. I must add. So we are very proud of something called the Dreams app. It's a joint effort by the Department of School Education and the Pondicherry University and VCRC. Dreams stands for Dengue Reduction Through Education Awareness Monitoring in Schools. And this is where we tap into expanding the data collection system by roping in hundreds and thousands of school children, by telling them that, okay, you are distributed across the UT, you are best placed to identify the stagnant water sources. Go do this and help us in keeping your family safer, and it works. We also run a very effective dengue disease hot map, which is basically a dashboard, which is GIS based, and it has effectively helped us detect not just dengue but also scrub typhus. There's also a dengue early warning system, which is integrating meteorological data as with the disease data. And in fact, in Tamil Nadu, there's a RE season, which is like the pre-monsoon season, when it gets so hot and humid that the disease outbreak maximizes. And we've been effectively able to say spurn on indigenous knowledge about the seasonal disease cycles, which are now corroborated by our research outputs as well. But also we are now focusing on not just software but hardware. So whenever we are beyond drone surveillance, we also are trying out drone based fumigation, drone based oil diffusion through the municipalities, through the local area development. But of course, I see that a lot of it is going to be AI based, as our panelists pointed out. And in diagnostics particularly, especially, say, rash identification and stuff like that. But within our research institutions in Puducherry, we've seen a lot of work on data modeling for disease spread based on different parameters and statistical analysis. However, there have been clear-cut advances, I must add, on phytogenetic analysis, nucleotide sequencing, and even strain evolution prediction. So this is what I, as a policymaker, feel is what we should be sponsoring ahead, be it for R&D or for implementation. And of course, this can only and only be successful if it is done in an interdisciplinary matter. Thank you so much. Thank you.
Thank you very much. And with this, we come to the end of this session. And I would earnestly like to thank each of the esteemed panelists for sharing their nuanced understandings, and also the state implementers for sharing what you are doing in your states and what further you would like to see happening. So I think if all of us, as we have pledged to work together, we really would be seeing more and more technology coming into surveillance and enhancing the disease detection capacities that we have. So with this, we end this panel by thanking each one of you for very valuable insights. Thank you so much.
Thank you very much to the distinguished panel. The ecstasy of erudition into the brainy skulls could be well seen throughout the session in the applauses that were being rendered and the smiles and the nods that were constantly coming up. So thank you very much to everybody for being such an active participant, being with us throughout this long day. And we'll take you right away to our next session, which you all are very energetic and enthusiastic about, I know. Quickly, the days shall be ready to welcome once again an erudite panel for the plenary session on joint outbreak investigation. All right, ladies and gentlemen, please mark your presence as we now welcome the distinguished members for the session. Please put your hands together and welcome Miss Anu Nagar, IFS, the Joint Secretary, Department of Health Research, to now grace the dais. A very warm welcome, madam. Welcoming Dr. Ranjan Das, the Director, NCDC, to please grace the dais. And a very warm welcome to Dr. Clement Ben, IFS Secretary, Central Zoo Authority. And I want you all to pour in some energy as we unfold this session of plenary addresses on joint outbreak investigation. With no further ado, may I please invite you, Madam, Ms. Anu Nagar, the Joint Secretary, DHR, to please take forth the session proceedings. After the panel makes the plenary addresses, may we please invite the expert panels and the state perspectives. And if you suggest otherwise, we shall do that.
Thank you very much. And we'd begin this session and welcome to the esteemed panelists. And I think we start with a small presentation, each one of us, and then as suggested, we'll call the experts. So I'll take this privilege of starting first. Thank you. A very good afternoon to you all. I know this is the last session and most difficult to bear, but I'll try to make it quicker, but and I'll also try to cover whatever I've been trying to say here. Can we move on to the next slide, please? Forests in India. We have one of the 18 megadiversity countries with 4 global biodiversity hotspots. India hosts 8% of the global biodiversity in just 2.4% of Earth's land. It contains 4 of the world's 36 biodiversity hotspots. We have 106 national parks, 573 wildlife sanctuaries, 115 conservation reserves, 220 community reserves. We have more than 45,000 plant species and more than 91,000 animal species in the country. These forests provide us essential ecosystem services like regulation of climate, availability of water, and recreational services, spiritual services, which all play a very crucial role in health security of the country. When we talk about forest degradation and disease, the degradation of forests leads to wildlife spillover and increasing human outbreaks. We know that 75% of the emerging diseases are now zoonotic in origin, and 60% of the pathogens that cause human disease originate from domestic animals or wildlife. The recent examples that you can actually link to is the Nipah outbreak, which is linked to habitat loss of bats because of encroachment by orchards. The roosting habitat is being lost. We can talk about the KFD disease, which is tick-borne viral fever associated with fragmented forests in Western Ghats. And because of the fragmentation, there is a closer association between the ticks, monkeys, and humans. And then is leptospirosis, which is caused by flooding and urban deforestation, which increases the risk of leptospirosis, a disease spread by bacteria in the urine of infected animals, including rodents, livestock, and pets. As the ecosystem is disturbed, the number of these species increases and it becomes a risk factor. Biodiversity loss is equal to increased disease risk. Higher biodiversity reduces disease transmission by distributing pathogen load amongst low competency hosts. We have seen that in the fragmented forests, ticks increase to 4-5 times. The habitat loss causes rodent populations to surge. Climate change alters vectors distribution. So Aedes mosquito is now seen at more than 2100 meters altitude in Himalayas. India has been trying to address all these issues, and we have many policy instruments at the international level. We are signatories to Convention on Biological Diversity, which talks about reducing zoonotic spillover by protecting ecosystems and biodiversity conservation. We are a party to IPBES Global Biodiversity Assessment, which calls for ecosystem-based health security. WHO, FAO, WAH, and UNEP agreement standardizes One Health surveillance across nations, and the Sendai framework integrates zoonotic pandemics into disaster management. We have number of policies and programs in India which talk about habitat conservation and revitalization. Our National Health Forest Policy 1988 focuses on ecological security over commercial exploitation. We have a robust national environmental policy which supports climate resilient economic growth. We have a very big protected area network. Today in the morning, the secretary said that we are adding 3 protected areas per month over the last 10 years, which is a very commendable number. Then we have a national action plan on climate change, which has about 8 national missions, including the solar energy, Green India mission, and sustainable agriculture mission. It's not. Then we have key projects and programs. Project Tiger, my batchmate and friend Bindu just talked about. We have a mangrove program, a large-scale mangrove restoration program. We have the Green India mission, which talks about enhancing forest cover. We have Project Elephant. And for the biodiversity, we have a Biological Diversity Act, which reinforces biodiversity conservation in the country. So coming to the integration with National One Health Mission, it is very important that the forestry sector also adopts this, and it is already an integral part of this mission, and it has been working on capacity building, technology enhanced surveillance, development of countermeasures, use of digital tools and data integration. And some of the important areas has been integration, working with DHR on joint forest health surveillance. So there is a surveillance at sanctuaries and national parks. With Animal Husbandry Department and ICAR, MOEF has been working for livestock buffer zone management in the forest fringe areas. With the Department of Health and Family Welfare, Ministry has been working with on the rabies elimination by 2030. And with NCDC and the state forest departments, there is an effort on real-time wildlife mortality reporting. Also, it's very important that the communities living around the forest areas need to be weaned away from the forest, and there has to be a lot of emphasis on livelihood promotion. So there is also a very strong linkage on working with the rural development and the agriculture sector. Let me take you through the surveillance and early warning systems that have been used. Use of GIS has been started by the Forest Department long back for forest fires, and all the divisions all across the country up to the forest guard level receive text messages whenever there is a forest fire. But it is also being used for identification of deforested patches, animal movement near settlements, and bat roost proximity in Kerala is one of the examples, for identifying disease and vector hotspots, and for identification of wildlife corridors to avoid fragmentation. There has been an emphasis on the environmental surveillance. surveillance of soil, water, carcasses to look for pathogens of interest. Wildlife health and surveillance in forest areas and zoos has been also undertaken. And from Madhya Pradesh, it has been mentioned that there is an app called Stripes, which actually monitors all these things, and this can the surveillance part can easily be integrated into it. And then there are predictive AI models. One of them has been the Kerala Nipah hotspot algorithm using bat movements and climate data. As I said, community engagement is the key element because India's tribal and forest range population is about 100 million, and it's very important to provide them alternate sources of livelihood. They can be used as cross sentinels in early outbreak detection. We need to strengthen the forest management committees for surveillance and reporting outbreaks. The frontline staff and forest watchers can be given an app like Stripes. There can be incentives for reporting unusual wildlife mortalities. Tribal healers can be integrated into the surveillance system. One of the successful examples has been in Maharashtra, where Worli tribal community has been trained for snake bite and zoonosis reporting. There is also a need for emphasis on the capacity building, including training modules for wildlife and health surveillance and forest health data sharing. So in this, I propose that Wildlife Institute of India can take a lead role and can be developed as a center of excellence. And there is also need for awareness on One Health to the local communities. To just sum up, I would say that there are 6 principles that we need to work on. The first one being strengthening ecosystem and biodiversity conservation. We have very good programs in the country running them, and we need to strengthen them. The second is enhanced integrated surveillance. There is a need for wildlife disease referral centers, which are already in the making. And I also think that there are many VRDLs, representatives from VRDL sitting here. Like we have virus research and diagnostic labs for human disease, there can be such labs established all across the country for wildlife also. We need to integrate climate resilience, and there has been a session on meteorology, and we can have models on risk assessment, early warning for floods and droughts. Uh, then there is a need for advanced research and capacity building. As I said, the WIA, the Wildlife Institute of India, can be developed as a center for excellence, and we can also make use of the BSL-3 network in the One Health system. There is a need for community engagement and sustainable practices. We need to promote awareness and sustainable land use practices to reduce human-animal conflicts and ecosystem degradation. And finally, there is a need for greater interministerial collaboration. We need to integrate, even at this district level and state level, all the departments that work together and strengthen our joint outbreak response teams. Thank you.
Something more is there? The process. Yeah, right. Respected PSA, Professor Aziz Sood, Dr. Bahal, Dr. Vinod Paul, and dignitaries present over here, scientific community, and ladies and gentlemen. So I'm here to give a perspective of the role of Ministry of Environment and Forests. I'm currently holding the position of Secretary, Central Zoo Authority, which has been notified as the nodal as far as the ministry is concerned to coordinate the One Health mission. Next slide, please. So here the role as far as the triangle of the human population on the one side, the wildlife and the livestock. These are all the three corners wherein the principle of One Health mission operates. So coming to and back an introduction of the Central Zoo Authority, it's the regulatory authority created by the parliament of the country, and it does the evaluation, the recognition of captive zoo facilities of the country, and we have close to 156 recognized zoos, and many are in the annual getting recognized. Private zoos are coming in a big way in the country. Exotics are coming in the country in a big way, and we, based on the zoo rules 2009, we evaluate and recognize them and monitor them. The financial assistance we provide is very minimal, and of course we provide the technical inputs to them. Yes, after this March 3rd meeting convened by the Honorable Prime Minister of the country, who chaired the National Board of Wildlife, he announced the creation of the National Referral Center for Wildlife to be established in the state of Gujarat, to be specific in Junagadh, and the infrastructure is coming up, and maybe by December next 26 the structure will be there. Meanwhile, we have started recognizing, establishing 6 regional centers across the country, and we have already started coordinating with the state forest departments, particularly the chief wildlife wardens of that country, in collating data and analyzing. Yes, the rescue, as far as the man-animal conflict is concerned, is coming in the day in and day out job for the frontline staff of the forest country, for the forest department of the country. Yes, conservation leads to conflict. We are in that phase now. The conservation has led to conflicts across the country, Eastern Ghats, Western Ghats, Northeast. Everywhere animals are venturing out. Few contributors, maybe the climate change is pushing these animals out. There are many factors added to that, and highlands are create the land use change in the form of leveling highlands into agricultural lands. That's attracting wildlife coming out of its natural habitat, this creating conflict like situation. And when our personnel handle this wildlife, maybe One Health has an angle to it. So these are all the broad things. So this is a map which talks about the distribution of the different types of zoos in the country. Moving to the next slide. Here it's a facility, it's a fixed facility there, and it's a semi-controlled system where this animal is in close proximity with humans as such, where the symptoms and the diagnostics can be done in a better way. And by that, surveillance can be done, and the preparedness will be there for future onslaught in a big way. So zoo is a facility wherein these things can be studied and implemented in a relatively better manner. So the core pillars being the disease monitoring framework of a zoo. We can do the capacity building in a better way because all these facilities are manned by senior forest officers who has a wildlife hospital facility there, and vets around, and animal keepers are also around. So we have a network of facility all across the country, and when One Health mission has to be implemented better, the zoo facilities should be taken into account. And there is intersectoral collaboration also, and the vision for integrated surveillance. These are all the broad pillars in a zoo facility. So recently, this episodic events happened in a big way in this year itself. So here is a tabulation of that. Maharashtra. So we have tiger, leopard, vulture, crow, hawk, and egrets. Madhya Pradesh from pet cats. Rajasthan, demoiselle crane, painted stork. Bihar, crow. Goa, jungle cat. Uttar Pradesh, tiger cubs, leopards. New Delhi, the recent one in the month of August 2025, we have this outbreak of avian virus influenza. We thought it's from a captive animal. It's not so. We have a water body inside, and the painted storks is a migratory bird coming outside, and the source is determined to be the painted stock. So which doesn't have any boundaries or barriers. We can't stop the migratory birds visiting our country. We have a lot of wetlands and water bodies in our protected areas. They will be the source of infections in the days to come, and they have to be manned and monitored. This can be a mandate under the One Health mission in the days to come. Yes, foot and mouth disease in the cartridge shoe of Pune, and the avian influenza outbreaks in Gorakhpur and Kanpur facility. This is a case study. I'll rush through the slide actually. So maybe what we did was, and ministry appointed a committee under my chairmanship, and we worked on that and submitted a report to the ministry. We isolated the affected aviaries in the facility. We closed the zoo for close to 2 months, and November 1st it was opened again to the visitors. Disinfection of high risk sections, and we had a coordinated action between the zoo and the Central Zoo Authority in the Department of Animal Husbandry and Nizad Bhopal. So we worked together and compiled this report for preventive actions in future. So these are all the tabulated information. I will not go through into the details. And we sampled from symptomatic painted stock, and the sampling from the aviaries and the environmental sampling from the zoo we carried out. And there is a scope for integration with the National One Health Mission as far as the zoo facilities are concerned. The diagram shows about the 16 odd institutions. During my service at least, never we always worked in silos, never there was an interaction. And under National One Health Mission, the 16 odd ministries are coming together. That's an uploadable effort from PSA. And we are in the process of updating the zoo management information system, wherein maybe the disease monitoring will also be carried out, and it is already getting upgraded, and they can be interacted with the One Health mandate, our zoo MIS system in future. And these are all the priority pathogens. I will not go through the details. And everybody talked about maybe pathogens coming from wild stock to humans, but there are examples from humans also. It's reaching wildlife. One example is tuberculosis from an elephant camp in Mysore. So things are happening the other way all around too. Yes, broadly the tenets of NRCW, it's a surveillance, response, prevention, and preparedness, and close to 100 crores has been sanctioned for this, and the infrastructure is coming up at Junagadh, close to 80 lakhs, the remaining for establishment and strengthening of the regional centers and the zoo facilities as far as monitoring and surveillance of diseases are concerned. This is how the federated data, the data sources, the input data, and the data analytics and the output data and reports can be generated. Again, a different mandate of us as per the provisions of the Wildlife Protection Act 1972 is the conservation breeding program. So we have started shortlisting 76 endangered species, and these facilities are also upcoming in across the country in many of the states. So structured breeding and release plans are there. So healthy population reduce abnormal immune suppression and pathogen amplification. This is a very important role as far as conservation breeding is concerned. A normal wildlife population in the wilderness is the one that we should aim for. If the one species is taken off from the ecological fabric, there will be a lot of maybe effects across the board. So maybe the normal population has to be maintained. That's why monitoring should be happened. And if an endangered species number is less, we should go for conservation breeding and strengthen that population and restocking in the wild. That's how we are. That's what we are planning as far as the conservation breeding facilities in this concerned. So the long-term impacts are strengthened. It strengthens ecosystem health and species resilience, reduces wildlife, livestock, human conflicts interfaces, and it enhances India's global leadership in science-driven conservation health. So these are all the things I have to add. I'll be happy to take questions if any after this session. Thanks a lot.
Thanks, Dr. Ben. Thanks for bringing into focus the zoos management in India and how they can be integrated under the One Health mission. So while we have both talked about the forestry sector and their integration into One Health mission, The key organization responsible for surveillance and for outbreak management in the human sector is NCDC in the country. And we have the director of NCDC, Dr. Ranjan Das here. So I request you to make your presentation. Thank you.
Good evening and very warm welcome. Thank you, co-panelist, and thank you, Dr. Rajiv Bahalji, Secretary DHR and DG ICMR, my distinguished colleagues, experts, students, ladies and gentlemen. So operationalizing this One Health, we have added one new chapter to it, that is the joint outbreak investigation and response. In this became very important since the approach of One Health is that we have to be collaborative, we have to be multisectoral in our approach and transdisciplinary, recognizing the interconnections between humans, animals, plants and environment, and we are doing it at the local level, regional level, at national and at the global level. And outcome is that we want to minimize our response times and achieve optimal health. After all, this is Vasudhaiva Kutumbakam, as has been already mentioned by all our expert dignitaries, the honorable secretaries, and various colleagues. So we have got multiple actors in it, and taking this into account and noting that, as the Secretary Health Madam mentioned in the morning, that we had incidences like in the Buldana incident, the skin and hair loss in Pune, and the pan-endemic encephalitis in Kerala, and various other such instances. The state and the district RRTs that we had earlier, and sometimes the central investigations teams that we had, actually needed one additional component, that is we have multidisciplinary to save the times and to reduce our response times. Hence this NGRT, National Joint Outbreak Response Team, was conceived in the year 2024, and subsequent to that we have had approximately 19 visits to the various states and UTs wherein the joint investigations have been actually carried out. And this is the NCDCs, actually we were already working on it and we have a couple of programs. So uh, the no, the focus of the National Outbreak Response Team was the outbreak response, and for it we have our 4-step actions in place, which is the first and foremost, we have to get the alert generation. This alert generation we are having through our IHIP portal. We are having it from the media scanning tools as well as the community reporting tools. And once the thresholds are reached, the signals are sent, and subsequent to which the NGORT is put into place. The orders are issued through the Office of the Director General of Health Services, Government of India, under the Ministry of Health. And after that, the field epidemiological investigations begin. And we have our SOPs already in place, and they are also being developed further. So after this, the team starts moving, then also before that we have got a briefing session, and we take a daily report through the VC also, and wherever it is feasible the teams meet physically, and subsequent to that of course there is a debriefing session. And when the team is in the field, we usually have multiple members, as I will be mentioning, who are usual components of that particular National Joint Outbreak Response Team led by NCDC. And we then also have the collect samples. It could be human samples, it could be animal samples, it would be environmental samples, and of course the food and water samples. So all this sampling, one of the key factors that is relevant for the outcome and efficiency of this NGORT is that Our transportation of the samples, what samples will be collected, how they will be transported, how fast they will be transported, to which labs they would be transported, that becomes very, very important. So we already have pre-identified labs, and it is also very important for all of our distinguished guests, including the students, to understand that we need to have at least 2 to 3 laboratories identified simultaneously where samples can be sent. This is particularly important so that in case there is discordance between some sample reports, so that we can have the harmonization of the reports and most important is that the from the alert generation to the final getting of the reports and the initiation for the final response being initiated, that should be minimized. And we had recent couple of meetings very recently under the guidance of the secretary DHR as well as other senior colleagues of various ministries, and we should aim that it should be within 48 hours from the beginning of the alert to the initiation of the first response. So these are our usual mechanism that we have. So we will skip this part, and these are the rapid response functions that again we will skip also this part. So the finally the response joint outbreak response team, it has to be efficient team, it has to be intersectoral, and it has to be, we do have administrative challenges, we are sorting those out, and we do also have resource constraints, communication gaps are there, they are going to be sorted out. And so one of the very important components of this NGORT is that whenever it is activated, we need to have a public health emergency operations center or the command center. We sometimes also name it as the strategic health operations center or the shock center. So once these are, and this is a small list of the current and the usual members that we usually have is from the besides the Ministry of Health, we also have from the Department of Animal Husbandry, ICMR, ICAR, Ministry of Environment, Forest, FASAI, Ministry of Jal Shakti, and even other components. And as a part of this, we also conducted a Vishanu Yudh Abhyas, as have been already mentioned by expert colleagues earlier. So the events that we usually use for our alert system for the NGORT to be activated, we have got a watch phase, we have got an alert phase, and we have got an awareness phase that is inbuilt in our IHIP system. And we have got logarithms already built in, wherein we have got a threshold for the 30 plus disease conditions, and more conditions are being also added to it. The lesson that we have learned through our NGORT, that besides the integration that we already have, which has to be technology enabled, which has already been mentioned by my previous speakers and my colleagues, we also need to have do the rapid identification and including the laboratories, and we need to have a coordinated response, a cross sectoral collaboration, and community engagement and training, which also includes the debriefing, including of the community, and identifying the areas for improvement. So with that, I will just come to an end. If you have got any questions, I will be taking them with the permission of the chair. Thank you so much. Jai Hind.
Thank you, Dr. Das. Would you like to invite the experts? Thank you, Dr. Ranjan, for explaining the role of NJORT and how it has been functioning. I'd also like to inform the gathering that under the guidance of Secretary DHR, we've also had 2 mock drills, which you talked about, one in Rajasthan and one in MP, which has helped us refine our guidelines and our actions to be taken during an actual outbreak. So thank you. Please.
Ladies and gentlemen, please join me in extending our earnest sense of gratitude to the esteemed dignitaries on the dais for steering a truly thought steering, and an insightful session of plenary addresses. A photo up here culminates the first segment of plenary addresses, taking us to the final segment of deliberations lined up for the day. Thank you very much. And right away, we begin inviting the luminaries who'll take forth the panel discussion. We are just getting the days decked up with a few more seats. And just to draw the kind attention of all the presenters for the session, we request you if you could use this podium. This has a laptop and that might just make it easy to traverse through the slides. So now inviting the esteemed moderator to take forth this session, Dr. Praveen Malik, the Commissioner of Animal Husbandry. Ladies and gentlemen, with your warm welcoming round of applause, requesting Sir to please grace the dais. The esteemed session co-moderator, Dr. Simi Tiwari, the Joint Director, NCDC. Welcoming you, Madam. The expert panel members. Ladies and gentlemen, please welcome Surgeon Vice Admiral Anupam Kapoor, NM, the officiating DG AFMS, with an energetic round of applause. We also welcome Dr. Himanshu Chauhan, the Additional Director and National Program Officer, IDSP NCDC. Warmly welcoming Mr. Sunil Sharma, AIG Wildlife, Ministry of Environment, Forest and Climate Change. Welcoming Dr. Manoj Murhekar, the Director, NIE Chennai. Welcoming Brigadier M.M. Ramachandra, the Director, National Security Council Secretariat. Welcoming Dr. Michael Friedman, Duke, NUS, Singapore. Welcoming Dr. Guru Rajesh Jami, the Senior Health Specialist at the World Bank. A very warm welcome to the expert panel members, and bringing the state reflections with them, we'll be joined by Dr. Lakshmanan, IAS Mission Director, National Health, to reflect on the state of Assam. Warmly welcoming you, sir. Also very warmly welcoming Dr. Pramila Barlal, the Additional Director, Public Health, Government of Odisha. A very warm welcome, madam. And finally, ladies and gentlemen, to bring the perspective from Rajasthan, we are joined by Dr. Bharti Malhotra, the Senior Professor, Microbiology and the Additional Principal, SMS Medical College, Rajasthan. Welcome, madam.
So, a very warm welcome to this uh, last session. And it has been a long day for all of us, but a lot of learning for today's regarding One Health and what exactly is the One Health approach to exactly set in the joint outbreak response for any emerging threat at human animal interface. So, I extend a warm welcome to this distinguished panel of experts and my senior and colleague, Dr. Praveen Malik sir, is a moderator here, and we have been working together for a we had a long association with Malik sir, and thanks. I just want to extend my sincere thanks to Anu Nagar madam and Malik sir and the uh, uh, wildlife representative here, who is a core uh, partner in setting the true One Health response at human animal interface. So, the today's panel session is taking in line that how the uh, practical actions are taken whenever any emerging threat is there at the health sector, not only at health sector but also in the animal health sector. So we have built in some of the questions from this distinguished panel of expert. I would like to request the colleagues to give introduction of the panels. So can you please display the slide here? Or
During the panel itself, we'll say who is who. Already they have.
I would request Praveen Malik sir to give a brief introduction of the panel.
Thank you very much. A very good evening to all. And it seems will be the last one between you and dinner. So we'll try to finish it as quickly as possible. But at the same time, would like to justify why we are here. In fact, when we talk about the pandemic preparedness, we just talk about a model called predict, prevent, detect, and respond. The response probably is the last thing, and that's why they probably have kept it at 6 o'clock in the evening. So, nevertheless, it is the last mechanism which actually is the activity seen by the public by the for the response to any pandemic, any epidemic, any outbreak. So this is going to be very, very important, and the kind of panel we have got, starting from the armed forces to the human side, to the wildlife side, to the uh, international exposure on the response mechanism. So we have got a wonderful panel here, and also some insights. When we are basically having this response mechanism, we need money. So that funding support, those kind of insights also will come from one of the panelists here. So welcome all the panelists to this wonderful panel. Would like to start with the interaction with the first one. We have got Admiral Anupam Kapoor from the Directorate General of Armed Force Medical Services. So would like to request your insights on the processes you utilize to collaborate with different sectors, including health, livestock, wildlife, during the outbreak situations. How generally the armed forces, they basically interact with all these civilian sectors and have the best of the response mechanisms in place. Over to you, Admiral Anupam, sir.
Thank you, sir. And at the outset, let me thank the organizers for having provided the Office of DGAFMS a platform to be here and to be a part of this very august forum. The armed forces have got a multi-tiered health structure, and let me give you a brief introduction into that to answer this question. Now, the health of our troops, be it the soldiers, the airmen, the sailors, is of paramount importance to us, because that's when they will be able to meet their uh, operational objective. And for monitoring the health of the military personnel, every military station is normally covered by public health experts along with their trained paramedical staff, or allied healthcare workers as they call. And this team is generally trained at the Department of Community Medicine at the Armed Forces Medical College, which hosts a separate entomology division and a public health laboratory. The primary objectives or the responsibilities of these station health organizations, as they're called, includes continuous monitoring of the health status of all personnel in their area of responsibility, maintenance of hygiene and sanitation standards across the military installations, and also maintaining a rapid response capacity during the localized disease outbreaks. Additionally, it is these SHOs which maintain a regular liaison with the local civilian health authorities to coordinate any public health initiatives. Now, very similar to the National Joint Outbreak Response Team, which has been just spoken about, the armed forces had taken an initiative way back in 1997 when they came up with the Armed Forces Central Epidemiological Surveillance Center, which was placed at AFMC, which maintains a multidisciplinary team comprising of specialists from community medicine, of course, infectious disease specialists, virologists, microbiologists, and other medical specialties, along with entomologists and allied healthcare professionals. Now, this team is tasked with investigating disease outbreaks and providing the epidemiological support and technical guidance during any outbreak situations across any military installation. So, in effect, the initial investigation is done by the station health organization, and if an outbreak is confirmed, it is the AFSEX which is activated along with the health vertical in the office of DGAFMS. The health vertical in the office of DGAFMS is the one which maintains close liaison and collaborates with the EMR division of Ministry of Health and Family Welfare, NCDC, NSCS, ICMR of course, and DRDO for any situation which is warranting a national response on issues of biosecurity. As far as the capacity building is concerned, the Armed Forces Medical Services is constantly collaborating with the ICMR and has established various BSL-3 labs and is in the process of establishing few more. The VRDL labs, including some in, which are planned in far-flung areas like Leh and in the northeast. The AFMS has a wide network of almost 134 hospitals across the length and breadth of the country. And amongst these, over 20 have various advanced diagnostic capabilities like the point of care multiplex PCR, etc., that we were talking about earlier on, for rapid diagnosis of any viral, rickettsial, or bacterial diseases. Now, the armed forces depends quite extensively on various animals like dogs, mules, horses, and livestock for various reasons. And for ensuring the health of these animals through vaccinations, routine screenings, and therapeutics, it is important to protect the health of the handlers as well as to prevent the zoonotic spillovers. Now, to deal with this, we have a separate dedicated corps known as the Remount and Veterinary Corps, the RVC. And it's there, they are comprised of veterinary doctors and other related specialists like immunologists, pathologists, microbiologists, etc. And it is these specialists who are available in the various large military stations who look after the health of the animals in consonance with the station health organization. These veterinarians are also in close contact with the local and the state Animal Husbandry Department. At the central level, the Director General of the RVC is on board with the National One Health Mission and maintains close liaison with the Department of Animal Husbandry and Dairying. The Central Military Veterinary Lab in Meerut is the point of reference for matters concerning the armed forces. Now, thus, there is, it's what I'm trying to put into place is that there is an organization at the local level, which is the SHO, and there's an organization at the central level, which liaises with the various ministries. Representatives from the Armed Forces, Medical Services, and the RVC participate in numerous interministerial committees and forums, thereby strengthening the national health capability. The COVID-19 pandemic exemplifies the success of this collaboration, where the armed forces responded with the rapid establishment of 5 dedicated COVID hospitals with provision of over 1,400 doctors, nurses, and paramedical staff to run these hospitals, demonstrating the availability of this rapid response. Some other examples where we've collaborated as a civil and military support is, we were the first ones to investigate way back, of course, the first outbreak of chikungunya in Kerala, typhus outbreaks in Darjeeling, and very recently in Aurangabad in Maharashtra, suspected plague and tick typhus outbreaks in Shimla. These are to name a few. The limited, time available. There are many speakers, so I'm not getting into a detailed discussion about this. But there is a collaboration in place, and this fusion of civil and military collaboration has yielded numerous very valuable learning experiences. In fact, we've been a part of this Vishanu Yuddha Abhyas, both the 1 and 2, and we've been observers in these, and we have had wonderful inputs as well as takeaways from both these exercises. So thank you for this opportunity just to introduce you with the collaboration.
Thank you, Admiral Saab. It's really enlightening to understand the wide network of the services from not only the human side, from armed forces, medical services, but also from the animal side in terms of remote and veterinary corps, the RVS. It's really wonderful to know that, and the kind of collaboration, because sitting at DHD, at Department of Animal Husbandry, the kind of interaction we have got with the remote veterinary services, it's really meaningful. So thank you very much for your insights. Now, going back to the originator of these response mechanisms in the One Health mission is NCDC. In fact, National Center for Disease Control under Ministry of Health and Family Welfare, we have got a panelist here, the Additional Director, Dr. Himanshu Chauhan, and would like to request you from your understanding, because you are running this integrated disease surveillance program, which is basically responsible to activate the national joint outbreak response teams in the system for responding to any outbreak throughout the nation. So it's quite a challenging task. I can understand, keeping in view the kind of responses from Assam to Kerala to North and Northeast. Would like to understand what challenges you have faced during the activation of these NGORTs, and also the kind of lessons you must have learned from these experiences, how you suggest us how to improve these, and when it goes to the states or at the state response mechanisms, what kind of precautions we should take in activating these kind of response mechanisms. Over to you, Dr. Chauhan.
Thank you very much, Dr. Malik, for that appreciation as well as the question that followed that. So we've been hearing about, I'll take a moment to talk about IDSP. We've been hearing about IDSP, IHIP since morning, right from the time when Secretary Health, Madam mentioned about IDSP, IHIP and the key role it plays to other eminent speakers, including Honorable Member Niti, and then various secretaries and state representatives. So this program that is mandated with detection of and response to outbreaks across the length and breadth of country exists in the form of district surveillance units in each district. And given the size of the country, the number of districts, the task is huge, as has been mentioned. Not only is the experience humbling, it also fills NCDC with a sense of pride that we are handling this huge mandate that's been entrusted on us. Talking specifically about the National Joint Outbreak Response Team and the challenges that we have faced while deploying it. At the outset, I would like to thank the Ministry of Health and Family Welfare, Government of India, for taking this initiative and constituting the National Joint Outbreak Response Team last year, as the Director NCDC referred to. IDSP NCDC is mandated with coordinating NGORT deployments. That includes the decision to deploy one and also to support the team that is deployed during those incidents which require deployment. After multiple deployments, 19 is the number the Director NCDC referred to since the time when it was uh, constituted. We have learned that there is a need for the leadership of various stakeholder ministries and departments which constitute the NJORT to be sensitized to the concept of NJORT. While 19 deployments is not a small number, yet still we feel after every deployment, when we reflect upon what went well and what did not, we feel that there is a scope of sensitization from the leadership level up to the team members who constitute NJORT. We've seen that the delays in mobilization of NJORT requires that some mechanisms in the form of either standing instructions or rosters available within the departments, within the ministries. These are available with every department, particularly for supporting logistics that can help early mobilization of the various stakeholder departments. Lastly, while significant improvements have taken place, the teams are still deployed largely. The states perceive the teams as the team from NCDC, the team from ICMR, the team from DHD, the team from wildlife, and so on and so forth. The teams are not still perceived as NJORT has been deployed, or it's the one team which is the National Joint Outbreak Response Team, which has come to support the state in handling that complex outbreak spanning multiple divisions and departments. So it would require implementing One Health not just in the form of a nomenclature change that NJORT is now the new kid on the block, as they say, but its implementation in letter and spirit is what would require this concept of NJOR to be truly successful. Those are my thoughts and reflections upon the challenges, sir.
Thank you, Dr. Himanshu. It was really insightful learning for us that what are the challenges we are facing at at the NCDC while deploying the National Joint Outbreak Response Team. My next question will be to the wildlife sector panelist, Dr. Sunil Sharma. Whereas we have learned that yes, there are challenges while operationalizing NGORT, but now we would like to learn from you because wildlife is an important sector in each and every joint outbreak response. What challenges do the wildlife team face while rapid deployment of any team from their side? What are the logistics challenges you face and how you report uh, any kind of wildlife incidents to a regular setup in your ecosystem? Over to you, Dr. Sunil Sharma.
Thank you, ma'am. And first, I'd like to thank NCTC also. I've also got an opportunity to be a member of NGRT, and I have learned a lot in these handling those two outbreaks. One is the avian influenza, which happened in Alapusha, and another one for Gorewada Zoo. in which some avian influenza were detected in the wild tigers, which we never expected. As mentioned, because issue there's logistic issue, because if we talk about the forest and wildlife sector, because the area is vast, and we are living in a country where we have a large and different ecosystem, different biogeographic zones. If we see, we have one side we have a desert, and another side we see Ladakh like sector we have, and in case some incidents happen to the Sundarbans, even the mobility is the biggest issue if we have to move first. Similarly, if we talk about the human capital, because when we go for a outbreak investigation, or the person who are handling these issues, there are generally two sets of people. One is the manager who deals with the wildlife management, like protected area manager are there, and and frontline staff, so who get first response that something has happened. And second is the person who has to act there, like wildlife veterinarians. And if we talk about wildlife veterinarians, there are not much wildlife veterinarians in the country who are specially trained in this. Myself, I'm a veterinarian basically, but if you talk me to do the specialization in wildlife, maybe at that time I don't have when I did my degree. So it's a specialized job, and you don't have baseline also, like you have in domestic animal sector or in the public health sector. You have many baselines. If you want to do something, you want to know some parameters are aberrant. When we are rushing into the field, then one factor is that we don't have the manpower, like adequate wildlife veterinarians. So mostly we rely on the field veterinarians, whom we are have a close association while working in the field also. Similarly, mobility is a big issue, because sometimes outbreak happen in the deep interiors, and you have to go deep inside the forest. If I can say, some incidents happen in a Western Ghats, so mobility is a big issue there. Similarly, the communication, because I have worked in an area, like I have worked in Melgha Tiger Reserve. It was a basically a tribal area, and I quote an example. Because if there are some only two department had a presence there, major department. One was the forest, because if they have something good to say, then even the forest, and if they have some grievance, even that is put to us. And second sector was the medical, because there was good dispensaries there, good set up. And in case but there was no communication. Mobile network was not there. So if you have to go and you have to do something, then you're depending on our wireless network. Even a pregnant ladies have to send across someone some emergencies there, then a wireless message has to flash from our network that there is a health emergency, so it sends someone. So communication is an issue. Similarly, the staff is not that trained, because when it happens to wildlife, people also get afraid. They are not that technical expert. And in taking the samples, or if you have taken the samples, uh, how it has to be collected. I mean, if you have collected, and how it has to be preserved. And if it's a deep inside forest or somewhere, temperature is an issue, then what sample you have collected is of no use if it doesn't conclude something. Similarly, when we talk about the response, sometimes it happens that people take it very casually when you without even like it's a Gorewara zoo, because we never expected that a avian influenza and common tigers can report in the wildfires also. So similar respiratory symptoms, and you are going just with a mask. You never expect there are some birds that there. It could be avian influenza also. So if you have to handle it in a proper PPE kit, maybe that also a big cause which is missing sometimes. But area is vast, and similarly to address this, there's a lot of need for the capacity building also. Although NGORT is a new concept which has just evolved after a lot of deliberation, lot of think tanks come, and since 2024 we are coming to existence. So I can say NGO with the coming of the NGORT, there is a lot of promptness now, which was missing earlier. Earlier, Earlier also, we have some incidents happening. We're reporting the field vets only. We're depending on the field veterinarians, because all diseases are mostly notifiable disease. So we don't have setup there, and so we just facilitate the things there. As a protected area manager, what I can know, I can reach out. Like NCDC, you may not tap the right person who to communicate. So if a field manager is there, protected area manager is there, he can liaise and he can arrange the things on place. So earlier it was you can say raw association, but with NGORT the promptness has come. Basically, the seriousness has also come. But as Dr. Himanshu also mentioned, I also like to quote that sometimes it happens when NGORT is on the field. So state also get afraid that something something is happening has happened, so we'll also put to blame also. So that fear has also to be allayed when you're working there. And similarly, regarding, I can say, for this better monitoring and better working in this sector, there is a lot of capacity building has been done. We have an autonomous institute, Wildlife Institute of India. So almost 400 veterinarians have been trained, clinical veterinarians have been trained, because they also run an advanced wild health management course. And but it depends from state to states. It is a cost. So states send their veterinarians, field veterinarians to get trained there, and they get an exposure to the how to handle the outbreak response. And similarly, protected area managers, they also get an opportunity to do advanced wildlife diploma, so also get an exposure. But per se, as a joint outbreak may not they be aware, but there is a I can say there is a need to sensitize, because the first what we are discussing here is basically we're discussing at top level and ministry level. But if we want to get these things materialized, then it has to percolate down. So whatever association we're forging here, it need to percolate to the state level also, district level also. And who's the first responder? First responder is the community worker, basically, who has noticed this. If they are made aware of this thing, then they can promptly respond. If a confidence is developed in them, they are given confidence that, oh, and the citizens have a good big role to play. So the ministry is working on this, and with the coming of the national referral center, as I was mentioning, we can foresee in coming years, say in coming years, we have a good database. We will be sharing the data with the across sectors, and which can use it a tool for taking prompt decisions also. Similarly, I would also like to inform that uh, 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 it has been envisaged to come as a center of excellence for the human wildlife conflict management. So we have a limited understanding. Whatever sample, wildlife sample we are coming, we are just getting the opportunistic sampling. There's not a routine sampling. So Zoom may be a setup where you can get a sample, you can study when the like we are working, we are doing exercise when we are going to a war. So we have to create the situation. So that situation we can see in zoos. So using that knowledge, we can actually practice it in the field. So that is being developed, and ministry is also looking this subject, a lot of sensitization, and like One Health. If it's a national priority, it has now been included in the curricula also of the IFS probationers also, the state forest officers, they're also being made aware. And maybe in the coming time, that NGOT also get reflected in the curricula, and this message get percolated down. Thank you.
Thank you, Dr. Sunil. We understand that a lot of efforts are being undertaken at Ministry of Environment, Forest and Climate Change, especially with the wildlife sector, and we are foreseeing the National Referral Center for Wildlife. So moving on to the next expert panelist, Dr. Manoj Murekar sir, who has been a veteran in undertaking many of the epidemiological courses. Sir, we have learned that lot of challenges are there, but you have been a forerunner of many pioneering epidemiological training courses. So we just wanted to know that how India faces the epidemiological research findings which have come up across many epidemiological studies while investigating various outbreaks, and how we are uh, finding these to be as an actionable recommendations during any real outbreak scenario, and how each NI under your leadership is enhancing the capacity of many frontline workers, including epidemiologists in India, to ensure the effective participation of these trained manpower in the joint outbreak response setting in the field. Over to you,
Thank you.
sir.
Thank you, Dr. Simi, for that long question. So there are two parts to that question, and let me answer the second part first. We all know that trained workforce in field epidemiology is key to effective surveillance and also for responding to any public health emergency, including outbreaks. And National Institute of Epidemiology, since its inception, has been conducting field epidemiology training programs, primarily aimed at medical officers working in state health department. In 2001, we started advanced course, a 2-year course. And then in 2018, we added one more course, that is 1 year intermediate field epidemiology training program in technical collaboration with CDC Atlanta. So as I mentioned, these courses are competency-based courses aimed at medical officers working in state health department. And the key competencies with respect to outbreak that we teach is disease surveillance and outbreak response. And these trainees, when they are undergoing training and also after their graduation, are often involved in responding to public health emergencies. And we are really proud to say that in the last 25 years, National Institute of Epidemiology has trained more than 450 medical officers from across all the states in the country. And these trained people eventually respond to outbreaks and be part of NGORTs. Last year, we also started at NIA one more initiative that we started a fellowship in outbreak science. And after the notification of NGORT, ICMR has created a roster of ICMR scientists who could be potential member of this NGORT. And we started this fellowship for ICMR scientists, and they could be epidemiologists, lab scientists, veterinarians, or entomologists. And during this fellowship, we train them not only on outbreak investigations, but also about tools for conducting research during outbreaks. So this was in brief how we are training or building the capacity of the medical officers in outbreak response. Now, coming to your second or the first part of your question about translating epidemiological research or findings of epidemiological research into actionable recommendations. So we all know that purpose of epidemiological research during outbreaks can be manifold. Epidemiological research can help understand the risk factors associated with disease. It can help identify the source of infection or reservoir of infection or vehicle of transmission. And in the context of, say, vaccine preventable diseases, it can also help whether the intervention in terms of vaccination, whether it is effective or not, whether your coverage was adequate or not. And for all these studies, one often need to do analytical studies, be it a case control study or a retrospective cohort study. And one challenge that, or one observation that I had in most of the outbreaks that in India was that these epidemiological studies are conducted when the outbreak is in declining phase. And by the time the findings are ready, outbreak is already over. And the primary reason I think for this is there is a delayed detection of outbreaks, or the teams are deployed very late. And by the time team completes their epidemiological research, outbreak is already over. And that could be one important challenge that I see. Having said that, I must mention that this epidemiological research has really contributed in many outbreaks in reducing mortality and morbidity. And I just want to very briefly tell an example of an outbreak of acute encephalopathy that used to occur in Muzaffarpur in Bihar. So many of you might have heard about these outbreaks. These were seasonal outbreaks occurring with tight clustering in summer months. Children were affected with very high mortality. And one important clinical finding was that most of the children used to present with hypoglycemia. So the epidemiological study, a case control study conducted during one of the outbreaks in 2014, identified two important risk factors for this outbreak. One was consumption of lychee, and second was that children were going to sleep without having their evening meal. And based on this epidemiological research, two important recommendations were given to government of Bihar. First was, as soon as a case of acute encephalopathy or AES comes to a health facility, 10% dextrose should be given to that patient, that child, before referring to the medical college. And second recommendation that was given was ensure that the parents were educated, in fact, it should be educated that children should not go to sleep without having their evening meal. And with these recommendations, the number of cases because of AES as well as deaths have virtually become nil. So this is one example I can tell you that AP research can really be useful in targeting your interventions. But what is really important is that this should be conducted well when the outbreak is in increasing is rising, not when outbreak is declining. Thank you.
Thank you, Dr. Marakar. Uh, it's really amazing to know the kind of efforts you are putting in building the overall capacities for the disease epidemiology and also targeting the findings into meaningful things. The only challenge you have seen so far is the delays in the reporting of the outbreaks. Nevertheless, whatever findings are being taken up in one outbreak can be very well utilized in the next or the similar kind of situations in future, and uh, could be very useful in case we start talking about modeling the diseases not only in terms of responding to any outbreak but also to the policy decisions how to take up the matters in future. So thank you very much, Dr. Manoj. uh, Moving on to the next expert panelist, we have got a very different field. uh, from the National Security Council, we have got Brigadier M.M. Ramchandra, uh, director in the NSC. Sir, you have been looking into very, very different aspect from the biosecurity angle as well, and you are pioneering to start to the initiation of that thought process in the Security Council as well. Would like to understand because one of the biggest challenge, probably to my understanding, is talking to so many stakeholders at one go and talking to different ministries, different departments, different agencies at one time talking about this very very different aspect of the security. How do you basically manage all those kind of things, and what kind of efforts you want to put in, and what message you want to give to all the stakeholders on that? Over to you, Brigadier Chandra sir.
Thank you very much, Dr. Malik, and esteemed panelists and esteemed guests. I'll not take much time since we are already running behind schedule. But in a very short, brief way, I'll try to explain what Dr. Malik has asked me for. Before I make my comments, I'd like to highlight two very beautiful statements which were made today morning. One by the Master of Ceremony when she said, health is the business of every sector and not only of the health sector. An excellent statement. And the second made by the chairman DRDO when he highlighted about the importance of biosecurity, which I'm sure was repeated by many other panelists also. So I combined both of these and I say biosecurity is not only the business of the biosciences, but it's the business of every citizen of the country. Till we have that kind of awareness about the biosecurity aspects, which touches the life of every human being, every animal, every bird in the country, we will not be a biosecure nation. This is what the aim which we took upon ourselves way back in February 21 when we identified the gaps in communication. The communication not only within departments, interdepartmental, interministerial, and it was not a deliberate gap. We by far are so tied up in our day-to-day firefighting that we tend to forget that there is someone sitting in a different building just 100 meters away who needs to be spoken to. When we identified these gaps, we broke them down into two buckets. One was the science and technology bucket, which deals with the scientists, the doctors, veterinarians, wildlife, and all the people dealing in the broad aspect of life sciences. So that is one bucket. The second bucket, we define them as SILE, SILE, security, intelligence, and law enforcement. So there was a huge gap between the communication of the SNT and the SILE buckets. Without bridging such a gap, we would not be able to have enough biosecurity which is required to deal either with natural, accidental, or maybe deliberate outbreaks, God forbid. So how do you deal with this? We adopted the case study approach. There are so many incidents which are happening not only inside the country, in our neighborhood, but across the world, which are being dealt by different governments, different health systems in their own ways to save humanity, to save wildlife, to save animals. So we picked up one after the other these case studies to understand the best practices, brought them on table, and invited all the stakeholders from the S&T and SILE verticals to come to us and discuss this. At the same time, we drew out a series of questionnaires and reached out to the private sector, veterans in various fields, and asked for their advice. All these consultations, taking advice, and what we realized we were actually doing was started to communicating between those who were not communicating with each other. WhatsApp groups were formed, old college associations were woken up, and in some cases, teacher student associations were broken up. And we reached out to so many people. It was really fun building these bridges and encouraging the communication, which was the huge requirement of making biosecurity buzzword, which today I was very happy to hear from so many people. Then we moved to the next level, bringing it to actionable points. Just talking doesn't make a difference. So actionable points came about by training. So we introduced the military concept of simulated training, tabletop exercises, and finally the mock drills. With these trainings, we not only learned many good practices, we also taught each other good practices, improved our standing operating procedures, and way ahead on how to deal with an epidemic or a pandemic before it hits us. You can't start building communications when the epidemic is already on ahead. You have to work in peace to prepare for the war. And that is exactly what we did. Just to give an ending point about what we learned in all this journey which we went through, it was very heartening to understand that at least it has been recognized that we need to traverse this journey with experts like Dr. Rajiv Behel, Jan Kanitkar, and so many of our seniors guiding us all the way. Today, at least we are looking at these aspects. We are making our SOPs, revising our SOPs, and what we need to look forward to probably is implementing those SOPs. And that is going to be the bigger challenge. We've done 2 mock drills. Let's not be happy with it. Now we want to go on and do mock drills in multiple states, in multiple domains. And that is where I think I'll close my talk. Thank you very much for giving this opportunity.
Thank you very much, Brigadier Ramchandra. In fact, you had spoken and clearly talked about the gaps, the learnings, and how we can improve this communication mechanism to ensure the real implementation of One Health during any disease threat or the threat to the national security through the biosecurity mechanism. So thank you very much. Moving on to the next expert who has been here from Singapore, from the Duke and US National University of Singapore, Dr. Michael Friedman. Mike would like to understand from you, because you have been moving around from one place to another, have seen many of these kind of outbreak investigations as well, from the very threatening kind of situation to some pandemic like situation. What is your global experience, and can you share some of those, and how would you suggest that Indian National One Health Mission include those learnings to make the our own outbreak response mechanism robust, or how you can suggest to strengthen our response mechanism? Over to you, Mike.
So thank you. Thank you, panelists, my esteemed panelists, and the organizers of this meeting, ICMR, the One Health Mission, NCDC, for inviting me to be part of this event, very auspicious, important event. you asked some good questions. So I'm gonna use a couple of examples. I'll start with uh, an example of uh, lead poisoning. Okay. No. So often we think about just infectious disease, but really outbreak response can be any issue that's not really considered normal that causes suffering and disease. And so I think one of the things that's important to note in good One Health programs is that it encompasses not just the wildlife and the livestock sectors and the agricultural sectors, but also urban planning, mining, other sectors as well, environment sectors, business sector as well. So I know you invited 15 different ministries here, and I think that's exactly what needs to happen. So this example of lead poisoning, which of course is, one of the world's biggest catastrophes over the last 100 years. There's actually been no bigger environmental catastrophe in the world than lead poisoning over the last 100 years, and that's been a global problem. Of course, it's been largely uh, eliminated in some countries, but most of the countries in the world still suffer, including India, from this. And it's a challenge now that India has reached a certain level of development that these are now the issues that need to be tackled. So again, that's why I'm going to use this as an example. So the example comes from the U.S., which is basically we've done a tremendous amount of work over the last 30 or 40 years to reduce lead poisoning. But we still do surveillance and we still track it and we still have pockets where there's still occasional issues. And because of our surveillance, we were able to detect a few years ago that there was suddenly an increase in children with lead levels that were high across the country in certain pockets. And as this resulted in an investigation, and after a very detailed investigation, they identified that there was a product sold in one of the grocery stores that was a cinnamon flavored applesauce that was causing this. At least that's where they identified. And when they went and looked at the product, and eventually found out that it was the cinnamon in it that was actually causing the problems. And then they traced back where the cinnamon came from, and they found out the cinnamon came from Ecuador, and found out it came from a small factory that was outsourced to provide the cinnamon, and they were adding lead to the cinnamon as a stabilizer without knowing it. Now, this is an example of One Health because it wasn't just the Ministry of Health, the CDC, and others that investigated the human cases, but then it involved looking at the industry issues, right? You had the food safety people, and then you had to internationally have the diplomatic community and our embassy get involved and try to figure out in Ecuador what was happening and go back to the factory and figure this out. So health, like we said, is a multisectoral issue, and sometimes the sectors involved are obvious and sometimes they're not, but that's just one example. Um, Another example from lead poisoning, which unfortunately is not a good example, is that I lived in Bangladesh for 4 years, and before COVID, we were identified an outbreak of, again, lead poisoning. But it was interesting because this was identified because the cattle were sick. We had a whole bunch of cattle in a certain area that got sick, and this triggered a response. And then when they investigated the cattle, they found out that the cattle had high levels of lead. Uh, and that resulted in looking into the local community and finding that we found out that some of the kids had high levels of lead as well. And we found out that there was a local battery acid factory very nearby to this community that was spilling their their garbage from the factory into the fields. Now that's a story that happens in many countries, unfortunately, in the developing world, including here in India. And I say it's a bad example because as a result of this, there was no action. It's the same problem, nothing has changed. So I think one of the big challenges for joint outbreak response is not just how well you conduct the outbreak, but are you able to affect any change? Are you able to change policy or at least help that community in any way? And I always remind people that the whole purpose of doing an outbreak, okay, is in order for three reasons. There's always three good reasons to do an outbreak. The first reason and most important reason is in conducting an outbreak investigation, you gain the trust of your community. Okay? So when you respond, you're signaling to the community that you care. If you don't respond, it's signaling to the community that you don't care. And if you do a poor job with the outbreak response, you're also signaling to the community that you don't care. So that I think is a very, very important factor to think about, is that trust, because trust at the end of the day, when you think about COVID or you think about anything else, is the most important thing in public health. Without trust, you have nothing. Second reason why we do outbreak investigation is to learn. When we do an outbreak investigation, it's an opportunity to learn something we didn't know before. Okay, that happened. One of the earliest examples was in my career was HIV in America, where we didn't know about HIV until people investigated these sudden deaths in the gay community, and we figured this disease out. So outbreaks are monumentally important in terms of understanding new diseases or new issues. And the third reason to do an outbreak response is obviously to try to create impact, to try to learn from this outbreak and create policy changes, create awareness, and create change as a result. So it's very important to think about those three things as you're going through an outbreak. The last thing I'm going to say before I finish is that another best practice, I think, from other countries in terms of joint outbreak response is from COVID-19. So beyond just a routine outbreak, my biggest concern is now these pandemics and biothreat risks. And so if we're looking at best practices in terms of something that's more substantial, and that's something like, for example, COVID-19 or even worse, there are lots of examples of countries in the region who have did a very good job of COVID-19 that we can learn from. Okay, and it's not America, unfortunately. We did not do a good job, and most of the European countries did not do a good job. The countries that did a great job were Vietnam, Thailand, Taiwan, Australia, Singapore. Those are the countries that did a really good job, and I would urge people to really learn from those countries what they did to control COVID, because their death rates were extremely low compared to the rest of the world. Okay, and part of the reason, I'm not saying the full reason, but part of the reason they were able to be successful is they had very good joint response activities. They were able to work together as a country. They had a good joint strategy. Everyone knew the strategy, and they were able to implement the strategy. Okay, so I think that's it's not just conducting the outbreak, but it's be able to respond to it, is be able to have everyone on the same page. So if you're dealing with different sectors, every sector has to understand why they're there and what they're supposed to be doing. So that's, I think, an important lesson. I'll just end by saying the last thing, which is what Brigadier General Ramachandra said, which is that I think one of the key steps for India moving forward is to do more after action reviews of outbreak response. So you learn from the process, but if you do those, you have to do those after action reviews in a critical way. If they're superficial and they're just icing on the cake, it won't help. But if you really look to see whether you've done a good job or not in outbreaks, that could be tremendously helpful in terms of improving the system. And simulation exercises. You've done a few, that's great, but a country the size of India should be doing 100 simulation exercises a year, if not more. So that would be my recommendation. So thank you.
Thank you very much, Mike. Thank you very much for giving an experience from your global experience, some insights you have shared, and the kind of suggestions you have given are really wonderful. Would like to see that One Health Mission include some of those suggestions for effective implementation of these outbreak responses. Moving on to the next one is the man who is the most wanted person here. Nothing works without money. And here is a person, Dr. Guru Rajesh Jami, Senior Health Specialist from World Bank, would like to understand your views on how you support these kind of One Health initiatives for pandemic preparedness and similar kind of activities throughout. What other funders can also, which can also be available for taking up these kind of activities? How you support those activities, not only in terms of money but also otherwise from your technical experiences elsewhere? Over to you, Jamie, for your insights.
Thank you, Dr. Praveen. And first of all, thank you to the PSA's office, One Health Mission, ICMR, NCDC, and the organizers for having me here. And thanks to the expert panel, which actually laid a lot of points towards this. Uh, Probably just pushing out on me in terms of making me the most wanted person here. I think I'll try to sort of be very economic in that front. Uh, if I can just quickly put it up, I think Chem also put it in the morning, uh, that bank has three modalities of funding. One is for technical assistance, which basically can be a part of piloting, testing something new, providing technical assistance, moving towards collaborative learning and some of these aspects of knowledge sharing. And that part is something that we call as the knowledge bank within ourselves in the World Bank. The second one is the lending. There is concessional lending, there is normal lending, and that's the big part of the business that the bank does. And when I say business, the business is development as a business. And the third thing is certain financial intermediaries like the pandemic fund, which many of you are aware, and there are several other funds like that which are set up for various causes and various issues to be dealt with. So these three are the main modalities of financing. And within the bank, as we look at investment, we have sort of been a part of the PM Abhim and then we have also been part of IDSP very early in the beginning. But as we have moved on, we have learned that when you want a very strong health system, you also need the health system to be resilient. And when we started looking at internally among us for resilience, we realized that resilience doesn't come only from the health sector or the health practice within the bank itself. So within the bank, we started then trying to sort of talk with agriculture GP, animal GP, then education GP, and GP is global practice. Also to talk with urban development infrastructure. So we started looking at internally, and that's where we all started looking at multisectoral programs. And this is where you will see the next generation of programs that are happening right now. For example, in the states like Gujarat, where we have a health system program, but within which we integrated pandemic preparedness within that. And if you look at a Kerala program, which was an agricultural program where we included pandemic preparedness and health related One Health aspects within that program. The current program in terms of the support that we do to PM Abhim, there are several of the work that has been talked in the morning, which we are sort of fortunate to be a part of that, including zoonotic surveillance and some of this work which happens in terms of joint collaborative way. But then as we realized that we also, from the bank, we realized that we also have an institution called International Finance Corporation, which is also a World Bank Group institution. And it used to work separately on the private sector financing part of it. So now we're working as a one World Bank Group. So if you look at it, IFC is now also working and leveraging private sector financing. And there is a $4 billion platform set for medical countermeasures. So we want to sort of also look at in terms of mobilizing private sector, involving private sector, and that's another place where we are trying to see. And sectoral integration, apart from the departments and sectors that we have, we also have to get the private sector together, and we are trying to sort of move ahead in terms of financing modalities for that part of it. And to the question that you asked, Dr. Praveen, there are multiple other donor and MDBs which are existing in the ecosystem. You have Asian Development Bank, you have AIIB. Then there are several philanthropic agencies. Many of you know about Gates Foundation and several philanthropic agencies, Rockefeller and others, which are actually working for some of these areas and do promote pandemic preparedness related activities. And morning we also had CEPI, which is also a coalition which is moving towards mostly in terms of medical countermeasures. So just to sort of end up saying that bank has this as a priority in terms of financing and funding for pandemic preparedness globally.
We have been doing this for quite some time, and we will continue to do this as we move ahead in the future also. But as you rightly said, as a One Health approach, we are trying to now talk about one bank approach, so that we also get ourselves internally together, including the private sector, and move ahead in that. I'll stop here. Thank you.
Thank you, Dr. Rajesh. Moving on next to the state implementers. So states are the ultimate agencies, those who actually need to implement the response on the field, on the ground. So we have the three state implementers here, three state partners. Moving on first to the state of Assam, we have with us Dr. Lakshmanan, Mission Director, National Health Mission. Sir, we understand that Assam is located at border location and presence of cross-border wildlife corridor. The state frequently report at IDSP many of the zoonotic disease outbreaks. So how can the learning from the Assam preparedness can be leveraged for improving the National Joint Outbreak Response Team in the National One Health Mission, sir? Over to you, sir.
Thank you, ma'am. All respected panelists, and my sincere thanks to the audience who have remained. So even though it is late in the evening, you have all remained here. So sincere thanks to you all. Coming to the question directly, and of course, a huge round of applause for the audience as well. Thank you. Coming to the question point straight away. In fact, the northeastern states have 4 countries in the vicinity: Bangladesh, Bhutan, Myanmar, and China. And of course, Nepal is slightly far away. But there is a lot of movement happening, which happens, and also the disease prevalence. In case of Assam itself, just to say, we are having Japanese encephalitis as endemic to Assam, and the disease pattern varies. Mostly in the winter season, we do not have much, but this pattern is not only in Assam, but more or less same in Nagaland, in Arunachal Pradesh as well. So in fact, for the whole northeastern region, I would say that it's not only Assam, but the whole northeastern region experiences all these things. So recently, last week, we were having a discussion, and some of our people were reporting that this time suddenly there is an increased number of dengue cases reported from Bangladesh and even West Bengal. So now this information does not come very automatically to the state. So one or two suggestions which I would like to place here is that even when I was discussing with our IDSP program executives and other officers, doctors there, one of the challenges what we face is in IHIP, generally we see the state-wise data. If I am seeing my own state's data, I have a lot of details. But if I see to the next state, perhaps I am only seeing the state-wise data and district-wise data. We do not know whether these are adjoining areas or there is a possibility of shift of patients and even the disease. So these are certain areas where we will have to have better regional coordination. Next point, some of the joint issues, like say Bhutan and uh, the northeastern region, we have many common areas and forest areas where it is very difficult to gauge for the changes as well. So application of space science, in fact, NASAC and other, there is a space organization in the state as well. So some of their inputs are also being taken. But the constant point is, be it JE, be it malaria, be it scrub typhus, uh, any of these pandemics, any of these zoonotic diseases, we do have to coordinate with the northeastern states, which happens in a very frequent manner. But of course, lot of learnings in the last 3-4 sessions here today. We will try to organize for a regional conference as well, so that we can have better coordination among the states. Thank you so much, and have a wonderful day. Thank you.
Thank you so much, sir. We understand the challenges of the border state definitely, and I think that the regional coordinator platforms, they can be much leveraged for addressing these challenges. My next state representative is state of Odisha. We have from state of Odisha Dr. Pramila Barar, and I must congratulate state of Odisha that they have been pioneering in launching the state One Health Action Plan. Ma'am, we just want to learn from Post launch of the State One Health Action Plan for State of Odisha, what are the recent advancements for operationalizing on ground this State One Health Action Plan? We understand that you have dedicated budgeting, so we just want to learn that how you are utilizing this State One Health Action Plan.
Thank you, ma'am. The distinguished panelists and respected audience here. The story of Odisha starts from farm to table, ma'am, from breakfast to dinner. Actually, I'll take only 30 seconds to describe a story. My mission director told me that I am the nodal officer for this One Health as well as IDSP HIP. So one day she told me, what are we doing? What are we doing for One Health? As a letter had come from Government of India to our states 3 years back, I think Madam will remember. So we started thinking what should we do, because we have anthrax cases reported from southern Odisha, Japanese encephalitis cases reported in 2015-16 in southern Odisha, scrub typhus cases reported from western Odisha, ma'am, and again this leptospirosis cases again reported from eastern Odisha and some of the central Odisha also. So we thought that the concept of One Health, which was given by Government of India through a letter, we started thinking what to do. So we devised our own state budget for this One Health, and for this year rupees 90 lakh has been sanctioned and allotted. Then one project management unit, it is specifically for Odisha, comprising of all your domain experts like microbiologist, veterinary, entomologist, epidemiologist, and within 2 or 3 months, ma'am, that will be in place in Odisha, which will be monitoring, and it is being set up beside Health Emergency Operations Center, so that the control team, the SSU or the surveillance cell, state surveillance cell, and this unit will be working together in coordination with each other. And again, we have decided, we have released the state action plan for One Health by our honorable health minister. That political commitment and bureaucratic commitment has led us to this stage now, and we have trained around 5 to 6 batches of this uh, RRTs, rapid response teams, and by the support of Dr. Murekar of NI, we have trained around 30. 20 have already been trained in IAPTP, and another 11 are being trained. So through capacity building, through training of our epidemiologists at the district level, through expansion of these district public health laboratories or point of care test in our district public health laboratories, as we have 30 district public health laboratories, we are trying to expand the testing of this zoonotic diseases. Now currently we are testing 3 to 4 diseases, but we are trying with the help of CDC, ma'am, to train our microbiologists for induction training so as to improve the quality, and we can build on for ENQA certification and expand the zoonotic disease testing at that laboratory. The repurposing of RT-PCR laboratory is being undertaken for fever panel and respiratory panel, ma'am. And again, this 39 sentinel sites for Japanese encephalitis is functional in our state, ma'am, and we are trying to expand it also. And one urban surveillance unit is functional in Bhubaneswar, catering to a population where we are going to start vaccine preventable diseases as well as this zoonotic disease surveillance, ma'am. And again, these sentinel sites for zoonotic diseases are located in the medical colleges presently, which will be actually expanded to other medical colleges, which I think 14 in number. And with the help of Government of India, NCDC cell and One Health cell, we are trying under their guidance to train our microbiologists, to train our laboratory technicians, so that the testing of zoonotic diseases is being undertaken. Because during the COVID time, we had such a beautiful collaboration or coordination between the ICMR and the state team, and a very good database. So similar coordination has to be taken up for zoonotic diseases, ma'am. And again, the in the morning they were talking of district zoonotic cell. As we have a state cell now, we will be working for district zoonotic cell, taking into account the veterinary officers, agriculture officers, and we have already communicated regarding joint RRT formation, and we are proposed in the PIP NHMPI for the next year to train 377 RRTs comprising of these intersectoral departments, And also we are in the process, by January we'll be training the state level TOTs of joint RRT. That we have undertaken. Again, notification of diseases like rabies. Ma'am, in rabies, for example, in rabies there is a problem because in wastage is a percentage in rabies. If we, even though we keep the rabies vaccination at the PSC level, there is a wastage percentage. So we would request from our state that single dose rabies vaccine, if it is done, or point of care test for this other disease, zoonotic disease, if it is developed by your technical institution, then it will be a very great help to our state, ma'am. And again, this problem or challenges we find while the implementation of this plan, ma'am, because zoonotic diseases are reported through IDSP IHIP. Out of 20, we have taken 8 diseases on priority basis, ma'am. So One Health resilient infrastructure in tribal areas, the pig, the goat, the cows, they live in one room, ma'am, in tribal areas in southern Odisha. So is there any resilient infrastructure or housing structure so that, or any hygienic things that can be made, ma'am? Secondly, preventive activities like farmer awareness regarding pesticides, snake bite do's and don'ts, and dog bite do's and don'ts to the lower level, panchayat level workers or Asha Anganwadi. Those we are taking, but we should actually train the volunteers of the villages, or the villagers should know actually about zoonotic diseases, because they keep the what they are rear animals and they domesticate also animals, ma'am. And we are talking of yesterday only our government actually increased the incentive of snake bite to 10 lakhs from 4 lakhs. The incentive was that compensation was raised to 10 lakhs. And again, why all zoonotic diseases are not given compensation, madam? That is my question to the panel. Like leptospirosis deaths or other deaths occurring, anthrax is very common in our state, and it's a livelihood. Animal handlers or animal caregivers, whoever it is, they may lose their what livelihood. So compensation should be a mechanism in this process, or under One Health program we should advocate for it for the animal handlers or animal caregivers, ma'am. Again, awareness regarding infectious diseases or infected meat consumption or animal products has to be prioritized. We are doing, but from the national level, if the materials in the form of videos or in the social media, it is being given, then I think it will be helpful for us. And regarding we are talking of air quality indicators, ma'am, equipment, still we are shortage of air quality equipments. We know some of the diseases are there. And again, uh, we work on 2 Ds, ma'am, and 2 Rs. One is to detect, that is surveillance. IDSP IHP is doing, but we are focusing on these 8 diseases, and we through this project management unit will be developing another mechanism for surveillance for zoonotic specific zoonotic diseases. And diagnosis, 30 DPHLs and 3 sentinel site, which will be expand, and with repurposing of RT-PCR laboratory, ma'am, for response and management of outbreaks, joint RRT. And our veterinary department, animal husbandry, is very cooperative. And during this H1N1 outbreak in the Puri district recently, they had cooperated with us, and we did a very good investigation, and Dr. Himanshu also know about it. So as a nodal officer for One Health, I actually advocate for man, money, material labs, we say, and we have the HR in position. We have to train them, and we have funds, but we need more funds and material, in the sense point of care testing, and to strengthen the labs. These are few points which I would like to keep on the panel. Thank you, ma'am.
Thank you so much, ma'am. And your efforts are quite appreciable, ma'am. Thank you very much. And our next state implementer is from the state of Rajasthan, a very proactive state in rather leading many of the zoonotic response. We have with us esteemed panelist Dr. Bharti Malhotra, madam, who is a senior microbiologist with state government Rajasthan, and madam is a regional coordinator for One Health and also state VRDL under ICMR. Ma'am, we have been undertaking a very outstanding Vishanu Yuddha Abhyas, the first Vishanu Yuddha Abhyas with you. And we would like to have your experience from the Vishanu Yuddha Abhyas, and that how that exercise has actually helped to improve the state rapid response team in true sense. Thank you, ma'am.
So, thank you,
Over to you.
everyone. Thank you to the ICMR DHR team, Dr. Anunagar and Dr. Nivedita and Dr. Simi, Dr. Praveen, for having me here. Coming to this question, this Vishanu Youth Abhyas was a very exciting experience. So it was one of a kind where the whole team from different sectors were there. So having that real life experience, that made us realize the importance of working together. And of course, we were already as a regional coordinator and as a proactive state working in the One Health. So we speeded up our action plan and launched the action plan. We made it crisp with the help of Dr. Simi and Dr. Mayank, and that was launched very soon after the Vishanu Youth Abhyas. And then the state level joint outbreak response teams, the district level response teams, all that structure was well defined, and those teams were made and the committees were made, and the roles and responsibilities were defined, and the data sharing started improving. And then we had to train them. Then the sector connect field epidemiology program run by Dr. Meera and Dr. Ruchi, they really went to each zone and trained the whole team for this field epidemiology and the outbreak response. So all the stakeholders, as mentioned earlier by the earlier speakers, they were called to these training programs which are done in the zone wise, and all the district level stakeholders were invited in that and trained them. And as a result, now we are having a very good network, and now we plan to take it further to the block level as well. And the in the our state plan, we had also envisaged a state level center and One Health cell, as well as at the district level cell. And of course, as per the national guidelines, the Public Health Emergency Response Center has also been planned out at the state and the district level. So all these things are activities are going on simultaneously. The data sharing has improved. Plus now we have not only the outbreak response, as a joint activity, we have been doing public awareness camps. We have been going to Goshalas, the zoo, the biological parks, and also doing the sentinels, zero surveillance of the animal handlers or those people who are at risk, along with our veterinary and the wildlife counterparts. So it has been a very great push. It had caused this Vishanu Youth Abhyas, and as a result, we are much closer, and we can see how working together makes a lot of difference. So, and we've been doing a lot of these activities. We also carried out an activity in Savai Madhepur, which is our wildlife sanctuary area. So we involved the wildlife people there in the sanctuary, and then the area around the sanctuary also was investigated, and plus these zoological parks and the zoos and all those things are being carried out. So it's an ongoing activity, and it's a very exciting activity. As a regional coordinator, we are carrying out the regular review meetings of the sentinel sites, and we have been doing inter-lab comparison for maintaining their quality. And now we have started the ECOS program, and now we also plan to increase the number of the sentinel sites with your help. And even if they are not sentinel sites, to the rest of the labs, we will at least ensure that the important tests are being carried out there in the DPHLs and in the medical colleges, so that it's a good network, and then the diagnostic facilities there with or without being a sentinel site. So a lot of initiatives state has taken, and of course you all have guided us, and we look forward to guidance from you all. Thank you.
Thank you.
Thank you very much, Dr. Bharti. Wonderful insights and the kind of recommendations which have emerged. So before closing this, I would like to thank wonderful panel of experts here, all the plenary speakers, Ms. Anu Nagar, Dr. Ranjan Das, and Dr. Clement Ben, uh, to speak about their experiences and the kind of activities they have taken in different sectors, and all the panelists here who have been talking about lots of different experiences, their recommendations, and I hope some of these recommendations will form part of the National One Health Mission when we'll take it further after learning this. Finally, I would like to thank the Office of Principal Scientific Advisor, ICMR and AHR, especially the big efforts from Dr. Rajiv sir, DG ICMR, You have taken really wonderful, and I would like to see some of the audience are still awake. So thank you very much, audience, for this patience you have shown the whole day. At least some of you are here. So thank you very much for this, and thank you very much, panelists and everybody. Thank you very much.
Requesting all the dignitaries to kindly step forward for a group photograph up here. And I think we couldn't have culminated the day any better than this very enriching and kaleidoscopic view of the distinguished panel. Our gratitude abound to each and every dignitary up here on the dais. And I'll fail my duty if I do not convey my utmost sincere gratitude to each and everybody still present here, showing their commitment towards advancing the One Health mission. Thank you very much for your gracious presence throughout the day. We request you to make sure that you do look at the marvels that the exhibition holds. Tomorrow morning at 10 a.m., we await at the same premise, the same hall, and we unfurl the proceedings tomorrow at 10 a.m. The entry shall remain through the same corridors. And in case you reach any earlier tomorrow morning, you may please make your visit to the exhibition center. With those words, drawing to close the day one for the National One Health Mission Assembly 2025. Thank you very much.